Welcome. Welcome, everybody. Welcome to the International Planetary Health Conference in Andorra. It's a pleasure to have you all here. We have been seen from around the world, and it's we are super enthusiastic to see how this little country with vast amount of forests, with a vibrant economy, can really have this journey within the country. Laura, your turn.
Thank you very much, Jordi. Welcome everybody to this first international conference on planetary health. My colleague, Dr. Jordi Serrano, and myself, Laura Cugat, will be presenting this conference in the next 2 following days. So first of all, thank you very much for joining us. Maybe some of you don't know so much about this small country in the middle or between Spain and France. Andorra is recognized as a country of the Pyrenees, and if you go outside and look around, you can see why. The mountains and their biodiversity are one of our most important values and resources and represent the 40% of our land. Moreover, Andorra has been recognized as the 4th healthiest country in the world in 2020 by the medical journal The Lancet. So all these characteristics makes Andorra a perfect backdrop to celebrate this conference. This event has been organized by the Andorran Ministry of Health, the Andorran Healthcare System, SAS, the University of Andorra, the Andorra Research and Innovation Foundation, and also we have a number of partners who help us. For example, the IS Global, the Barcelona Institute for Global Health, the Public Health School of Menorca, and the Carlos III Institute of Health. In the next 2 following days, we will be hearing different roundtables and also different talks, and the audience will also have the chance to participate, to make comments, and also to pose questions. You can follow us here in person in the San Julia de Lòria Congress Center or virtually on streaming. So please stay tuned and join us. Some of our leading experts have come from far away, so we are so pleased to have you all here to attend this conference. So Jordi, can you explain us a little bit more about our experts?
Yes, we will explain we will be here listening during 2 days, a big quantity of experts from many international organizations, WHO, International Maritime Organization, UNICEF, as Laura explained, IS Global of Barcelona, Instituto Carlos III, Public Health School of Menorca, and many others, UPC, WOC, University, many national, international, and also regional organizations. But just an initial comment. Humans during the last 50 years have pushed themselves out of a stable zone called holozone. If you don't know, now we have entered for the last years in a new era called Anthropocene. You can imagine why. We will listen to our authorities now, but later we will also listen to experts that will guide us into what we can do or how we can improve at least the diagnosis and the status quo of all of our planet. So with that, Laura?
Yes, we move now to the opening session entitled Embracing Planetary Health. And on this occasion, we welcome the Director of the Andorran Healthcare System, Josep Maria Piqué, the Director of the Andorra Research and Innovation Foundation, Marc Pons, the Director of the Public Health School of Menorca, Matías Torrent, the Director of IS Global, Antoni Plasencia, who was unable to come in person, but he has recorded a video for us. Also, we welcome the Rector of the University of Andorra, Miquel Nicolau, and the Andorran Minister of Health, Albert Font.
Dr. Piqué, the floor is yours.
Bon dia a tothom. Good morning, everyone. Thank you for being here. The public health discipline has traditionally focused on the health of the humans, without necessarily taking into account what is the health of the whole planet. In the late 80s, a movement was born with the concept of global health, and was born considering that the narrow public health aspect has to be open because it was only focused in territorial, regional, or national perspective. And then the movement considered that we have to move to a worldwide perspective and taking into account the human health and the planet health. We must say that this movement was considered pushed by the fact of appearance of AIDS in Africa and the rapid and dramatic dissemination over the world. In 2015, the concept of planetary health was launched by the Local Health Foundation and the Lancet, as I said. What is this term? Under this term, we consider that is the health of human civilization worldwide, but also the state of the natural systems on which it depends. And when we talk about health, we are not talking just a state of a complete disease. We talk about the complete state of being well as socially, economically, as a personally in the world. A few years ago, the WHO elaborated a report defining what planetary health refers from there. I will read textually. It's the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economically, social, that shape the future of humanity and the Earth's natural systems that define the safe environment limits with which humanity can flourish. Andorra is a country with a strong commitment with the Sustainable Development Goals, the SDG, adopted by the United Nations in 2015. But from the healthcare system, we are well aware that any effort that we put on that will be nothing if simultaneously other domains not are developed, economically, again, socially, educational, and environmental sustainability. Taking into account all these concepts in this framework, in the conference that we are opening now, we pretend to better understand how large is the relationship between the human health and the planet health, but also what are the challenges that we have to face, and what are the changes that, as a professionals, we have also to face to pursue some objectives in the coming years. On behalf of the Andorra healthcare system, an organization from which we try to be sensitive to all those issues around the planetary health, we want to welcome and desire that you can enjoy the meeting. And we hope that at the end of the meeting, we will be more knowledgeable about this concept and we will see how to deal in the coming years with all those challenges that we have ahead. Please enjoy the conference.
Thank you very much, Dr. Piquet. And now with us, Marc Pons, Director of Research and Innovation from Andorra. Thank you, Marc.
So good morning, everybody. So my idea today was to explain a little bit one specific case that we had here in Andorra that I think it's the best way to illustrate the relevance and the importance of this focus that we are talking today about the planetary health. So some years ago, we started to explore, to work about trying to see if there was some impact in health about thanks to the environmental pollution. So working straight and looking generally to this data, maybe we see, well, it seems that maybe it's not an issue. No, we are more than 90% of the day with good or very good environmental air quality. So it seems that maybe it's not really an issue. But when we doesn't work. Maybe. Well, the next one. Will you go through the slides because the pointer is, it seems it doesn't work. Okay, I will. So when we start to look at in greater detail, so we found that in specific moments and specific days of the year, it seems to be not so good, the situation. So maybe the next one. Okay, so we identified that in those specific days, very few, but in those days, it came that in the hospital, we identified an increase of 20% of the cardiorespiratory diseases. Next one, please. So we start to go to see a little bit what could be the drivers of this. So maybe it could be, so we were seeing what would be the sources of pollution. Then we saw that mainly it comes from the traffic, the vehicles. So we started to look to this relationship between traffic and pollution and the health effects, that we see that there was not direct effect. So next one, please. Next one, please. Next one, please. Yeah. So we started to look at the weather. So we look at how weather was impacting this air pollution, but the same. So when we relate weather to the health impacts, there was not apparently straight relationship. However, we started, let's start to see this holistic point of view, and let's cross these traffic dynamics, weather dynamics, and this is how we started to have better insights. So it comes to mountains areas, that it's a very common pattern that we call that is the thermal inversions, because we are in the valleys. So these kind of thermal inversions, it doesn't allow to recirculate the air masses that are in the bottom of the valley. So this kind of pattern facilitates this deposition of this concentration of higher particles and air pollution particles. So, and it comes that specifically at this time where these events are more intense, that is just in the morning. Please, the next one. We saw that is exactly from 6 to 9, where 70% of the traffic of the vehicle fleet of the country is moving to go to work. It's just 2 hours, 3 hours. So when you look at general patterns of traffic, you didn't identify that. When you cross these two patterns, it's a wow, what's happening here? You have all the vehicle fleet moving. Next one, please. This weather pattern that facilitates this concentration of pollutant in these specific areas. And then where it's happening, next one, please, where you have the most of the people is concentrated and living. So the exposition of the people in this specific moment of the time, it's at the right time, at the right place, at the right moment. It's just a lot of time, very short, in very specific time of the year, but we see that it's having an impact. We would see if it's higher, relevant or not, on the health dynamics. Next one, please. So here the same now, when we started to look at potential interventions and how we could be help to reduce this exposition. So it seems that, for example, interventions in human dynamics are the ones that have a higher impact on reducing this effect. So it was before the pandemic, and we were talking about changing more flexible or remote working could have a good impact. So now it's at that time, to talk this issue in the public administration was, wow, sure, this is impossible to do it. We can see how we are right now. Next one, please. So just to finish, that's it, no? There are some issues. We are facing challenges, complex challenges, that from this reductionist point of view that we are facing so far, these challenges, it's impossible to tackle them. And this is a little bit the approach that we are talking here, that this holistic point of view is necessary. Just a quick more example, just looking at the future, no? So from our side, from climate scientists, we are working on how climate change is changing these patterns, these dynamics. And this is an example of how we have been identified that this kind of patterns that I show you could be more frequent and more relevant in the future thanks to climate change, or some other patterns that these last 2 years were so funny. Next one, please. This is the transport of sand dust from the Sahara due to these global circulations. This is Arcalis in 2021. So just joking apart. Next one, please. You can see the huge impact of this kind of events in the country, not only for ski and snow dynamics, but of course, all these particles are deposited and are contributing to this health quality. And when we are adding different factors than the one that's saying, we are seeing that how this interdisciplinarity is needed at all when we want to explore, for example, this kind of specific health issue. So finally, just my remark is this one. No? I think this is a little bit what we would like to discuss and learn more these days, that for being effective to this new challenge that you have, we need holistic insights to really have effective environmental and public health interventions, and this is a bit what we will be discussing today. So thank you.
Brilliant, brilliant, Mark. Thank you very much for this precise intervention about Andorra conditions. And now with us, Matías Torrents from the Public School Health of Menorca. Thank you very much, Matías.
Bon dia, good morning to everybody. Well, we started already with some data, some points, some scientific points that will be talked these 2 days. I just want to make a short introduction of our relationship with the Menorca School of Public Health and Andorra. It's for me, obviously, a great satisfaction to be here today in this international conference on planetary health, representing the Menorca School of Public Health. For several reasons that are linked to an increasing interaction between Andorra and Menorca in several aspects. During the COVID-19 pandemic, public health professionals from Andorra and Menorca got in contact trying to learn each one from the other on strategies used to face the pandemic. Realized then that we had lots of similarities in terms of population size, economic activity with an important weight on tourism industry, and especially nature-linked tourism, and even geographic determinants of isolation, one as an island limited by the sea, and the other as a valley limited by mountains, and both having a limited number of entry doors. In parallel, other contacts had been established between these two territories for possible collaborations in other aspects of social and socioeconomic interest for both parts, and mainly driven by the interest of Andorra to become a reserve of the biosphere of UNESCO, distinction that Menorca obtained in 1993, and of which Andorra wanted to learn about from our experience. The reserve of the biosphere recognition is granted by the Man and Biosphere Program of UNESCO, which, according to their own definition, is an intergovernmental scientific program that aims to establish a scientific basis for enhancing the relationship between people and their environments. It combines the natural and social sciences with a view to improving human livelihoods and safeguarding natural and managed ecosystems, thus promoting innovative approaches to economic development that are socially and culturally appropriate and environmentally sustainable. It sounds like the definition of planetary health that Dr. Piquet told us previously. So the Man and Biosphere Program of UNESCO probably was one of the first attempts to implement strategies leading to a healthy planet and thus to a healthy population. Within this context of relationship between Andorra and Menorca, last September, a representation of the Ministry of Health of Andorra visited the Menorca School of Public Health, which next September will reach its 33rd edition. Our School of Public Health is a yearly 10-day school taking place in September in Llazaret, that is a small island within the harbor of Mahon, so it's an island within another island, that was built in the 19th century for quarantining the boats before entering any Spanish harbor. So it's a quite historical place for public health, and quite actual these last two years. And is the only one in the Mediterranean that maintains most of its original buildings. Our experience with the Menorca School of Public Health showed its potential for accompanying this process through a reserve of the biosphere philosophy and the strategy in which Andorra is involved. And planetary health is the framework in this context. I am glad to see that following our discussions on possible activities in this field, the Andorra team has set up the program of this conference. In fact, I believe planetary health will become a new main approach, or is becoming a main approach of public health. And in our Menorca school, we have introduced also planetary health as one of the focus these last years. Congratulations to the organizers for such an interesting and comprehensive program of this first international conference on planetary health. And I wish a long life to these kind of activities in Andorra. Thank you.
Thank you, Matías, for supporting us from the beginning for this conference. And Menorca really did very well during the pandemic. At some point, Matthias was the the best place in Spain, with the best statistics, At one point, yes. That's why some people of Andorra went to visit him, Thank you, Matthias. Now we have with us Dr. Antoni Plasencia. He is the director of IS Global Health for Barcelona Institute for Global Health. Sadly, he couldn't be here today, but he has recorded a video for us. Please, the video of Antoni Plasencia.
So thank you very much on behalf of the Barcelona Institute for Global Health, IS Global, its trustees, institution, and the whole IS Global community, to the authorities of Andorra for this kind invitation to participate to this international conference on planetary health that comes at a very important moment. In an intense and closely interconnected, permanently changing world, all health is global and therefore needs to be understood beyond geographic and political boundaries. And also, health needs to be promoted and protected as a global public good. So IS Global, as an academic research and translation institute, has been a pioneering center in promoting the concept of planetary health as a new way of thinking about and researching health in the context of the Anthropocene. Since this new concept gained visibility a few years ago, IS Global has promoted its adoption as a cross-cutting approach that requires understanding complexity, working in a multi and interdisciplinary way, and also, importantly, acting urgently. Our commitment to combine human health with the concept of the health of the Earth's natural systems coincides with some of the formulations both of the United Nations and of prestigious academic institutions and different fora all over the world. For IS Global, our main challenge is how to improve health and human development and at the same time reduce the enormous health inequalities, in other words, the unacceptable lottery of where you are born and raised. And this challenge becomes concrete with our commitment around the Sustainable Development Goals and the relevance of the climate crisis and the Anthropocene as a unique opportunity for transformative changes to precisely improve health and equity. We work on two main fronts: combating diseases related to poverty and improving equity in health and development, and also in promoting healthy environmental conditions, especially in cities. And in both areas, with these both approaches, we combine human health and environmental sustainability as key components. And I have to say that the current COVID pandemic, should accelerate precisely the understanding, the importance and the scope of this idea of planetary health. Obviously, this poses enormous challenges, both challenges for the imagination and the way of thinking about health, but also challenge of transformation, of policies, of action, and especially of urgent action. So in closing, we are very happy to do our bit to contribute from our knowledge generation, dissemination and application activities to tackle these challenges, and also to be part of this outstanding event today in partnership with prestigious and committed institutions and colleagues. And also we remain open to find new ways to align new opportunities to formalize our mutual collaboration with Andorra, as we have done in the recent past around the COVID-19 pandemic. Thank you very much for the opportunity and all the best for the conference.
Thank you very much. Dr. Plasencia has been always supporting us also for the conference. And it's a pleasure because IS Global, Barcelona Global Health Institute, is a big player in this field. With us now, the Rector of University of Andorra, Nicolau. Thank you.
Bon dia, good morning, good night for the ones who are attending from America, good afternoon and good evening for the ones who are attending from other continents. Minister, authorities, ladies and gentlemen. On behalf of the University of Andorra, be welcome to this conference. We are very pleased to co-organize this first international conference on planetary health here in Andorra. The University of Andorra is fully committed to sustainability and also to this multidisciplinary, interdisciplinary, and transdisciplinary field and social movement that planetary health means. Just 40 minutes ago, at the university, I was opening, together with the Minister of Health, the activities to commemorate the International Day of Nurses, celebrated around the world every 12 May, the anniversary of Florence Nightingale's birth, who is considered the founder of modern nursing. During the opening, I underlined the importance of education and health as the core disciplines to grant humans quality of life and also to provide the main tools to face the present and future humanities challenges. Higher education and research have to be in the center of government priorities because higher education and research make possible the answers to all complex questions and challenges. And one of the big challenges, not for the future, but for now, for the present, is climate change and Earth sustainability. We are living in an era where the impact on Earth by humanity is much more dramatic than ever before. Although humanity has achieved the highest advancements in science, in technology and human development, we have put our planet at risk with serious outcomes. Not only climate change, but wars, shortages of waters and food, increasing pollution, new diseases, etc. In 2008, I remembered experts talking about the great moment we were living economically and socially, at least in the richest country here in Andorra. You can check this in the newspaper libraries, all this the declaration. It was said that big economic crises were over. And that globalization and the world economic structure were so solid that we are protected from big crashes. So it was surprising. Well, in the very 2008, a deep and long economic crisis hit the world. And it lasted a lot of years, one of the longest crises in modern times. The experts were wrong, really, actually wrong. And we were wrong as well. And when we were recovering from the economic crisis, something completely unexpected happened again, the pandemic. No one could imagine that the world would be locked down and that the whole planet would be threatened by a virus in the 21st century, a new virus. This year, 20 and 22, the virus seemed at least less deadly, and we began step by step to return to normality. And then the Russian army attacks Ukraine. A new war in Europe led by a nuclear power. What will be next? So now we know that we don't know it, but we need this knowledge, really, we need this knowledge. We were too naive 15 years ago. Now perhaps we have all grown up to expect what will be next. So all these recent events affected dramatically social life and health, particularly mental health. But they are not the only ones that affect humanity life, our environment, as Mark said, because us, so 8 billion people living on Earth, our environment is changing. Water scarcity, changing food systems, urbanization, biodiversity shifts, natural disasters, fires, floods, climate change in general, changing land use and land cover, global pollution, wars. And the question is how all that impact human beings, their health, the migrations, the nutrition, the social relations. We are here today and tomorrow to talk about all that. But as I said before, talking is not enough. We have to act now. The clock is ticking and really we are running out of time. Consequently, it is truly necessary that all disciplines work together to face and find solutions to all these challenges. And at the same time, to better understand how they are impacting our own health. We, universities and higher education institutions of all the world, have to commit to this interdisciplinary field and provide the knowledge and the required tools to find solutions to the planetary health while improving quality of life and human health at the same time. We are looking forward to listening to your proposals. Thank you very much. Muchas gracias.
Thank you very much, Rector, for the great support that the university has given to this conference. And now with us, the Minister of Health, Albert Font. Thank you very much.
Moltes gràcies. Molt il·lustre senyora síndica general, molt il·lustre senyora subsíndica general, molt il·lustre senyor conseller, honorable senyor conseller, senyora secretària d'Estat de Salut, Madame la première conseillère d'ambassade. Mesdames, Messieurs, bonjour et bienvenue en cette si belle journée de printemps que nous n'allons peut-être pas gâcher en restant ici à écouter des conférences, puisqu'elles traiteront, je pense, de tout ce que viennent de mentionner les anciens collègues. Le fait pour moi d'inaugurer ces premières journées consacrées à la santé planétaire constitue un plaisir et un honneur. D'autant plus que, comme nous venons de le constater, la qualité des intervenants scientifiques en garantira autant l'esprit d'innovation que les valeurs prédictives, puisqu'il s'agit de cela. En tant que représentant du gouvernement, j'aimerais profiter de cette occasion pour dire un mot à propos du plan stratégique d'agencement de l'agenda 2030 en Andorre. Cet agenda prétend développer la route tracée par la stratégie générale de développement durable, et en particulier celle de son chapitre consacré à la santé et au bien-être. En matière de lutte contre les épidémies et les maladies transmissibles, qu'il me soit permis de dire que notre pays peut présenter des résultats objectivement positifs, en particulier à propos des protocoles de détection, de surveillance et de traitement des marqueurs sanitaires. Puisque toute maladie, au-delà de sa traduction première, entraîne toujours des syndromes connexes qu'il est important de reconnaître et de traiter, le programme de soins psychologiques autour de la pandémie de Covid constitue l'exemple type du traitement des effets secondaires de ce qui a été et reste une affection d'origine microbiologique. Ce plan a été lancé dès avril 2021 dans le cadre du plan intégral de santé mentale et de lutte contre les dépendances. Malgré la tentation de le faire, ne serait-ce que pour affirmer une légitime reconnaissance du travail accompli, il ne s'agit pas ici, bien entendu, de lister tout le catalogue des actions réalisées dans le cadre du ministère de la Santé, que je représente à l'occasion de cet acte, qu'il nous soit toutefois permis de dire que nous avons compris, et bien compris, qu'aucune pathologie n'est disjointe, ni purement organique. L'homme est homme et reste en communion avec le reste de la nature et de sa propre nature. Le concept de santé pourrait donc s'apparenter à celui d'une nébuleuse multiforme, changeante et au centre de gravité mal défini. Toute altération est à la fois cause et conséquence d'un syndrome qui trouve son origine chez la personne saine et dont l'influence s'étend au-delà du syndrome organique lui-même, pour déborder sur le mental, le docteur Piquet en a fait mention, sur le social et même sur le versant économique, hélas. Restons donc dans ce concept, dans celui de l'interrelation des étiologies, afin de justifier de l'indication de ces journées, dans un monde dans lequel les hyperspécialisations sont de mise. Nous savons tous que ces spécialisations sont nécessaires. Elles constituent l'unique manière d'avancer loin dans la connaissance, au prix de risquer de perdre une notion de perspective, de dissoudre ce concept de vision d'ensemble. C'est ce que nous allons tempérer ici, grâce à ces journées. Regrouper autour de nous, autour d'eux-mêmes, d'éminents spécialistes pour traiter de santé planétaire pourrait sembler un contresens, puisque la santé planétaire est par définition un concept général. Cependant, c'est justement ce caractère général qui, nous l'avons dit, constitue le paradigme de la santé. Rappelons la définition que l'Organisation mondiale de la santé en fait. La santé est un état de complet bien-être physique, mental et social, et ne constitue pas seulement une absence de maladie ou d'infirmité. Y a-t-il meilleure description d'un concept généraliste? Parler de santé planétaire revient donc à parler d'environnement naturel, voire d'écologie, mais entendu dans un sens de symbiose, de communion avec notre condition humaine. Parler de santé planétaire revient également à parler de prévention, de médecine préventive, non plus sous la forme de politique vaccinale que nous avons si bien connue, ni de chiffres statistiques, mais enfin sous la perspective la plus ouverte, la plus générale et aussi la plus naturelle. Telle est également la mission de l'action politique, permettez-moi de le dire, et de la politique de santé en particulier. Il faut gérer les dossiers unitaires afin de composer un ensemble homogène. C'est toute la difficulté des hiérarchisations. Mes points de difficulté aujourd'hui, tous les experts présents que j'ai le plaisir de remercier d'avoir accepté notre invitation ne parleront que d'une seule chose, de santé. Ils le feront avec leur langage de spécialistes, avec leurs convictions de personnes engagées et surtout avec la perspective de participer à un travail commun. Notre petit pays s'enorgueillit de les accueillir, de les entendre, je dirais même de les écouter avec une oreille passionnée, puisque toutes leurs interventions, parties d'horizons différents, convergeront sur l'essentiel. Elles se rejoindront à propos de la communion naturelle de l'homme avec la nature, dont il fait évidemment partie, mais qu'il a trop souvent traité comme un complément, plus ou moins lointain, plus ou moins facultatif. Je vais terminer en remerciant l'initiative et la tâche réalisée par les organisateurs de ces journées, le gouvernement d'Andorre, le service d'attention sanitaire, l'Université Andorre et Andorra Research et Innovation. Et enfin, toute notre gratitude à l'Institut, je ne vais pas le prononcer en français, l'Institut de Salut Global de Barcelona, l'Escola d'Estiu de Salut Pública de Menorca, ainsi que d'Edalus Iberia et Andorra Telecom en tant que collaborateurs, et au Comú de Sant Julià de Lòria, évidemment, pour la cession de ces installations. Avec tous mes vœux de succès, je vous remercie, mesdames et messieurs, pour votre aimable attention.
Thank you, Minister, for this vision ensemble, comme vous avez mentionné. And now we would like that you make a new applause for the authorities, because thank you for accompanying us. We are starting now, soon. And in 20 minutes we'll have, or less, in 15 minutes we'll have the first roundtable. But before that, we would like to set up the objectives of the conference. Laura.
Yes, before running through the first roundtable and the first conference goals, I would like to explain a bit the structure of this conference that will last the next 2 following days. After the inaugural session, today we'll have 3 roundtables. The first one will take place before the lunch break and the other 2 in the afternoon. And then we will end this first day conference with an open talk about mental health. Some of our speakers are here in person, but also we will connect with many others virtually. So you will see that this conference will be so dynamic and so diverse. On the second day, we will start with a summary of all the issues that we have been discussing today, and then we have two more roundtables, yes, and we close the event with 2 debates between some of our experts and also the audience. We want to remind that this conference is free. All the sessions will be in English, except some short summaries after the roundtables that will be in Catalan, and then after this quick review of the structure of this event. Jordi, can you tell us more details about the conference goals and purposes?
Absolutely. Thank you very much. And for that, we're going to launch a nice video that we have prepared for you. The main objective of the conference is to bring awareness to who? To our general population, and also especially to our healthcare workers. Not everybody is aware of this new initiative, this new field. Obviously, everybody has listened, understand that the ecosystems are connected to humans. But now we have clear data. We will start with the roundtable number 1. The lessons that we have learned with the pandemics must be leveraged to confront and to address planetary health challenges. We have gathered amazing experts that you will enjoy in just 10 minutes to discuss and see if we can extract conclusions. It's not easy. As you have seen during the pandemic, fake news and many other stoppers and barriers can sometimes put many fences to governments. Environmental impacts on your health, that is the roundtable number 2. We have gathered also fantastic group of experts in that sense. Not only pollution, climate change, also nutrition. Many possibilities can affect our health. And for that we will discuss them and how we can address them with the resources that we already have. Number 3, the opportunity for digital planetary health. We have seen during the pandemic how digital can save a lot of visits, and because of that, a lot of tons of CO2 and other greenhouse effects. All that will be supported with science, and we will see the possibilities. Who is suffering more, possibly? Who will suffer more? The climate change, vulnerable populations. That's why we have to research on them, on chronic disease, on aging, on children. They're the most affected, and also low-income countries. Especially in those low-income countries, biodiversity is getting lost so quickly, and that doesn't benefit to them. Biodiversity can be lost at any moment, and it's a catastrophe. Migrations and other things. We will comment that this picture and also this picture later in some slides, but all these pictures are related in a holistic map, and they have a reason to be. This is the Milky Way. Not everybody can see it. Polluted cities. Some cities have already done many things to stop that, but not many others. Even the trash outside the earth right now. We are not safe in any place. That's why we want to start fighting together. It's time. There is no time to lose, but we have to be positive. Catastrophic messages have not been useful, as you can see in the last years. We have to work together in a transdisciplinary way to really achieve this nice water, like the rivers of the world, like the vessels of our body. Thank you very much, and we thank you so much that you have come here to listen to these experts. And now, if we can put very quickly these quick slides, where we will remind some stats, very important, no? Can you launch the slides, please, in that sense? Meanwhile, the stats we will show now are the stats of WHO and other international organizations. No, it's well known for many years that these slides, that this data really is there. Okay. So you can see here how the environment impacts our health. It's not only the pollution that you can imagine, no, but also the inadequate water sanitation or the occupational risks. Governments can do many things to improve these risks. The next, please. Top 10 causes of death from the environment. Heart disease attacks, ischemic attacks. It's amazing how many people are dying every year because or related or due to or as a consequence and so on. We're talking about 2.4 million, and if we compare it with very destructive global health diseases, it's 10 times more sometimes. So it's important to see the problem in perspective, and we know that in the last 2 years, and we have here in the room experts that we will explain that very well, how many people, we don't know exactly. You know that there are stats between 7 million, 50 million have died, but it is still, every year, this number of people die caused to the environment. Next, please. 24% of all global deaths are related to that. And it's a big burden, and we should all work together, and it's like a big topic. The biggest burden of disease stats will fall under the umbrella of environment, pollution, climate change, and so on. The next, please. And who is most in danger, as always, in that sense? Thank you very much. children under 5, and adults between 50 and 75. As always, the most vulnerable are the most affected for these conditions. And of course, also the low and middle income countries bear the greatest share of this environmental disease. That's why we have to work together to help this population. Some things that quickly governments can do. When we're talking about non-communicable diseases, chronic diseases as it's understood by the general population, governments are thinking, okay, this will be the burden of my budget in the next years. So if we tackle that quickly, we can also help to reduce this by reducing these environmental factors, because many, as you saw, occupational risks and many others the blame relies on these environmental factors. That will also save the budget for governments. And also, of course, a healthier, safer workplace, as we were explaining before, it can help a lot. 2.7% of all disease, it's due to this not taking care occupational workforce. This is what you won't see it again if you have never seen before. This is a gold tooth from the Costa Rica forest. And this is one of the images that really impact to the life of Cristina Figueras. As you know, this is the woman that was leading the negotiations in Paris COP22 for the final agreements. And she was from Costa Rica when she was, I think, 18 years old, 78. She saw many of these frogs. And in 89, they told her that these frogs have disappeared. That's why she dedicated her life to the fight for the environment. Biodiversity is a great tragedy. Every time we lose one of these magnificent creatures, we can lose opportunities of new drugs, opportunities of understanding the nature, metabolic routes, and of course, it affects many other animals. You can see seagulls can carry antibiotic resistance bacteria all around the world. There have been a study in Barcelona University that it had shown that they are carrying Campylobacter and Salmonella, very resistant. And of course, seagulls, fly a lot, and they can widespread this resistance. This is a paradox of this globalization and how these animals can really widespread the bad habits of a hospital or a population giving antibiotics when it's not necessary. And climate change will affect that. We will also have a talk about that in the second day. And finally, only 70% of people can still see this sky in the world. Light pollution, it also affects the way we sleep, the way we communicate with others. So in that sense, this is a problem, and of course, we should do something also to solve that. Not only these concerns, but the main general concerns are about plastic, about waste in general, and we should do something because the trophic chains in the sea are really going to be a big problem very soon in that sense. And not only that, we have even bigger problems. If one day we think, okay, we can go up and be relaxed and see the world as it used to be, impossible anymore. So we should be working in that sense together to have really a nice world, because our body lives in the world, and the earth is our world. Thank you very much, and we hope you enjoy the conference. Thank you very much. And of course, thank you very much, of course, the organizers. We are so happy, the government of Andorra, the SAS, Andorra Recerca y Innovación, University of Andorra. It's been a pleasure to work all together to organize this conference. And we don't have to forget, of course, also the supporters of this conference, also the collaborators, and also the sponsors. Thank you very much. Thank you very much.
Okay, thank you very much, Jordi. We are now going to begin the inaugural session entitled Quo Vadis, Planetary Health. This talk will present the status quo of planetary health and also will look at where this fascinating new discipline is heading to. We have in this roundtable, in this inaugural session, some experts from international well-recognized institutions. For example, we have Elena Villalobos, person in charge of climate change and health Health at the World Health Organization, Oisimbre Debates from the Vasco da Gama Network of Planetary Health Initiative, Cristina O'Callaghan from World University and IS Global, and Fernando José García López from the Carlos III Institute of Health in Madrid.
Thank you very much. We will have to wait a couple of minutes because we have to change the logistics. But meanwhile, we would like to comment also that later, after this conference, in the afternoon, we'll have the conference, before lunch, we'll have the conference of planetary health lessons. We have with us experts, like here, Clara Prats in the audience, and we have experts also like Deborah here that came from Washington. We thank you that so much, Deborah Thompson. And we also have, of course, Joan Marc, who will be online, and another speakers that we will connect later. And Eduardo Celades from UNICEF. Actually, Dr. Celades will be connecting from a car because he's on a mission on the field, and he didn't want to miss this conference, and he will be connecting from a car in that sense. So now, with us, the inaugural session, and we will enjoy, as Laura was saying, the presence of the Elena Villalobos from WHO, and Oisin Brady from Family Doctors Network for Planetary Health, and Cristina O'Callaghan from IS Global, and also we will be enjoying the presence of Fernando Garcia from Salud Carlos III. Thank you. It's a pleasure. Please come to the audience. Thank you. Thank you very much. We have with us Dr. José María Piqué, Director of the SAS. Thank you.
Please. Go ahead.
Yeah.
Sí.
Vale. Thank you very much. We have this session led by Dr. José María Piqué. Thank you very much. Thank you.
Thank you, Jordi. I will use the opportunity because maybe I have no another opportunity during those days to say thank you to Jordi. Jordi, this conference never would be possible with your support and your effort for this great work. Congratulations. Okay. So go ahead. As I said previously, this session, we will pretend to better understand how is the interdependence of the human health and the health of the surrounding planet environment. We need to learn what are the challenges that we have ahead. We need to learn how we have to change behaviors as a citizens, as a professionals, and how from the institutions, from the healthcare institutions, from the administration institutions, we have to move this reactive medicine that we are just deploying right now to a predictive and a preventive medicine. And when we talk in prediction and prevention, we have to talk not only about human health, but also our environmental health. So there's a lot of things that we have to learn, and we are very, very, very grateful to have a very outstanding spot of speakers to address all those issues. So, having said that, we will just start with Elena Villalobos, that, as has been said, is a Master in Public Health in the London School of Hygiene and Tropical Medicine, and right now is a technical office in the WHO dedicated to climate change and health. So, I guess Elena will be online. Elena, the floor is yours. Thank you very much for your presentation.
Thank you very much, John Maria. Just one question. I cannot share my screen, and I would like to use some slides. I don't know if you can grant me access to this.
They will do it now. Okay?
I basically can start. Well, I'm Elena Villalobos Prats. I work in WHO. I'm leading the area of work related to capacity building and country support on climate change and health. And I would just say to start that I'm really excited to be part of this. I really thank the government of Andorra and all the organizers for the opportunity to be part of this important event. And I must say, I am impressed by the quality of what I've seen so far. So thanks for this invite. Now I can access, let me just share my screen. I will be very fast. As, let me see. Okay, I think we have seen already this slide. I think it is important to go back to it because it is really important for us also working in the Department of Environment, Climate Change and Health in WHO. We've been advocating for years that the environment is really leading to disease and to mortality. And basically, as Joan Maria was mentioning before, we think that prevention is a key part of public health and overall health. And we are advocating for much more investments to be targeting the environment. These are the different programs that we are basically structuring our work in WHO, in our department. And basically, as you can see, the environment for us is everything that is outside a person. So basically, we are looking at air, water, sanitation, climate change, the built environment, the working environment, agricultural practices, occupational risk, community noise. So all these are the programs that we are promoting. With regards to climate change and health, we have 3 key areas of work, basically, that structure everything we do. The first one is understanding and addressing the wide range of health impacts from climate change. A second one is looking at strengthening the climate resilience and environmental sustainability of health systems and facilities around the world. And the third one, and probably the one that is becoming more and more important now, is basically also understanding and maximizing the health benefits of mitigation actions in other sectors. So as you know, there are key sectors that are contributing to most of the emissions, like, for example, energy, transport. And we are convinced that if health is properly represented, there can be win-win situations for both the environment, health, and these sectors. I don't think we need to spend too much time looking at the health impacts from climate change. This is becoming, unfortunately, clearer and clearer. We are seeing an increase in the number and severity of extreme weather events, also heat stress. We are seeing changes in the ecology of vector-borne diseases. We are seeing, for example, also malaria going now being present in highlands where before was not present. We are aware of all the impacts posed and mediated through health, through food security and nutrition and food systems. And also we are more and more aware of the impacts from climate change via water and sanitation. What you see in the right slide is basically perceived health impacts from climate change. And basically this is coming from the global survey on climate and health that we conduct every 3 years with countries. And as you can see, the priorities or the most understood health impacts from climate change are related to vector-borne, waterborne, and foodborne diseases, also injuries and death from extreme weather events, heat, airborne and respiratory diseases, non-communicable diseases, malnutrition, food safety and security, zoonotic diseases, and something that is changing now, and I think is relevant for planetary health, is mental health. In the previous round of the global survey, the proportion of respondents identifying mental health as a priority was much lower, and now this is increasing. And we are seeing that it's coming this as a priority in different fora. Now, the youth are really concerned about changes in the safe environmental boundaries. They are really concerned about the climate change and the threat that is posing to their health, to their lives, to their future. And this is happening also with regards to biodiversity loss and other environmental pressures. I'm really pleased to see that there is a specific session looking at this, because I think this is going to be a priority in the years to come. And again, not only related to extreme weather events and the direct impacts that this can have in our mental and psychosocial well-being, but also with regards to these long-term, less understood impacts related to, for example, solastalgia or eco-anxiety. This has been also mentioned before. This is coming more and more relevant also in the climate change and health agenda, and it's basically the health impacts of the causes of climate change, which is basically the emissions and air pollution. And as Jordi mentioned before, there are 7 deaths, approximately 7 deaths, 7 million annual deaths from air pollution, from exposure to unsafe levels of air pollution, and this is huge. Something that is important also with regards to climate change and health is the equity considerations. What you can see in the map in the top is basically the representation of those contributions to the emissions. And as you can see, North America, Europe are quite big, because basically they are the ones responsible historically for most of the emissions. But then what you can see in the bottom part of the slide is the representation of where most of the health impacts are being felt. And then you can see that Africa is huge, Southeast Asia, and also Central and South America are also quite big. This is important because it's also related to the difficulty of moving with an agreement on climate change and health, because the equity principle and the common but differentiated responsibility is present in all of the negotiations. This is the approach that we've basically institutionalized in WHO to building climate resilient health systems. At the beginning, when we started working on climate change, we mainly focus on evidence and basically explaining which were the interlinkages between climate change and health. We started implementing projects around 13 years ago. So basically, when we were going at the beginning to countries, they were saying, okay, I understand these impacts, but we really want to get to a practical approach to make sure that we tackle the climate change impacts from climate change. So basically, we took the health systems building blocks and defined 10 functions that, if strengthened, can really support strengthening the resilience of health systems. I will just focus on two maybe, because they are important. Is climate-informed surveillance systems. We are trying to promote the use of climate and weather from seasonality to longer-term climate data to basically understand and try to even predict outbreaks of climate-sensitive diseases. And something that is becoming more and more important also is on the work that we are doing on healthcare facilities, and also looking at environmental sustainability, basically looking at reducing the emissions of health service delivery and overall health system operations. Something that has changed in recent years is the centrality of the health argument in the negotiations. As you may be aware, last year the United Nations Framework Convention on Climate Change, the Conference of the Parties 26, was organized in Glasgow, so under the UK presidency. And this was the first time ever that a formal health program was integrated into the COP presidency program. These are the 4 initiatives that they promoted. One is related to climate resilient health systems. The other one is leading by example, basically reducing the emissions from health sector. Another one was related to ensuring the integration of health into the nationally determined contributions, which are basically the commitments from countries to reduce their emissions. And the last one was mobilizing the health voices for climate action. WHO was working very closely with the UK, and basically, I was more responsible for the initiatives on climate resilient and low carbon sustainable health systems. And today we already have 58 countries that have committed to these initiatives at Minister of Health level. So I'm kindly inviting also Andorra to consider their commitments to these initiatives. These are basically the summary of the commitments. I will not go into too much detail. I will just probably make reference to countries having committed to under these initiatives to assess the health vulnerability of climate change at population or healthcare facility level. And I think it's relevant because this gives us an opportunity to understand which are all the environmental trends and all the environmental causes of causing health impacts. So basically, we don't only look at the hazards that are posed by climate change, like for example, extreme weather events, increase in temperature, changes in the quality of water, but we may have also the opportunity to look more broadly to all planetary health concepts. This is just my last slide, sorry if I was a little bit long, is basically looking at, it's a poll that was conducted in the UK, and people were asked to range which were the more trusted professions. And as you can see, nurses and doctors are the most trusted professionals perceived by countries. So basically, this gives us the opportunity to make sure that the health argument is included as an argument for increased ambition on climate change. And it gives us a little bit the responsibility, but also the positive role to lead by example. So I think what you are doing today is basically contributing to this. And yeah, I'm really grateful for the opportunity. Thank you very much.
Thank you. We will skip time after the talks for collecting questions from the audience. So stay there, please. Now we will introduce the next speaker, Dr. Oisin Brady. He's a GP trainee at the Trinity College in Dublin, and also a member of the Vasco da Gama movement, Planetary Health, and member of the Planetary Health Alliance. So, Dr. Brady, your turn.
Thank you very much. Get my slides here. Can everyone see my slides okay there? Thank you. I'm delighted to be here. My name is Oisin. I'm a family medicine trainee on the Trinity College Dublin Specialist Training Scheme, and I'm the Vasco da Gama Network's Planetary Health Special Interest Group lead as well. And I'm delighted to be here today. When I was considering the topic of this inaugural session, Quo Vadis, Planetary Health, when it's framed in Latin like that, it makes me want to respond in a philosophical way. But there's nothing abstract or philosophical about the very real dangers to human health that are related to the field of planetary health. When considering where planetary health is going, I think it's very useful to just ground ourselves in what the current state of planetary health is, and to give a little bit of background on it. I won't dwell on this for too long, as this has been talked about already, but I suppose to be aware that planetary health is a field that was started in 2015 by the Rockefeller Lancet Commission, and they offered a definition of the health of human civilization and the state of the natural systems on which it depends. So this is, crucially, it's an interdisciplinary field that relates to human-caused degradation of the environment and the health factors related to this human-caused degradation. I'll brave my Latin pronunciation one more time with another quote. Qui totum vult totum perdit. He who wants everything loses everything. And I think this does help us ground our understanding of planetary health and how we found ourselves in this position We know that our continuous industrialization, commercialization, consumption of the world's resources with impunity has unequivocally led to environmental changes and changes in our climate. As the International Panel on Climate Change report in 2021 stated, it is unequivocal that human health has warmed the atmosphere, ocean, and land. World energy consumption has increased from 100 exajoules globally in 1960 to over 500 exajoules in 2020. I think this quote does encapsulate things very well. We have mortgaged the health of future generations to realize economic and developmental gains in the present. And as was discussed excellently in the previous presentation, we enjoy a nice lifestyle in high income countries, often at the cost of severe health effects in lower income countries, and those health effects are starting to be realized now in high income countries as well, related to planetary health issues. This is a very busy slide, and I won't dwell on it for a long time either, but just to reiterate some of those health effects, we've caused environmental degradation and changes to our ecosystem, such as climate change, biodiversity loss, wetland loss, damage to our ecosystems, and this causes myriad direct and indirect health effects which impact each other and exacerbate each other, and cause worsening health outcomes down the line. Direct health effects like heat waves and floods, ecosystem-mediated health effects like altered infectious disease risk, and indeed the recent global pandemic we've experienced directly relates to this: increasing urbanization, population density, loss of biodiversity, and it is fundamentally a planetary health issue. So these poor health outcomes are managed in unsustainable healthcare systems, which have unsustainable practices, and then these unsustainable practices cause further environmental degradation, and this then causes worsening environmental factors. So it's a spiral within healthcare itself. And so where is planetary health going? So if you'll indulge me, I'd like to share another quote. Education is the passport to the future, for tomorrow belongs to those who prepare for it today, as Malcolm X said. And I do believe that education truly is the future, as our literal future as a species depends on a paradigm shift and a seismic shift in our understanding of how we relate to the environment as a species, and the way that we do business overall across all fields. However, I'm a family medicine trainee, and I'm working as a clinical doctor, as a physician, and I suppose my bias is towards family medicine. But I do think that family medicine in many ways is ideally situated within healthcare to relate to the issue of planetary health and to deal with planetary health issues. Family medicine doctors see disease in its early undifferentiated stages, and as was articulated in the previous excellent presentation, the disease prevention is absolutely crucial in preventing poor health outcomes and improving environmental outcomes as well. In our current models of healthcare in many countries across the world, the investment is on secondary care at the stage when diseases have already manifested themselves and they're at the severe end of the spectrum, whereas a more sustainable model would invest at the early stages in primary care and in public health when disease is undifferentiated. And this is projected to dramatically decrease healthcare costs, use of healthcare resources, and indeed healthcare resource healthcare carbon emissions as well. So it's a more environmentally sustainable philosophy. and approach towards health. So how can we, A, identify the areas that need to change, and then to ensure that planetary health is going in the right direction, how can we foster the right practice in trainees and future physicians? So I think when talking to physicians and people in healthcare, the language of medicine is very much based on research and evidence base. And certainly, I think that that's a crucial area to touch on when promoting and advocating for planetary health amongst physicians. And I've just highlighted a sample of numerous groups that exist that provide excellent resources and repositories for planetary health around the world. Groups such as the Center for Sustainable Healthcare in the UK, the Planetary Health Alliance, which is based in Harvard in America, EQUIP in Europe, the World Organization of Family Doctors. This is just a sample of numerous of groups that have excellent repositories on the evidence. I'll provide some samples of areas where the evidence shows that healthcare can improve in terms of their emissions and their impact on the environment. This graph from the NHS report published in 2021 on the right here just shows the distribution of areas in which the highest amount of healthcare emissions are brought about by the healthcare sector. And you can see that the worst area is actually in primary care and family medicine. Pharmaceuticals, including prescriptions, have the highest carbon emission burden. And overprescribing in family medicine accounts for approximately 10% of total prescribing. So it's definitely an area that can be reduced when unnecessary prescriptions are being made. It's very interesting to see that the carbon footprint of each prescription item is modeled at 5 kilograms carbon dioxide. This is the equivalent of driving 28 kilometers in a regular sized car. So it's really significant, these prescriptions, the impact they can have. Nutrition and diet are also crucial areas. These are the cornerstone for a lot of preventative medicine, definitely in family medicine anyway. And this quote, I think, is a nice quote from the Eat Lancet Commission, which summarizes that food is the single strongest lever to optimize human health and environmental sustainability on Earth. So while making positive interventions for human health, you're also making positive interventions for the environment at the same time. The Global Burden of Disease study consistently ranked diet as one of the key risk factors for health. And the Eat Lancet report found that the most beneficial diet for both the environment and for human health is a diet that is more focused on plant-based foods than animal products and processed products like that. Another initiative that can be looked at is social prescribing, which is an area which has already shown great benefits for human health, and green social prescribing can be used as a way of promoting positive activities within nature and improving the interface that people have with their environment and improving health outcomes at the same time. So where is planetary health going, and how can we take these evidence-based measures and instill them amongst young physicians and put them into practice now and in the future? Well, to this end, in 2021, we set up the Vasco da Gama Movement Planetary Health Special Interest Group. This is a group of 45, currently comprised of 45 members. Just to state what the Vasco da Gama is, it's the European network of the World Organization of Family Doctors. It's specifically for young and newly qualified family medicine specialists, newly qualified being in the first 5 years of qualification. And here is a sample of some of our members who have kindly agreed to let me share their photos with permission. You can see that there's a very international representation here from our membership, and we had our inaugural workshop in the Edinburgh conference, Vasco da Gama conference in January of this year, and we tried to ground our ground planetary health in clinical scenarios using the evidence base. So this is a growing group, and I think what this shows is that there's great awareness and appetite amongst young physicians towards planetary health. And I think in order to promote positive planetary health practice, networks such as this, where young physicians can learn about planetary health, can get involved in planetary health work and research, are very important. And then role modeling planetary health in medical practice will help to improve how resources are used, and to help how healthcare systems are organized in order to not only improve patient health, but also improve the health of our environment. My last slide there. Thank you very much.
Thank you, Oisin. The next speaker is Christina O'Callaghan. Christina is Master in Epidemiology in the London School of Hygiene and Tropical Medicine, and now is Assistant Research Professor in AES Global. Christina, go ahead. Seems we have some troubles getting Christina.
Okay, now can you hear me now?
Yes, we can hear.
Okay, thank you for the presentation. I was just saying that I'm also professor at Universitat Oberta de Catalunya, and I mentioned that because I'm going to present some of the work that we do there related to education. So I think, that's important. Well, thank you very much for the presentation, as I said, and for the organizers, especially Jordi, for inviting me today. I would have loved to be there in person, but for several reasons, this has not been possible. But well, I hope there will be other opportunities in the future. Well, I would focus my presentation on education for planetary health. It's nice to hear that Oisin in the previous presentation mentioned that as an important step to move forward planetary health. It seems I'm having some trouble sharing the slides. Okay. Well, these are the 4 topics I like to cover during my talk. I want to stress even more the importance of embracing the concept of planetary health, which previous speakers have already done. Then stress the need of education as a key mechanism to face the global and environmental crisis that we face. Then I will present one of the frameworks that have been proposed to include planetary health education in the curriculum, and I will finish with an example of a postgraduate education on planetary health, basically presenting the masters that we started last October at work. Well, as I said, well, with the previous presentations, I think it's already clear the importance of planetary health, and this will be even clearer after the end of the conference. But as we are just at the beginning of this event, I want to show some data to help understand how and why the concept of planetary health arose. Well, if we look at which have been the trends in human health globally in the last centuries, and especially in the last decades, we see that it has generally improved. For instance, we see that the level of illiterate people, I don't know what's going on with the slides. well, sorry about that. So the number of illiterate people has decreased. The number of people living in poverty, and especially in extreme poverty, has also decreased. Under 5 mortality has gone down, and overall life expectancy has increased globally. However, if we look at what had happened during that same period in the natural systems, we see that during that same period, and especially after 1950, we've seen an acceleration of the human impacts on the natural systems. No? For instance, we see that degradation of the terrestrial ecosystems has been accelerated. Overexploitation of the ocean has been also accelerated. There has been an increase in the emissions of CO2, which, well, as you're aware, is the main driver of climate change. The acidification of the oceans has also gone up, as well as the loss of tropical forest. So what do we see here? So we see that based on observations between the last decades, especially since 1950 until nowadays, we see an improvement in our health at the same time that we see a massive degradation of the natural systems. Previous speakers and environmental epidemiologists like myself, we keep on saying or talking about the importance of the environment where we live to preserve our health. However, seeing at this data, we see a paradox. No, we see an increase, or an improvement in human health, while at the same time we see a degradation in the environment. Well, the explanation for that is quite straightforward, and is that there is a lag between the degradation of the environments and the negative effects that we see in health. Basically, the improvements that we have seen in health globally in the last decades have been achieved by jeopardizing the health of future generations. This has been the discourse for many years. No, we've been talking that we've been jeopardizing the health of future generations, but we have reached a point in which we are already suffering the negative effects of this environmental degradation. Where do we see that? No, as previous speakers have commented, we are seeing the effects of climate change globally, with more extreme events, heat waves, to mention a few of the very clear effects of climate change, although it has been already commented that there are more complex ones. The effects of the loss of biodiversity, that, to mention some examples, compromise or jeopardize food security in many parts of the world, or lead to an increased risk of the appearance of new infectious diseases, or the high burden of disease and mortality associated to global contamination. There is a lot of research linking or explaining the effects of the global environmental crisis and the climate crisis in our health. What I want to stress here is that regardless of which specific aspect of this global environmental and climate crisis we focus on and the health effect we focus on, there are 3 issues that are common. All these challenges are complex. They require a multidisciplinary approach, both to understand them and to face them, and they require urgent action. To put an example to make that clearer, if we talk about climate change, as Elena Villalobos and Usin have commented, the effects of climate change and health are not straightforward, or not all of them, and some of them are mediated through very complex pathways that might need time, and we might require time to see the effects. Obviously, they require a multidisciplinary approach. Again, if we think about climate change, we cannot think that climate change will be solved only by the contribution of people working on the climate sciences or people working on health. We need the involvement of many other disciplines, for instance, people working in technology, in economics, and in other in social sciences. And obviously, we need an urgent an urgent response to those challenges. Again, if we take the example of climate change, a few weeks ago, we have the report of the IPCC saying that we have less than 3 years to act if we want to avoid an increase in global temperature of 1.5 degrees. So it's in this context where the concept of planetary health arose and is gaining importance. Oisin has already provided a definition of planetary health, so I won't stand on that. Basically, stress that planetary health means understanding that human health is depending on the health of the ecosystems in which we live. So basically that we cannot talk about human health without talking about the health of the planet, and the concept of human health should be evolved and talk about planetary health when we refer to human health. So in this context of global and environmental crisis and climate crisis, in which we face, as I said, complex, multidisciplinary and urgent challenges, there is an increasing need for a new generation of professionals, academics and researchers that are able to improve human health within the planetary boundaries. There are a number growing of initiatives promoting this and claiming for education on planetary health. I just want to present you a couple of relevant examples, such as the declaration of the United Nations Global Sustainable Development Report, The Future is Now, published in 2018, in which they call education and institutions at any level, but especially universities, to incorporate high quality theoretical and practical oriented courses for the study of sustainable development. Also, another important initiative is the Call for Action Our Planet, Our Future, which was signed by more than 1,000 Nobel laureates this year, in which they called universities to embed the concept of planetary stewardship in our curricula as a matter of urgency. So basically, there is a growing need of academics, professionals, and researchers that are able to first understand the full complexity of the challenges related to planetary health and well-being, and second, develop and find solutions and implement them and strategies to tackle these challenges. So which are the skills and competences that this new generation of professionals should have? First, these people should be able to find complex solutions, working side by side by professionals from other disciplines. So we need people that are good in their areas of expertise, but they are able to put that knowledge together with the knowledge of people working in other disciplines to find solutions to complex problems. In that regard, experts on planetary health must have a common language and a common vision that allows them to contribute, as I said, to put together the knowledge on different disciplines to achieve common goals. And third, people working on planetary health might be committed to contribute to the search of these solutions and the implementation of those solutions as a matter of urgency. So motivation and convincement that there is a real change needed, it's also important for this new generation of professionals that we need to train. Now the question is how we translate all of this in a meaningful curriculum, right? In that sense, there has been a planetary health framework for education proposed. This was published in the Lancet Planetary Health just a year ago. And they propose, the authors propose a framework that covers 5 domains that should be included in any course devoted to train professionals in planetary health. These 5 domains include the interconnection with nature. So basically that students understand that humans live, said in a way, in symbiosis with nature, so that we are dependent on nature. Second, a domain relevant related to the Anthropocene and health. So so that students understand that the challenges we face are the result of human activity, and that these are causing important negative health effects. Third domain on equity and social justice. Well, this relates to some of the slides that I think it was Osin who showed. Fourth domain on movement building and system change. As I said, we need research in planetary health oriented to promoting and implementing solutions. And a fifth domain on system thinking as complexity. As I previously mentioned, the challenges we face are complex. Just to finish, I want to present an example of postgraduate education, which is the Masters on Planetary Health that we launched last October. To our knowledge, this is the first Masters on Planetary, fully devoted to planetary health. We started, is an interuniversitary master that we started between Universitat Oberta de Catalunya, Universitat Pompeu Fabra, and IS Global. And clearly it has a multidisciplinary approach that is guaranteed by three strategies. First, the program was developed by a multidisciplinary group of researchers and professionals that work in planetary health from different disciplines. Second, we guarantee multidisciplinarity by the students to whom this master is offered. And third, by guaranteeing a multidisciplinary profile in the lecturers that contribute in the course. Briefly comment the structure of the masters. The masters is organized in three conceptual blocks. The first one relevant to concept and methods, in which we try to cover three of the domains that I was mentioning from the planetary health framework. No? In this first block, we give an introduction to planetary health. We provide the students with the methods and approaches relevant for planetary health, and we finish with an introduction to global and multi-level governance. In the second block, we focus on the main challenges that have been internationally defined as challenges for planetary health, and we link this block with the domain of understanding the interconnection within nature. And then we finish with a block on implementation of solutions or the application of knowledge, which we link to the domain of movement building and system change. Basically, in this block, we train students to lead transformative changes in society and how to promote and to conduct research in planetary health. I think I've been already talking for more than 10 minutes, so maybe I'll leave the take-home messages for you to go through them when the slides are shared, and I leave my presentation here. Well, thank you very much. And I leave my email here in case there are any questions that we have no time to go through during the questions and answer part of the session. Thank you.
Thank you, Cristina. Lastly, we have Fernando C. Garcia Lopez. He's Master in Epidemiology in the School of Public Health of the Johns Hopkins University, and is working in the Centro Nacional de Epidemiología del Instituto de Salud Carlos III. I would like to thank Fernando for the effort to be here today. Thank you.
Thank you very much, Josep. Good morning. I would like to thank the organizers for inviting me to this conference. Okay. Every year since 1947, the Bulletin of Atomic Scientists sets the doomsday clock, which is the time we have left until midnight. Midnight is the doomsday day. This year, on like the year before, 2021, it is only 100 seconds to midnight, the closest in 75 years. These are not good news. This gives us a hint of the importance of the threats to humanity. And most of these threats are threats for public health. There are many healths for global public health, but I want to focus on the main, what I consider the main threats, which are pandemics, global warming, and nuclear war. First of all, pandemics. We can see that almost 15 million is the number of excess deaths attributed to COVID-19. This is a report, a recent report of in 5 of May, and in this we can see this is a too high a figure, and but as we can see in this map from the WHO, we can see that there are been countries that have fared very well, those in yellow, such as Australia, New Zealand, Iceland, Norway, Japan, South Korea, China, and others which are fared badly, Peru, Bolivia, Belgrade, Russia, Belarus. So we must learn how to deal with pandemics. And here we can see that how the world has failed to provide vaccines to everybody. And we can see that high-income countries have hoarded vaccines at the expense of low-income and lower middle-income countries. Unfortunately, most of the world was not prepared to deal with a pandemic like this, despite repeated warnings related to influenza or other respiratory infections. This time, in COVID-19, we have been lucky because we could have a pandemic combining the transmissibility of COVID-19 with the case fatality rate of Ebola, which is around 50%. But we can have a further pandemic with both characteristics. So we must be prepared for future pandemics, and we know how to do it. The second threat is the anthropogenic global warming. The health consequences of climate change do not receive the attention they deserve in general media. Last October, WHO considered climate change as the biggest single health threat facing humanity. There are a myriad of healthy risks, both direct and indirect, both present and future. I won't go into details on that because Elena Villalobos has talked about them. This is a report of WHO, very good. But I would like to focus on one idea that Elena said, that the need to reinforce health systems, because without good health systems, the mitigation of climate change won't be won't be feasible. We know that greenhouse gases have been accumulating in the world, especially during the last decade, the last century. And we know that we have not reached yet the peak of global emissions. And we can see that rich countries have not barely reduced their emissions. This is the prospect, the warming scenarios for these centuries, which are very worrying. And if the case we reach 2 degrees Celsius, we can reach a point where irreversible feedbacks can be triggered. And we can see that the high-income countries are the main responsible for climate change, for emissions, and they must be the main responsible for cutting fossil fuels consumption. We know that unless the world moves away from fossil fuels, the outlook for the future is quite bleak. We know what we have to do, and we have to do it. And finally, my third main threat for public health is nuclear war. On this slide, we can see the 2 co-presidents of the International Physicians for the Prevention of Nuclear War, IPPNW. Bernard Lown and Eugene Chasov. They both were cardiologists, and they said then and now they insist that nuclear weapons pose the greatest immediate threat to human health and welfare. The WHO has said the same. The only approach to the treatment of the health effects of nuclear warfare is primary prevention, that is, the prevention of nuclear war. We must prevent with what we cannot cure. Because in addition to the victims caused by blasts, radiation, and firestorms, a nuclear war could bring about a nuclear winter, as smoke and soot would block sun's rays. The nuclear winter could exterminate virtually the whole humanity. If 100 cities in the world are destroyed by nuclear weapons, that could trigger a very hard nuclear winter. Even a limited nuclear war, such as one between India and Pakistan, would have dire consequences to the human health around the world. We cannot forget that we have been on the brink of an accidental nuclear war in a couple of times at least. And these are the men who saved the world. There is a documentary on this officer, a Russian officer. This one and this other both decided at some time not to launch a nuclear war. That would have been an accidental nuclear war. According to Robert McNamara, former US Defense Secretary, we lucked out. It was luck that prevented nuclear war. But there is a solution. ICAN, which is the international campaign to abolish nuclear weapons, which was promoted by IPNW and received the, as well as the IPPNW, ICAN received Nobel Peace Prize in 2017, made every effort to get the UN to approve the Treaty on the Prohibition on Nuclear Weapons, the TPNW. This is a treaty which has not been signed by nuclear countries, but that's the solution to end the danger of nuclear war. To sum up, we must be aware of the threats, of these threats, and act accordingly. We must act urgently. We know what we have to do, but we have to have the will to do it. I could quote Antonio Gramsci. He was an Italian thinker. He said that we have to have the pessimism of the intellect and optimism of the will. There's still time to act. I don't want to be too pessimistic because we know what we have to do to try to deal with these threats. Thank you very much for your attention.
Okay, thank you, Fernando. I think we have at least 10 minutes left for discussion. So if anybody have any question from the audience, please, I think we will have the micro around, I guess. If someone can just formulate the questions in Catalan, we can do it. We can just relate for you. Okay, in the meantime, I have an overall question for the speakers. How we can convince the health administrations and the public and private insurance company to move budgets from the end stage of the diseases to the initial part of the problem with the prediction and prevention. As Dr. Brady said, he's claiming that a lot of budgets goes to the secondary care, and he's claiming that we need to put in the primary care because it's the frontier of the problem. And not only by our healthcare resources, but also all these elements of the social environment. So we can convince the administrations to move this expenditure. We are very, very with alarm saying that the biggest economy of the world, US, has grown 2 points in the GDP in the last decade, expenditure in healthcare, with no better results in quality. So anyone can just address the question? Elena, from the WHO. Gamin.
That's not an easy question. And I think we would like to know the responses, because this is also something that we are claiming internally in WHO. They need to get, I mean, when we compare the 23% of global deaths caused by environmental causes and the budget that the environmental department has, I mean, it's not very coherent. We've been trying to work on this because really we think this is the game changer. And it's not only thinking about giving more money to the Ministry of Health, but basically making responsible other sectors of the health of their populations. So basically we are convinced, and we are trying to really make sure this is happening, that other sectors also take this responsibility. And we think that basically helping them to understand which are the health gains that they can get from healthy policies could basically provoke change. Just as an example, what we are paying for fossil fuels in terms of cost doesn't include the cost of treating all these people that are getting sick and are dying from exposure to air pollution. So we are convinced also that putting a price on that is coherent basically and that includes this cost basically will be a fairer solution, because at some point it's not going to be sustainable basically to keep on just subsidizing this health cost. but again, open to recommendations for making sure that this is considered.
Any comment from other speakers on that?
Yeah, just well, completely agree with Elena. And just to add on that, well, we were talking about the importance of educating and raising awareness in the general population, but I think we cannot just trust in the goodwill of companies to make these changes, and it's clearly needed that we need political compromise to lead those changes through strategies such as well, legislation changing in the taxation of or subsidies, and of course we as individuals can have a role in defining the leaders that we have. So I think it's important to raise awareness and educate society to promote this change, but at the end we need a clearer political compromise and a strong leadership to promote these changes and establish the necessary regulation and legislation for companies to embrace these new policies.
Okay, you have talked a lot about education. Do you think universities are ready to change the curriculum to just move to this new paradigm? Or universities is too late? We have to go to the primary school and the secondary school to get better awareness in the early population.
I think this is not so. These are not exclusive strategies. So I think the earlier the population gets education on environmental issues and children at an early stage are aware of the consequences of their actions in the environment and their health. It's important, but I think universities are very well placed to train professionals. As I stressed in my presentation, urgency is a key issue for planetary health. So we cannot wait until kids who are in primary school now reach university or reach their professional life to make these changes. So I think universities should start now training professionals on this area. And personally, I think that postgraduate education provides an excellent opportunity for training on planetary health. As I mentioned, well, and I and other speakers, planetary health is clearly a multidisciplinary area. So we need experts who already have a good knowledge or are experts in other fields working together. And I think postgraduate education in planetary health provide this environment of putting together experts in different fields and train them to develop a common language to understand and making them able to work together for planetary health.
I think there is a question from the floor.
My name is Anish. I don't know if the mic is working. Hi?
Yeah.
Yes. My name is Anish and I'm founder and managing partner at GSD Health. Our mission is really to promote entrepreneurship and we help companies get investment and successful. My question is for Elena, but again, don't want to put WHO on the spot over here. In terms of what we've seen during the pandemic is there is a lot of reactivity happening from WHO. And now that you've seen a lot of data coming from different parts of the organization, different people, different sectors as well, what proactive measures are we really making in order to help on this part? And I know it's a very open-ended question, but what can we do as individuals from a WHO perspective that we can start changing certain things that are validated by us, and what is the position from WHO on that?
Sorry, could you just clarify whether you are talking about reactivity with regards to COVID or reactivity with regards to environmental health?
No, my question, maybe the straight question is, at an individual level, what is WHO requiring us to do in order to ensure that when we are talking about planetary health, when we are talking about things that we need to take action on today, what are those things that we need to do so that we can start making sure that our future is more secure?
Thank you. And I think that's a very, very good question. Basically, our key approaches, at least on climate change and health, is working with the ministries of health. So our key partner, our key actor is always ministries of health. And most of our approaches are basically, at least the work that I do and that I lead, is creating the guidance, practical guidance tools for ministries of health to be able to both address the wide range of impacts from climate change and then to promote those health co-benefits working with other sectors. At the individual level, we have somebody else who is leading all the work on advocacy and partnerships. And basically, we are working with the civil society, with International Federation of Medical Student Associations, the World Medical Association, just basically working with those that are better placed to send some messages that WHO basically cannot send in the way we would like because we are mandated by countries. And then we have also specific recommendations on how we can decrease our own emissions, but always from a public health perspective. I don't know if this answers your question.
Thank you. Thank you. I would like to have also a question for Oisin, because, and quickly also a quick one. Oisin, today is the International Day of Nurses. By the way, there is also a Planetary Health network of nurses, and they wanted to come. There was no space anymore, but we congratulate nurses today also. But in general, clinicians, you as a clinician, other clinicians, or other even chemists for, I don't know, biologists for planetary health, all these institutions could help a lot, as what Elena was saying now, no? Professionals that can do that. What is your experience, and is it easy to other professionals to do the same that you're doing?
Thanks, yeah. And I'm aware that during my presentation, I focused primarily on family medicine physicians, but that's absolutely true. It's absolutely correct that anyone across any of the healthcare fields can participate. Like the definition of planetary health, certainly, as has been mentioned by the other speakers, is transdisciplinary, interdisciplinary work. And I think that collaboration is absolutely key. The issues that come from planetary health are very complex and they require input from different areas. For example, if you talk about something like the pandemic, you have the biologists working, and the infectious disease scientists looking at the pathogen itself, and then you have the public health researchers looking at how the disease has spread and the population impacts, and then you have the nursing staff distributing care in healthcare centers, as well as distributing vaccines, and then you have physicians treating, obviously, as well, people who get sick. And as I mentioned, the pandemic is an example of a health effect related to planetary health. So all these fields are absolutely crucial. And in research I've done, postgraduate research I've done, looking at education for planetary health amongst undergraduate medical students. Actually, there's a lot of research and a lot of ground has been made within nursing in particular as well. So it's definitely an area that's growing in all areas of healthcare.
Thank you. Last question from the public.
A quick comment. There was a question about how to discuss with policymakers planetary health. Well, I actually wrote a book about that, and I'll be speaking after the break. The other thing is, everybody, you're welcome to stick around because we also will discuss in the next platform primary, secondary, and tertiary education in planetary health. So please stick around.
Okay, let me give a last question for Fernando. From one institution as yours, that is a public institution, how is your feel after the pandemics or after the first phase of the pandemics? Were your institutes enough prepared for this kind of event? and if the administration has followed your recommendations during the pandemics. I think it's not an easy question.
It's not an easy question because my institution is only, it has to make statistics, and a lot of statistics and only a few recommendations. We don't have any executive power, which corresponds to the Ministry of Health. What we do is to analyze data, trends, and so on, but it's the background information we need to have, but that's only a kind of help to decision makers and for them to make decisions. Although I think that in the future there is a plan to change how public health is organized in Spain. There is a plan of building up an agency of public health which must be independent and must do a lot of recommendations that do not correspond to the agency but to the government. But if the government doesn't follow those recommendations, it has to say why they don't do it. Because we need in public health strong, independent organization. Probably my institution could be something to help for that, but unfortunately we don't have that strong information agency yet.
Okay, yes, we will close. I would like to thank you, the speakers, for the excellent presentations and for the discussion itself. Thanks a lot.
Thank you for the speakers for the inaugural conference. We thank Elena, Cristina Oisin, and Fernando here to have come and to have shared your knowledge with us. We request you, if you can, or I think you have to all work, but if you can stay also, listen and follow the conference. And we place everybody to share in your networks, in your WhatsApps, everywhere, the streaming link, because then everybody says, no, I will look it later. No, now is the time, okay? Thank you very much, everybody. It's a pleasure. We have to keep working for planetary health, and we will have now, Laura?
Yes, thank you very much, everybody. Now we have a short break until 12 o'clock, and then we will start with the first roundtable. So see you in a few minutes. Thank you very much.
Thank you.
Thank you.
Okay, yes. Vale. Okay. Yeah, there is some people that are going to have something to pick, okay, to eat. Follow the people who are going there, okay? Yeah.
Nous sommes très fiers en Andorre d'organiser ces premières journées de santé planétaire parce que nous sommes conscients de ce que la santé et la planète peuvent avoir de commun. Il s'agit de savoir d'un côté en quoi les souffrances planétaires, entendues comme écologiques, peuvent toucher la santé des hommes et en quoi les habitudes des hommes peuvent affecter justement ceci, l'écologie et toutes les, disons, les attributions que notre planète, entendue comme écosystème, peut avoir sur la santé. Alors, c'est véritablement, nous pensons, et c'est pourquoi nous en sommes fiers, une innovation que de rapprocher ces deux disciplines qui sont à la mode, hélas, pourrait-on dire. Et donc, ça sera notre première occasion d'accueillir ici de très grands conférenciers qui font autorité en la matière, que nous allons écouter avec attention et que tous les assistants et que tout le public va devoir suivre s'ils veulent respecter à la fois leur santé et à la fois notre planète.
Hi, Jordi. Thank you very much. That's a pleasure to be here in Andorra in this very important activity. Yes, planetary health, for those like me that is in the field for some decades, it's an interesting concept because we start as environmental health early in the 90s, 70s, so discussing in Stockholm all that relationship between environment and people, and very much focus on the media, air, soil, water, and that's all important today, yeah, but it was kind of segmented, and that's come together in explaining the relationship between environment and health, and the environment epidemiology then was a very important concept, and everybody, you know, dedicate ourselves to environmental epidemiology, environmental toxicology, and also the science of exposure was a big, you know, community working and discussing it, and that is have an evolution to talk about determinants of environmental health, determinants of health, and then from there there are these new concepts that is very interesting, planetary health, where not only you look into the same very important issues, that the interaction between media and people, but a little bit broader. You look for the interaction between humans and the earth, and how that is happening, and also how that distribution is socially fair or unfair. And this is, I think, is the very interesting advancement in this concept of planetary health, different from what we had before, because it's a more holistic view and more focus on the planet, people, and the equity. So that's all the same time. And this is an exciting time where, you know, after the publishing of the Lancet Commission on Planetary Health and all this big community that is actually evolving and forming, and also trying to perfect the concept itself, because it's a concept that, in principle, looking to go a little bit more focus on Earth system and Anthropocene era, but actually we end up being more anthropogenic and very much looking in the humans' health and very focused on humans. So, and I think the community is now advancing and discussing more and more this interrelationship, this integration, and that's why such meeting like this one in Doha is so important, not only for review where we are, but also to address and discuss how to challenge and advance knowledge in this very important new field of public health and global health, of course. Thank you.
So thank you very much on behalf of the Barcelona Institute for Global Health, is global, its trustees, institution, and the whole is global community, to the authorities of Andorra for this kind invitation to participate to this international conference on planetary health that comes at a very important moment. In an intense and closely interconnected, permanently changing world, all health is global and therefore needs to be understood beyond geographic and political boundaries. And also, health needs to be promoted and protected as a global public good. So it's global as an academic research and translation institute, has been a pioneering center in promoting the concept of planetary health as a new way of thinking about and researching health in the context of the Anthropocene. Since this new concept gained visibility a few years ago, ISGlobal has promoted its adoption as a cross-cutting approach that requires understanding complexity, working in a multi and interdisciplinary way, and also, importantly, acting urgently. Our commitment to combine human health with the concept of the health of the Earth's natural systems coincides with some of the formulations both of the United Nations and of prestigious academic institutions and different fora all over the world. For ISGlobal, our main challenge is how to improve health and human development and at the same time reduce the enormous health inequalities, in other words, the unacceptable lottery of where you are born and raised. And this challenge becomes concrete with our commitment around the Sustainable Development Goals and the relevance of the climate crisis and the Anthropocene as a unique opportunity for transformative changes to precisely improve health and equity. We work on two main fronts: combating diseases related to poverty and improving equity in health and development, and also in promoting healthy environmental conditions, especially in cities. And in both areas, with these both approaches, we combine human health and environmental sustainability as key components. And I have to say that the current COVID pandemic, should accelerate precisely the understanding, the importance and the scope of this idea of planetary health. Obviously, this poses enormous challenges, both challenges for the imagination and the way of thinking about health, but also challenge of transformation, of policies, of action, and especially of urgent action. So in closing, we are very happy to do our bit to contribute from our knowledge generation, dissemination and application activities to tackle these challenges, and also to be part of this outstanding event today in partnership with prestigious and committed institutions and colleagues. And also we remain open to find new ways to align new opportunities to formalize our mutual collaboration with Andorra, as we have done in the recent past around the COVID-19 pandemic. Thank you very much for the opportunity and all the best for the conference.
The health of humans and ecosystems are more and more intertwined. Planetary health is an emerging discipline which covers the linkage of those concepts. Facing these new changes, we will need to adapt and transform our healthcare systems, and also it will be necessary to work together with scientists and researchers from the disciplines related with ecosystems. The coming Planetary Health Conference, to be held next 12 and 13 of May in Andorra, will cover some of those aspects. Please join us.
Older people are vulnerable to the effects of climate change, like extreme heat, air and water pollution. Given this situation, a healthy aging can enable all the people to be more resilient to cope with the changes. At the next international conference, Planetary Health, we will explain the Andorran healthcare program to promote a healthy aging.
In the Planetary Health Conference, we will talk about the microbiome, its interaction with the ecosystem, and its impact on the human health.
Els propers dies 12 i 13 de maig tindran lloc a Sant Julià de Lòria la jornada sobre salut planetària. Intervindran institucions andorranes i també de caire internacional, com per exemple l'Organització Mundial de la Salut. No us ho podeu perdre.
From the point of view of public health, planetary health offers many opportunities and challenges. Public Health Agency of Catalonia is involved in different initiatives. I would like to highlight the identification of environmental risks to health, the evaluation risk with risk assessment strategies, and actions to promote the reduction of the risk. It's a pleasure to see how this interdisciplinary field, the planetary health, includes health people with this important concept.
Human health and environmental health are two main topics that scientific community have been dealing the last years. However, the intersection between these two dimensions is still not deep explored, and this is a great challenge that we have in the coming years, and after pandemia is of course one topic that has been put in front of our priorities. The International Conference on Planetary Health is a great opportunity that we have to join the cutting-edge community dealing with this topic. So we're really welcome to host you here and have the opportunity to discuss this amazing topic with us.
Well, planetary health is a new paradigm that has arisen in the last years, and basically it refers to the importance of understanding that human health cannot be separate from the health of natural systems. Basically, in the last decades, the improvements in global health have been sustained by an overexploitation of natural systems. We've seen in the last decades how life expectancy has improved, under 5 mortality has decreased, but on the other hand, during this same period, we've seen an overexploitation, as I said, of the ecosystems. We've reached a point in which we have to change our definition of health and understand that
health has to be understood as a global concept, and human health cannot be separated from the health of the natural systems. And this is especially important, as I said, in this point in time where we are facing the climate crisis and the global environmental crisis.
Now that we are seeing the war in Ukraine, the danger of nuclear war is rapidly increasing. In the Cold War, the concept of MAT, mutually assured destruction.
Hola Eduardo, ¿qué tal? Supongo que estás por...
passant el doctor Eduardo Celades, que és un metge espanyol que ha tingut la delicadesa d'atendre, està a Nigèria, en el terreny, i està a punt d'entrar a la connexió. Esperem un parell de minuts i en aquest sentit, si no, hi avançarem. Està dentro? Vale.
Pots començar tu. Tu pots fer el welcome i després t'agafo jo. O directament jo. Què prefereixes?
Carles, quan puguis entra.
Welcome back to the conference. After this short break, we will move on now to the first roundtable entitled Pandemic Lessons to Address Planetary Health Challenges. 2 years ago, when the pandemic broke out, citizens may have difficulties to follow and to understand epidemiological discussions. But now, 2 years after all this fight against the pandemic, COVID-19 pandemic, the situation is so different, and all these discussions maybe are more common and more easy to understand. Now we have a big opportunity to use all the lessons we have learned to set and to fix possible planetary health challenges. Now in this first roundtable, we welcome Deborah Thompson, founder and president of One Health Lessons, Joan Carles March from the Andalusian School of Public Health, Eduardo Celades, Chief of Health and HIV/AIDS at UNICEF in Nigeria, Ferran Campillo from Holot Hospital, and Carla Prats, researcher and professor at the University of Catalonia.
Thank you very much, Laura. We can launch, to remember, this video of 20 seconds, just to put everybody on the context. Remember that we're... Thank you very much. We have online also Eduardo Celades from Nigeria. Thank you very much, Eduardo, for being with us. And we will have to wait for Dr. Joan Carles March. There has been an emergency, specifically a funeral, so we'll see if he can join with us. If not, we are very happy to have with us Dr. Eduardo Celades. Thank you, Eduardo, to be with us. And we leave the moderation to Dr. Mireia Garcia from Ministry of Health of Andorra. Thank you, Mireia. The floor is yours.
Thank you, Jordi. Thank you, Laura. Hello, everybody. Welcome to this roundtable, the first one of the conferences. And as what the master said, this first roundtable is about COVID pandemic. Again, we're talking today about this great situation and that we lived for the last 2 years, but today we're not speak about cases, not deaths, no loss, not face mask. Today we want to know if we learn something, if we can use these lessons to face up new challenges like planetary health. And we'd like to answer these two questions. After these 2 years of pandemic, we learned lessons that can help us for these new future challenges, and how can this knowledge be used? So that's what we ask to these fantastic panelists that are here with me and others virtually. They are 5 speakers with commendable careers from different fields. So as on the previous session was said, planetary health is a crucial issue that has to be faced by a multidisciplinary approach. That's what we try when we invited these speakers. You will see that each one is from different fields. So we hope that we'll conclude more widely with their own point of view. So at the end of the 5 or 4 presentations, we will have time for the audience questions. So let's get started with the first speaker. She's Deborah Thompson, on my left side. As was said, she's veterinarian. She's founder and CEO of One Health Lesson and a chair of the One Health Education subgroup of the World Veterinary Association, and author of The Art of Science Communication. It's this book that is very, very interesting. So, Deborah, welcome. Thank you for being here. The floor is yours.
Gracias. Hola à todos. Bonjour, bonjour à tous. Nice to see everybody. Merci pour l'invitation aujourd'hui. Thank you very much for having me here today. It's an absolute pleasure to be here. I am coming from Washington, D.C. in the United States, and this is a thrill to be in Andorra. Before I get started, I wanted to ask, a show of hands if you don't mind, who here considers themselves in science, technology, engineering, or mathematics? Okay. As expected, a lot. Next question, and keep in mind, I am used to very loud Americans, so please shout out, how old were you when you wanted to be in this profession? You don't remember? It was so long ago? Is that what I'm getting? 10, 18, 15? Okay, so young. 40, yes. Young in general, right? Young at heart, right? So just for clarification, yes, I am chair of the World Veterinary Association's One Health Education subgroup, but this particular talk is focused on One Health lessons. And if the remote works, let's try this. It works. One Health lessons. What is One Health lessons? It is an organization that inspires children and adults around the world to value the connection between our health and the health of the environment, animals, and plants. It's that connection that we teach. Now, how do you explain the One Health concept? You see, One Health is like planetary health. Look at this definition very closely. Does anything look familiar to you? 15 years ago, 20 years ago, we used to say One Health was mainly animals and humans. No, we have soil scientists involved, we have water analysts involved, we have air specialists involved, we have global planetary health involved. So now's the time to talk amongst everybody, right? So what is the One Health concept? It's that connection between environmental health, planetary health, plant health, public health, animal health, because we're all connected. Now, how do we explain the One Health approach? And this is how we explain it to the little ones. We say it's teamwork. Put simply, it's teamwork. One word, teamwork. Between people of different backgrounds, disciplines, and strengths, we come together to solve and prevent health problems. Simple. The One Health concept, in one word, is connection. The One Health approach, in one word, is teamwork. Does that sound familiar? Now, the mission of One Health Lessons, this organization that teaches this around the world, is to inspire children and adults around the world to really value that connection and value that teamwork. The vision is ultimately, I understand, it's not a small vision, it's a large vision. It's to change societies to create a more sustainable planet. So right now, we have 11 different age-appropriate lessons on onehealthlessons.com. You are more than welcome to explore it, and surprisingly, or not, thanks to David Villanova, we have lessons available in Catalan. So we'll go over a few slides from the original COVID-19 lesson that has to do with the human, animal, environmental connection and ecosystems, of course, but then we also have a lesson focused on the COVID vaccine, particularly the mRNA, messenger RNA vaccine. And how on earth do you talk to a 6-year-old about messenger RNA when they don't even know what a cell is, right? They don't even know what DNA is, let alone messenger RNA, right? Well, explore the website. We have done it. We have done it because before being a veterinarian, I was teaching. I taught kids as young as 5, 6 years old, and I taught students as old as 65. So I had that wealth of knowledge, and I created these lessons for the world. This is, as you can see, it's been translated in several different languages, including French, of course. And this is one of the examples that we provide at One Health Lessons. So in this situation, we explain to the 6-year-olds, we say, look at this forest. It's beautiful. The sun is shining, the water is clean, the animals are not competing very much for food or for shelter. And then something changes. We have a discussion. Why would there be a change? And where are the animals going, right? If you lose your home, if you can't find food locally, where do you have to go? They have the same problem. And just like for humans, there's cortisol level, the stress hormone in animals. And when the cortisol level rises, just like in people, we can have a weakened immune system and start to show more signs of illness, right? We all know that for people. It's also recognized in animals. So look at these animals who are starting to move. And at this point, the students already know about zoonotic diseases, diseases that can jump between different species. So we ask the students at this point with this simple diagram, say for instance, if not just one bird leaves, but all of the birds leave, the owls, the hawks, the little chickadees, the little parrots, everything leaves. What changes? So we ask them, and we review. Well, there are less trees. Why? Because there are less seed dispersers. Why are there more rodents? Why? Because there are less owls and hawks. Why are there more foxes? Because there are more rodents, right? And then we have to think about what are the germs that can be shared between all of these different species, going back and forth. So the students get this really fast. They understand. But we do a lot of activities. So this is Catalan, clearly. And if I could ask maybe Jordi to be a volunteer. Thank you, Jordi, for being voluntold, as we say. So we say, there are different types of mutations, right? There are point mutations. There's genetic reassortment for, say, influenza, swine flu. So this is an example of how we share what a point mutation is with students. We ask them to do a tongue twister. So for instance, you don't need to do it 5 times fast, but just to demonstrate, if you don't mind. Just once, it's fine. So you can imagine, thank you. So you can imagine, if you say that 5 times fast, there's going to be a change, right? Unless you're like a professional. But there's going to be a mutation. And the way we explain mutations to children is they're changes, right? They can strengthen something, they can weaken something, or they can just change something and it's benign. But that's the way nature is, right? So we also play up the fact that we cannot lose further biodiversity. No, bats are incredibly important, and we review this with the students. So to wrap up, what can you do to promote planetary health, One Health in your community and beyond? Well, there are 3 options. Okay, and feel free to check out the QR code that I have there. Track number 1, you can become a certified lesson leader. That means that you take part in 4 hours of
self-paced training, and you learn how to speak to children and adults of various ages how to communicate planetary health to them. Then, if you take it upon yourself to teach 5 times in your own first language in your own community, then you become a One Health Lessons ambassador, and at that point, you teach others locally how to teach these lessons. Because ultimately, I did not create One Health Lessons for the English-speaking world. I created One Health Lessons for the world. One Health Lessons exists for the world. And it takes hundreds of volunteers, like David, to translate these lessons so that you can have these lessons be accessible to children and communities around the world. Last but not least, I invite you all to yes, excellent. I'm happy that you signed on to the website. So track number 3, an internship. Right now we have 2 weeks left of an open enrollment period for interns. I have had interns from around the world working with One Health Lessons. They have been physicians, they have been internal medicine specialists in veterinary medicine, they have been environmental health scientists, they have been law students, international relations students, even dental students. Okay? All I care about is that you have a passion for planetary health and One Health. You want to dedicate your time to improving the health of everything, animals, people, the environment, right? And you have to be 18 years or older because it's easier that way for me. So feel free to explore that QR code. And for the last minute, I wanted to share a video. Just a word is that I know that there's a lot of movement in the planetary health space and the One Health space, especially in education, right? What's very important to recognize is that we don't have much time, right? We don't have much time to get our message out there. So instead of recreating the wheel, I invite you all to join our efforts so that we can succeed together. Gracias.
Thank you very much, Deborah. Our second speaker will be Dr. Eduardo Celades. Yes, you're sorry. You're online. Dr. Eduardo Celades is a Chief of Health and HIV and AIDS at UNICEF in Nigeria. Welcome, Dr. Celades. Thank you for joining us from Dakar, I think. Can you hear us?
Gracias. Thank you. Thank you very much for inviting me. I hope that you can hear me well. I'm so sorry to be so far away. At this moment, I am in Bayelsa. Bayelsa is a state in the south of Nigeria. It's actually the state in Nigeria where oil was discovered more than 50 years ago. And actually, I just came back, sorry for being late, from a meeting with the deputy governor, where he was explaining to me that oil was a blessing because they got the resources and the financial resources that came with oil, but as well a curse, in the sense like now they are having so many health issues related with pollution and relating with the exploitation. So I think that's very relevant actually for the discussions today. So, but before going further, just to say I'm very enthusiastic on the presentation from Deborah and One Health Lessons. So Deborah, I see that you're working in Nigeria. Please liaise with us, with UNICEF here in Nigeria. We'll be happy to work further with you. So this is an open invite. And so thank you to Jordi, to Mireia, to organizers for doing this cross-fertilization, right? That allow us to learn from each other and to look for opportunities. So let me just share my screen. Let's see if, I hope you can see. I hope you can see. So basically today, over the next 5-10 minutes, I'm going to talk a little bit of my experience as a doctor that I have been working in public health in low and middle income countries for the last 15 years.
Sorry, Eduardo.
Yes,
We can see your screen. Wait a moment. I think we have.
Okay.
Now. So go ahead.
Okay.
Sorry.
Excellent. Thank you. Sorry. And in any moment, the line can be interrupted. Sorry for that. It's noise in the background, so apologies for all this. It's the reality that we are facing here. But just to say, what I'm going to do today in the next 5-10 minutes is to share with you some reflections, right, that I have learned over the last 15-20 years working in low and middle income countries, and especially in West Africa. And I am not an academic, so my reflections or comments, don't think that they are for the Lancet. It's based on personal experience, and it's based on what we are seeing and what I have been doing for the last years. And I wanted to start. Let me see, how can I move to next? Yes. So, okay. I wanted to start talking on for me, like, what are now the main two global agendas that we have at this moment, and to see the links between them. When I started in the early 2000s, as many or some of the people that are in the audience, the main global issue was the HIV. If you remember, the 3x5 initiative, and was how to end or to control at least HIV in most sub-Saharan Africa. Since then, the challenges have multiplied exponentially, I would say. So there is a clear global agenda where a lot of us we are working. It's called the Global Health Security Agenda, that basically tries to respond to the question of how we prepare to the next pandemic, how to respond to it. And this has been very much what we have been doing over the last 2 years, and the best example is COVID-19, right? But we saw that as well after the 2014 outbreak of Ebola in West Africa. So there is a clear drive at global level to look to the next pandemic or to the current pandemic. But as well, it's an emerging issue. That's the one that we are discussing during these days. It's in planetary health. That, I mean, there are many definitions, but to me, what tries to do is to respond to the question how environmental factors influence health and what can be done about it. And a good example, we just saw it in the One Health lessons, and how animals, forests, vegetation interact with one to each other. But what I believe is, like, we cannot have one without the other. And as you may remember, the Ebola outbreak in 2014 in Sierra Leone started with a boy that in the border between Guinea-Conakry and Sierra Leone ate or was infected by a fruit bat. And that was because there were like exploitations of wood in that area, that basically they clear the forest, so human beings were going to places where normally they were not going. And with COVID-19, we don't know yet exactly origin, but what we know is like movements of people, globalization, etc. They have contributed clearly to really spread out COVID-19. So it's clear that there is a strong link. However, let me go to next slide. I would like to highlight is like, how is it done now? Global health security and planetary health, and how it could be. And as well, here I am talking based in my experience. What I am seeing is like many of the priorities that we are discussing, they are decided in the offices in Geneva, in London, in New York, but very often are disconnected from the reality of what is happening in Bayelsa, for example, where I am now in the south of Nigeria, right? We have the nice words, frameworks, and declarations, but this is not translated into practice. As well, in my opinion, we have some legal and binding instruments. For example, in global health, in the Global Health Security Agenda, we have the international health regulations that they make mandatory to report certain diseases like polio, for example, or yellow fever. And in planetary health and climate change, we have the Kyoto Protocol, the Paris Agreement, etc. But these instruments are not enough to really make a change, because most of the times, it's a volunteer to join them, and it's difficult to make them enforced. As well, low and unpredictable funding. I have to say, it's true that with COVID-19, for example, in Nigeria, we are receiving a lot of funds, as well happened in Ebola in 2014 or in other outbreaks. But however, they are very unpredictable. So it's very difficult to really plan long-term responses based on that. And the last 2 points for me are very important. One is the insufficient integration and efforts to build resilient health systems. We cannot really achieve our goals in improving health outcomes if we don't have a strong, resilient health system, especially primary health care, to really deliver the services that population need and in an affordable way. And I think it's very important that the two global agendas are focusing on that moving forward. And as well, as we say often, prevention is better than cure, right? So I think still very often we are very reactive, and we are not almost proactive trying to find the solution. So how it could look like instead of having these the issues that we have in the first column. So I think a bottom-up approach will be much better to really tackle the problems that we have. And I will show some of the issues here based on my recent experience in Nigeria. And as well, we need to move from the current voluntary international agreements that are not binding to really legal frameworks that can be enforced. And one example is the Pandemic Prevention Preparedness Agreement that is currently negotiated in the World Health Assembly, but others that can come. As well, how we can move to long-term funding and use south-to-south capacities and capabilities. Here in Nigeria, it's amazing the capacities that they are from the people and the way that people are doing things. So as well in Sierra Leone, how to respond to Ebola, or in Liberia, community centers were created by their own communities. So how we can build on that to really move forward. And again, how we can build resilient health systems moving forward. So I will share with you some reflections, three reflections only, that I got from my experience. The first one is like extremely weak health systems, as the ones that we have in many low and middle income countries, are overstretched, and it's very difficult to them to respond to sudden changes, being outbreaks, environmental challenges, etc. So let me just show you a few maps here. This is Nigeria. This is the map of Nigeria, 36 states. In the first map, in the left, you will see ANC1. This is the first prenatal visit of pregnant women. The blue, that is normally, it's mostly in the south, is like the best coverage. In the north, we see lower coverage. Actually, when you see the lower coverages, is the places where there are issues on access because of insecurity. And this insecurity is very much related not to religion, not to Islamism, but is related with the traditional fight between herders and farmers, between pastoralists and farmers, because of the use of land and water resources. So I don't know if I can point it, but in the places that you see in the first graph in like orange, this is the places where we're seeing this conflict because of water. And this has been aggravated in the last years. And this results in that less women can access to prenatal visits. If you go to the second map in the middle, you will see that actually the first one relates to access, but the second one relates to quality of care. So the map is getting red and red. And when you see skilled birth attendants, that is the pregnant women that they went actually for the skilled birth attendants for deliveries in the hospitals, you see this is mostly red. So we have basically this map shows that when you have a weak health system, access is aggravated for environmental issues, then quality as well is not good enough to keep the clients or the users of the system into the system. So you get people try to go, pregnant women, to the first consultation, but they don't manage to go through all the consultations to deliver until the end of the process. So at the end, health outcomes are not improved, and we are seeing a tremendously high rates of maternal mortality and child mortality, especially in the north of Nigeria. Only in Nigeria, more than 2,000 children, they die every day for preventable causes. And almost 150 pregnant women, they die every day. Like a plane with 150 pregnant women crashing every day. And this is not in the news. And this is everything related with the problems that we have and in access and in quality of a quite overstretched health system. what happened when COVID-19 came and the efforts were diverted to the response of COVID-19. So you can see here clearly in this graph what started to happen starting in the first quarter of 2020, that what we saw is a consistent decrease even of the services provided to the population. So what we are seeing is like weak health systems, when it's compounded with a chronic environmental issue and then with an acute crisis like COVID-19, are unable to deliver the services the population need. So that's why we really need to invest in health systems. My second reflection that I would like to share with you is how disease control is intrinsically linked to climate and hygiene conditions. And I will talk about polio. And as you know, we are very close as the world to eradicate polio. It's polio now. We have only wild polio in 2 countries, in Pakistan and Afghanistan. One case was detected 6 weeks ago in Malawi. But for example, in Nigeria, in August 2020, we were able to eradicate polio. This was really a huge success. However, as still we have so poor hygiene conditions in most of the country, what we saw, and you can see here in the graph in 2021, it was a resurgence of cases. In this case, it's not all polio cases, is vaccine-derivated polio, but it's very much related with 2 of the issues that we have been discussing. One is the poor hygiene practices. The other one is the poor and weak health system that cannot deliver high immunization coverage rates. In places like in the Northwest that we're seeing, only 11% of the children are vaccinated. So really we are seeing like how we don't have a really functional health system. And here, what we know, the good thing is like what we know what needs to be done. What we know that if we intensify routine immunization, if we do campaigns, if we improve hygiene, if we really have a good safe water sources, we can really end the current polio outbreak that, as maybe you know, is the biggest polio vaccine-derivated outbreak in the world here in Nigeria.
Sorry,
so
Eduardo,
maybe
you have 1 minute. 1 minute.
Okay, yes,
Thank
I'm
you.
going to my last reflection and then I will wrap up. The last reflection is like, despite of the challenges, guys, we know what needs to be done, right? That's the good thing. So here I can show you as well with some data how is the vaccination coverage in Nigeria of Planetary, the best proxy that we have. How in 2021 you can see below how was reduced, but in this other slide we can see what we know what could be done. In this case is to do massive outreach campaigns with a very low cost. You can really increase immunization coverage. This is just an example. We know what to do for most of the challenges that we are facing. That's the good news. So I would like to end with some final considerations and takeaway messages. The first one, it's clear, at least to me, that we cannot achieve the Sustainable Development Goals, especially SDG 3 on health, without a strong global health security agenda for pandemic preparedness and with a strong planetary health approach in mind and in practice. And this should be further leveraged to strengthen the health systems and tackle inequalities that we are seeing across countries and within countries. My second consideration is the current legal frameworks are insufficient and have limitations, especially because we are dealing with growing complex issues that they go beyond our areas of expertise. So we need to bring people together from different areas of expertise to really be looking to how we can have strong agreements in place. The third one, and this is an appeal to the people sitting in Washington, D.C., in Geneva, in London, in New York, priorities should be defined bottom-up, should come from country level, from community level, and we should take in consideration local, national, and regional priorities, as well as the multisectorialities that we have. Finally, I think that if we want to succeed responding to the next pandemics, the current pandemics, to addressing the planetary health issues and environmental health issues, we really need to invest in sustainable, resilient health systems. And Miriam, I think I will stop here. I hope I went not too far away from my time. Thank you very much.
Perfect. So thank you very much, Eduardo. Well, we move on to the next presentation. I think that I will introduce Dr. Ferran Campillo to have time for the next one. He's a pediatrician from Olot Hospital who has created a pediatric environmental specialty unit. So welcome, Dr. Campilla, thank you for being here.
Thank you
and
very
the
much.
floor is yours.
Thank you very much. I would like to share my presentation. As you can see, we are talking about planetary health, but it's more planetary pediatrics or children, because as I'm going to explain now, children are the most vulnerable of all the population to planetary health issues, and also the solutions and the approach that we are going to that need to be done is child-centered, child-focused. So I'm a pediatrician. I'm a physician, a clinical doctor, working with children. So I would like to show to share with you some points that some flash points that I think are very important in terms of planetary health. Maybe many of you have seen this comic strip that shows that COVID is just a tiny wave in the ocean of the crises that are coming ahead, like recession, that is a euphemism for poverty, climate change, but also the biodiversity collapse. Some years ago, some pediatricians working in Europe, but also in Latin America and the Caribbean, were thinking what are the main issues for our children, for their health, in terms of environmental challenges. So we found that climate change, of course, is one of them, and children are one of the most severely affected by this, because in the World Health Organization estimates that around 88% of the burden of diseases related to the climate change is going to fall upon children under 5 years old. So you can see that there is an asymmetry, a terrible burden for children, even though they are not prepared. They are especially vulnerable, both physiologically, but also in terms socially and other. Also, air pollution is one of the biggest threats for them. When parents come to my office, to my medical office, and they ask me about their child's asthma or some other diseases, they need to be aware that air pollution is now responsible for, here in Europe, for at least 1 out of 3 new cases of asthma, of chronic respiratory diseases like asthma. And maybe in bigger cities like Barcelona, this amount of this data is even more important, and maybe half of the new cases are due to a bad air quality. But many other are especially important for children, no? And I'm happy that some of them have been brought here. But one of them, for me, is maybe not the root, but a very important one, is the lack of contact with nature. Contact with nature, when people are not in love with nature, when people are not, they don't know the things that nature provides us, people tend to neglect it. So first point that I would like to share with you is that children are not small adults. No, when we see this picture, we can see that children have bigger heads, and in terms of the whole body, but they also have physiological or health vulnerabilities. They breathe more air per kilo per weight than the adults. They eat more food per kilo than the adults, and they also have special features. They are of course smaller. So when they are walking or they are crawling, they are putting things in their mouths, so they are at risk of poisoning or other health problems. They also have a lack of decision power. Here, I think we all are adults, and if we go to policymakers, there are no children there. So the approach to politics, the approach to planetary health is sometimes, or most of the times, I would say, centered in adults. So this is one of the main issues for them, because they are the ones that they are going to suffer more from these planetary health issues, these planetary health problems, but they are not participating. They are not they can have a vote on what we are doing in Kyoto, Paris, Glasgow, etc. And this is a picture I like. You see that here in nearby in Catalonia, in Spain, there's this movement called Revolta Escolar, school rebellion, and this is an opportunity for them to express themselves, to say, hey, our schools are not a healthy place to be. This place where we spend a lot of time are noisy, are contaminated, are polluted. So they are telling us adults that something needs to be done. And what about pandemics? Well, in many countries in Europe and in Spain, children were one of the collectives that had to be in a restrictive lockdown for a long time. You could go take a walk with a dog, but children needed to be indoors for more than 6 weeks. So what we studied is that children who had access to open areas, to green areas, their well-being, even some of them improved, but at least they could exercise, they spend more time with their family. But when the household income was not guaranteed, when they had no balconies, no gardens, no open areas, they struggled the most. So again, children, and especially poor children, are the ones at risk. So I'm going to share with you some experiences we had at our pediatric environmental health specialty unit, and during the pandemic. One of them was that we took our office to the forest, because we knew that transmission of the virus, of the COVID virus, was was greater in indoor areas. So we went outdoors. This is our small forest outside our hospital. And there is also another experience that we call it Forest for Health. we try to reconnect children with nature, but we do it as soon as we can. So we start working with pregnant couples who come to us in their routines for checkup routines, and we ask them about the contact with nature, about how often they go to the forest, to the beach. So and if they don't go, we of course we recommend it. But after that, when the baby is born, we say that in our hospital all the deliveries are twins, because when they go home, they take home a child and a tree. So this experience is trying to reconnect the children, reconnect the families with their environment, to take care of it, and so far it has been a great experience. Also, education is a main issue for children, of course for adults. So we had another experience that children used to visit our hospital, and during the pandemics we had to cancel this activity. But outdoors we can also explain a lot of health issues, a lot of planetary health issues. So we take a walk in our forest, and we explain them things about air pollution, about mobility, about climate change, about biodiversity, and it is also a great experience for them, and of course for us. Yes, I think this is the last slide. We also go to the schools. We also go there to show them and to not only study their air pollution, the air quality, but also that this may translate to something in their community. No? So in this case, they are studying the air pollution in their school, in the school area, so they can translate into posters, into brochures, into actions that can change, in this case, the mobility, the commuting to the school, but also that can give data to the policymakers. And these are some materials that we have created with the Spanish Pediatrics Association in order to foster active mobility to school. And I would like to say that it is time for planetary pediatrics, and this is a paper, it just came out, that the children's approach to planetary health is not only important, but it's the only way for me to see it. So thank you very much, and I'm enjoying it.
Thank you very much, Ferran. And now we have here Clara Prat. Yes, finally we changed the order. Clara Prat is a professor at the Polytechnic University of Catalonia and researcher in the group of computational biology and complex systems. So welcome, Clara. The floor is yours.
Thank you very much, Mireia. Thank you, everybody, and especially to Jordi for inviting me here. It's been an incredible experience, and we have just started. So, okay, so I have, yes. So good morning, everybody. In the first 10 minutes, I will talk a little bit about data, about what have we learned about data during this pandemic, and also about the communication of this data. Despite I'm not a data scientist, I'm not an expert on communication like Deborah, but we have been users of these things. So I will talk from my experience rather than from my expertise, let's say, okay? So I will start by introducing myself just to put this talk in context. Okay, I am a physicist, I work with physicists, but we have spent more than 15 years using mathematical models to study infectious diseases. So we live in this multidisciplinary world where we collaborate with medical doctors, with microbiologists, with radiologists, with computer engineers, with many pediatricians like Ferran. So we are used to this communication between different disciplines, and it's an amazing world to be. I love it very much. So given our expertise, of course, last 2 years we have been involved on the pandemic, and just to illustrate why have we used so many data, because we have been collaborating with the Catalan government, also with the European Commission, by providing them with monitoring tools, which are at the beginning, they were scarce. We have been working on predictions, daily predictions of incidents, of admissions, of deaths, of visits to primary care, of different issues related with the pandemic management. We have been working a lot also on different analyses using these computational-based approaches. Like, for instance, with Ferran and other pediatricians, we have studied the transmission in schools. How do they contribute to the pandemic, or how the measures that have been implemented for children are working, like masks, like these bubble groups, like this kind. Can we evaluate these measures that are harmful for children, of course? And in all this pandemic situation, we have also worked on, well, we have devoted some time on communicating, trying to help people understanding what the situation was and how could we contribute with better, let's say, epidemiological behavior, or etc. So this is our framework, and I will talk from this context, okay? Just a few words. I'm sure that everybody here, everybody are scientists. I think that everybody answered yes. So everybody is aware of why that data are important. But just to mention a few keywords, of course, data are not perfect. Data have many limitations. Data are not reality. Reality is much more complex than what data can reflect, but at least data are the best way that we have for objectivizing reality, to quantify things. And this is the starting point for many things. This is a starting point for describing a situation. When we want to face a problem, when we want to find a solution for something, we first have to describe, to see which the situation is. We have to analyze this situation. We have to try finding causalities, interactions, connections, and data are the raw material to find these interactions. And we also need this data to build the models, for instance, for increasing the understanding of this system, of these interconnections, to make predictions, or to, for instance, explore different control interventions. To cite a few, I could extend the list. But of course, I think, or from our expertise, data are like the cornerstone of the scientific progress, and this is why they were so important in the pandemic. Nevertheless, if we travel 2 years ago, the situation was, wow, the situation was very complicated from the data perspective. I think that in all the countries we were not prepared for diagnosing. We were talking this morning about the case of Andorra, for instance, with the PCRs. We were talking with David, but we could only diagnose the serious cases in hospitals. We had many problems on the case definition. What is a positive by COVID? What is a death by COVID? Still today, we have problems to define what is an admission, a COVID admission. Is it caused by COVID? It's COVID incidental. Can we distinguish? So, and of course, the information systems were not prepared. So it was an absolute disaster. But nevertheless, we had something. From the very beginning, we had some institutions like the WHO, the ECDC in Europe, CDC, or the Johns Hopkins. that were trying to gather the data that we had with many limitations, but they were data at least regarding cases and deaths, which were the first data that we could analyze. And many countries started providing this data. At the beginning, the analysis was quite manual because we had to deal with PDFs. PDFs were still today, we are being communicated data with PDFs, but in any case, we have to start to learn how to transform PDFs into data. We have to manually revise many strange things, like this here, this plot in the bottom is the first wave in France, for instance, and if you see, there are a few spikes. Of course, they were not reflecting an increase in transmission due to super spreading event, let's say, but they were related with changes in the reporting protocol. So it was a quite manual work. But despite all these situations, we could start working. We could start fitting models. This is a picture from February, I think. We could start doing something with this data. So even with the limitations, data were essential. The situation today is very different. I think that these 2 years have supposed a huge jump, let's say, or a huge advance in terms of data. These databases have increased in terms of quantity of data, on quality of data. They are much better, but nowadays we have many other things. We have this fantastic Our World in Data platform where we can find not only cases and deaths, but also vaccination, but also admissions, but also tests, but also many different data sets that are important as well to do better analysis, to do better predictions. Also, many countries have made an effort to increase the granularity of this data and provide data by regions, by municipalities. So the higher the granularity, then the better the analysis, the predictions. Okay, I can go to the details and increase this knowledge. And we have extended the concept of necessary data to deal with health problems, for instance, with the mobility data, which were crucial in some points of the pandemic. So we learned that we had to widen our perspective and work not only with health data, but also mobility data, also with education data, with socioeconomic data, and put everything together. So I think that the change has been enormous. So, what have we learned during these 2 years? Okay, there's a principle, which is this FAIR principle, that I think that the pandemic has demonstrated that is essential. The data must be findable, accessible, interoperable, and reusable. Okay, without these four principles, data cannot provide the whole potential that they have. I must say, I think this afternoon there's a specific roundtable about digital health and health data, but I think that this pandemic has been an opportunity for increasing the effort on this digital health, and this is in the same time it's increasing the amount of data that we can work with. So the more the data, the more the knowledge that we can extract, and this is the best way to increase this scientific knowledge. So regarding these principles, of course, they entail that data must be transparent, of course, and I would like to reinforce this message of the need for open data. I think this is important, obviously from the philosophical point of view. When we talk about health data or mobility data, for instance, we talk about data that are generated by persons. So I think that this data belong to the persons, belong to the society. So this data must be open, satisfying all the protection stuff. Okay, but this data belong to society, so they must be open from a philosophical point of view. But at the same time, we have seen in the pandemic that the scientific progress has been enormous, and one of the reasons is that there were thousands and thousands and thousands of scientists working on a common issue. If we have open data, then we have more data available to more scientists. So from a practical point of view, the more the scientists working on something, the higher the probability to find better solutions. So I think that open data is the necessary point from this philosophical, but also from this practical perspective. Of course, we have also seen that it's very important that the data have, between countries, we have some kind of homogeneity or common protocols or something that allows for a more global approach rather than this local approach of what is occurring here today. But I can learn from what is occurring in another country and act in consequence. So I think it's essential to promote these like supranational data infrastructures that provide this common framework and that, to some extent, centralize. And I think that a big effort on centralizing data to common spaces, even data from different nature, not only health, but also mobility data, socioeconomic, education, meteorological, climate, pollution data. If we move forward this connection between data, then today, fortunately, we have tools like artificial intelligence that can find connections that we cannot imagine. I think that the first talk in the morning about this Andorra particular case was an example of this, okay? Sorry, Clara. Okay, 1 minute. Okay, and then regarding the data, just to mention this need also for a common structure in terms of space or of granularity. And a key point for me is that the data must be very, very well documented. I mean, a number without the explanation of what is behind this number, it's nonsense. I need to know where this number comes from and what are the inherent limitations so that my analysis can be put in context and my conclusions can be put in the context of these limitations or this meaning, etc. And to end, and as a final message, I would like to talk a minute about the need for communicating data, okay? Why? I think there are two reasons again. One of them is that related with what I was mentioning, that data belong to society, so they should receive the feedback about this data. But when we talk about these global problems like the planetary health, they require global solutions. So everybody must be engaged to this solution. So we must communicate to people. Who must communicate? And this word has, this point has been mentioned many times this morning. I don't have the answer because scientists communicate, politicians, technicians, outreach experts, influencers, community leaders, journalists. Probably all of them are necessary in this ecosystem for data communication, and also they must communicate between them. I have to talk to politicians, I have to talk to journalists, okay, and they have to talk to me, okay? So all of them are important. Where? Of course, media and social media, but we have to move to the schools, and I like Deborah's talk very much. We have to go to schools, we have to go to civic centers, we have to go to the community, we have to find a way to communicate to everybody in the society, even those that are not reading the newspapers. How? Of course, with transparency, with a balance between rigor and simplicity so that everybody understands what I am saying. And I think that it's important to put data in context when talking to people. What does it mean that the temperature will increase 1 degree for the next X years? Does it have implications? Otherwise, this 1 degree is like a number. No? I have to put this data in context and try to explain what does it mean. We have to talk with empathy and listening because people's worries are normally different from yours, and you have to provide the answer to these worries. And so here with the pandemic, there was a moment where everybody wanted information, and there was a moment where everybody turned off the radio when we were talking about the numbers. So we have to find the right balance between the need for the information to be translated to population, but also to be aware of the over information or the fatigue, the pandemic fatigue, etc. Okay, and I think that's it. Thanks and sorry. I think I take one extra minute.
Thank you, Clara. Finally, we've got Dr. Joan Carles Marc. He's online. Thank you very much, especially for coming. I know you had some problem. He's from the Andalusian School of Public Health. He's a doctor, and this Andalusian School of Public Health is a public institution located at the University of Granada. Welcome, Dr. Marc. Thank you for joining us.
Thank you very much for your invitation. Thank you to Jordi for invitation to me. I will talk about lessons for all about One Health. No? First idea that I can try to explain that in front that happen in our world, there are two things, good government or bad government. About the ideas, the things that happen in our world, there are two different ways to explain our different policies about it. No? Good government or bad government. No? The scientifics, the technical professionals, we are learning about what is important to change about the problems that we are. No? We need a change, an important change that all our environment is possible to change and go to that idea. No? About it, we need to change that an adequate public health strategy needs a strategy. I think we don't have a strategy about what the public health need in this moment, and we need a strategy. It's very important to have clear about it. No? And I explain about it, about this strategy, something that for me is very important to do. First is inequalities. Inequalities, we are different people, and different people need different strategies because we have different audience, and for this we need different strategies to arrive each one. First idea about inequalities, and for this we have to have an idea, a clear idea about what are inequalities and the difference between people about to arrive to the health. No? We know that social inequalities kill the people. That is very important to be clear in this moment. No? In the pandemic, the income of the richest, the 10% went from being 5 times higher than that of the poorest 10% to being 15 times higher according to the Bank of Spain. No? This is very important because that explains that in the pandemic, the people who has more riches have been more and more. And this is one of the problems to be in front to the inequalities we have in this moment. No? The pandemic hits low-income households the hardest and widens the gap in Spanish society. And the virus chronicized the inequality. And during the confinement, the increase in stress poverty was enormous. That is another problem. During the confinement, the increase in extreme poverty was enormous. That is one add problem to know. No? And we know that we need to reduce the gap between the poorest and the richest. This is we need this to change. Is the first idea I can explain. The second idea is about the social determinants of health. No, we have different social determinants of health: the genetics, the environment, the economic, the social, and the healthcare system. There are different aspects from the population health. No? And for this, we need to do some different things. First, we need to review the old age care model. This is very important, and in this pandemic, we have seen that is very, very important. The second, this is to the view of the people, of the old people, is not to view the health and not to view the other things that are important to increase the health. The second aspect is the countries have to address the issues of health and development because the population health remains a challenge. And this is very important to have an integrated model for action. An integrated model for action between programs and between policies, between programs in individual behavior, programs in lifestyles, and policies between settings and circumstances. They are very important to have an integrated model for action. And for this, it's very important to reduce risk factors, to reduce risk circumstances, and maximize assets. They are very important to change this idea. Reduce risk, increase assets. It's very important to change the view we have. No? The third aspect I can explain is to know that that says to your heart it's very important to know the different factors influence the disease at a community level. It's very important to have a different view about it. No? And for this, something for me is very important. First, health is already being damaged by rising global temperature and the destruction of the natural world, a situation health professionals have been drawing attention to for decades. That is very, for me, important to say in first place. The second question is a global risk of 1 degrees above the pre-industrial average and continued loss of biodiversity carry a risk of catastrophic health damage that will be impossible to reverse. Despite the world necessary concern about COVID, we cannot wait for the pandemic to end to quickly reduce emissions. And also, the conclusion of scientific studies are, for example, disaster occurred before our eyes and on a large scale. The COVID pandemic that we have suffered Science 2020 originates from a zoonosis related to deforestation. Cold drops, snowfalls, torrential rains, drought, health waves, and megafires multiply and accelerate this problem. In our country, in Spain, 75% of the territory is already at high risk of desertification. Is another problem we have. And for decades, successive governments have failed to take action commensurate with the magnitude, urgency, and severity of the climate, energy, and biodiversity crisis. From science to action, the first coordinated scientific rebellion in more than 25 countries. And we have worked about it in different places in our reviews, etc. No? And the threats of the survival of our civilization and even to life of the planet is increasing every day. This inaction, we have an important inaction, can no longer be tolerated. The situation is so serious that it is necessary to mobilize the scientific community to demand immediate action. There is no time. We don't have time, and for this is very important to change. We know that the pandemic can help a cleaner world, much cleaner air, but this is a necessity. And this needs an action about the politics, about the scientific, because we need a change, a very important change to cleaner world. The fourth thing I can explain is we see things with different textures and colors. And for this, we need to change our point of about our actions. And for this, we need to build trust. To build trust with professionals, to build trust with citizens, to build trust with associations, to build trust about with scientific societies. We need to build trust because we don't build trust, we have a problem, an important problem. And for this, it's necessary to work individual and to work with groupal actions, community action and individual action, groupal action, and community action. This is the important to change the problems we have. No, and for this, is important collectivity, an intelligence collectivity, because we need a leadership and we need to stretch the public health and bringing it closer to the ground. And for this, we need more gift and prepare it, as public health more social, and a public health more about context and environment. This is very important to change the public health we have in this moment. And for this, we need also to support the community care networks. It's very important to support community care networks. We change, for change the public health is important, these three actions, and also to support community care networks. And also to improve the social umbrella, because it's necessary to change the difference between richest and poorest.
Sorry,
for
you,
this,
you have
we
one
need
minute.
Change to need increase our communication to arrive the different people. And for this is we need increased response capacity to health crisis with a network to create network, to collaborate, to listen people, listening with conversation, with interaction, with participation, with collaboration, with an open view of the different problems we have. And this is all, I think, I have different measures. We need to change the different things. And all of this question, we need to work with people, with professionals, with scientific society, with patient association. This is important, with, no about, no, because we need to work with these different people and association. And for this, we need to be near than the people. Thank you very much.
Thank you very much. Thank you to all the speakers. I think we've got a great presentation. And now we finish and we have perhaps 10 minutes for discussion. I hope you got your question ready in the audience. I don't know if anyone has a question, please raise your hand and specify if the question is for a specific speaker or not. I think that this is.
Hola. This is David. Thanks so much for the talks. It's really impressive. I mean, we're facing talking about data, and we're facing the same challenges in Andorra. It's time to open and go for openness of the data. I think it would be great. So I have a lot of questions, but probably I will skip some for lunch. But Deborah, what do you think? What's the output from or the feedback from one lessons from both from the obviously from the kids, from the teachers, and so on, but also from the institutions and regarding this program? What's your feedback?
Yeah, thank you, David, for the question, and also thank you for volunteering to translate so many lessons into Catalan. Feedback from the students, they love it. Honestly, I get feedback from classrooms around the world, and the key is to get the students to laugh, to play, to have fun. And at the same time, they learn. But they don't focus on learning. They focus on doing that tongue twister and getting it right 5 times, right? And then, oh my gosh, the competition on that is fierce. Let me just say that. There's One Health Lessons ambassador. We just celebrated our 2-year anniversary last week. And the ambassador was at the graduation ceremony, and he shared a story. He's from Nigeria, and he's a 3rd-year undergraduate student in studying microbiology. And he said that he approached a school of, oh my goodness, well over 1,000 children, right? And he said, I wanted to see if you were interested in having me come and speak as a guest speaker. And when they heard about what he was going to be discussing, they said, no, the kids are not going to be, they're going to be too small for this. And he's like, well, let me just give it a try. And after that one try, we had, apparently I wasn't there, but he said that there were students and teachers stopping right next to the classroom, peering in, and then they invited him to go to their class, and then go to their class. And over a course of 3 months, he has gone to 22 schools, has educated over 1,100 students on his own. And when I said too small, the age that was at that school was as young as 3 years old. So he was teaching kids as young as 3 years old. Now, what do the principals think of this? The directors of schools? they often really like it because at the same time as the students are learning, they're also seeing real life scientists and engineers and mathematicians coming in and speaking about something that everybody can relate to. But it's like a real life human being coming into the classroom and serving as a role model. So that way the children don't feel like science is too far away because you look like just somebody else on the street, right? So it's been I'm fortunate and happy to say that it's been a great success around the world, and we always modify based on the culture at hand. So instead of saying a strawberry, I don't know, we have strawberries here? Okay, yeah. Okay. It doesn't exist in Nigeria. So instead of having a mutated picture, a strawberry that's mutated as a picture, we have bananas. So that's for instance. Thanks for the question.
Here.
Thank you. Clara, you said that you are not a data scientist, but you act as a data scientist during the pandemic. Yes. My question is, you just use it or apply it, your knowledge, your previous knowledge, and you get an output, or you learned a lot during the pandemic?
I learned a lot, but I learned a lot every day, even before the pandemic, and this is thanks to this multidisciplinary way of working. But if we talk about data, we had to learn a lot because we had to change our perspective. We used to study tuberculosis before the pandemic, so we were studying a disease that had a long history with, well, limited data, but a long history of data and knowledge, etc. And when the pandemic started, we were dealing with a new disease, so we knew almost zero about this disease, and we didn't have this historical data. So I think that the most important thing to learn for us was to grow with the data, let's say. So we start working with really limited data, but with very dynamic data that were changing every week in terms of significance, of meaning, of what were they representing. And yes, we have learned a lot of things, but I think that the most important for us was this change in perspective, that we were inside the problem, we were inside this data, and we were seeing how these databases were built and how they were growing, and we could also interact with the people in Catalonia, in this case, that were working on the data, and it was amazing. Thanks.
Yeah.
Hi, Clara. Stefan from Malta. I was also practically in the data management team of the COVID response in Malta. Two main questions. What automations did you implement, if any, especially when it comes to collating the data? And how did you resource the daily updates? Especially, like, how did you resource? Like, because, for example, in our case, we really had one person who, let's say, thank God, she didn't take sick leave, you know? And even if that happened, or if there was vacation, we stepped in. And even in the first part, it was just 2 doctors doing the daily statistics, and then this person came in, and thank God for that, because we could do different focus. But in your case, how did you do that? Like, so summary, resourcing, and automations. Thanks.
Okay, at the beginning, everything was absolutely manual. And progressively, we could change into automatizing things, etc. So we always try to find data sources. So we didn't work on the building of the data. So we already worked with somebody provided the data to us. But in the case of Catalonia, we were in constant feedback, okay, to each other. So we did not participate from inside, but we could have this feedback, and this was very, very important. Well, we finally tried to find a balance, because if you wanted to provide very, very particular predictions, for instance, with Catalan data, we worked with different data sets, we made many different kinds of predictions and analysis, but it could not be so automatized. But but in the case of Europe, for instance, we still today we are producing weekly predictions. At the beginning, they were daily predictions, so we could not try to predict, for instance, hospitalizations for all the countries, because hospitalization data were different for each country. So we decided to provide only the incidents and the deaths predictions, because this was the only way to do it every day for all the countries. You know, so we had to find a balance between both.
Thank you.
Yes, thank you very much. You know, really, really great presentations. Really great because all of them were very focused in innovation, in ideas. But I don't know if this question has an answer. I really don't know. But basically, how can we use this planetary health, this One Health, all these approaches, all these great innovations, and focus more in the left behind populations? How are we really, you know, using all these great initiatives, but focusing, you know, in the refugees, in the migrants, in the indigenous communities? I don't know how to explain to them, you know, to a child that has no food for today, on how to implement the One Health approach. Thanks.
Perhaps, by Eduardo, perhaps. Are you there, Eduardo?
Yes, yes.
Okay.
And
can you answer?
Maybe, thank you. Maybe a couple of cents on that. I mean, I think with planetary health and with the COVID-19 pandemic, we learned many things, right? Like vaccines can be developed in 1 year with a new technology. We learn medical treatments and how to reduce mortality. But what we didn't learn is, as you said, how we can really respond to the people that they most need it, especially leaving no one behind. And to me, a key issue here is equity or inequities. What we are seeing is like in the high-income countries, to treatments, to diagnostics, to having amazing initiatives on planetary health, but the economies less advanced and low and middle income countries, they are still facing tremendous inequalities, both with the rich countries, but as well within countries. Here, the differences in Nigeria between the Northwest and the Southeast are massive, at more than 40 points in immunization coverage, for example. So I really think that what we need to do is to try to have an equity lenses, and that all these innovations that we have been seeing here today are actually translated to low and middle income countries and are not only adopted, but are adapted first. Because the technology requirements, the approaches, as we said with Deborah earlier, are different, right? So I think this is an appeal to really think with these equity lenses to how we can adapt and adopt all these new tools.
We have some problems with the
Could I
with the image.
Could I
Perhaps Deborah,
contribute?
you would say something.
Yes, two quick stories.
Approaches and technologies.
Eduardo, we have some problems with the sign-up now. I don't know if
Sorry, yes, I think I was cut. No, just to say that to end the reflection. So how this is an appeal to all the audience and all the innovators and decision makers in the audience to really think how we can adopt and adapt the new technologies, tools, and approaches to the reality of the communities and the low-income countries. Thank you.
Thank you very much. Sorry, Deborah.
Thank you. Yes, these vulnerable populations, it's definitely, I mean, you work with them all the time, so you know how sensitive this type of information is. And certainly when you have to worry about a roof over your head where your next meal is, how can you bring a sense of planetary health to those populations? Well, we have done it, fortunately. So 2 short stories. Right now, as we speak, there are 4 members of a refugee camp in Kenya. They're originally from the DRC, Democratic Republic of Congo. And they have found out about One Health lessons because one individual had his niece, who's 5 years old, show up at a lesson online, and he was inspired buy it, and he wanted to teach locally because he saw the children, they need something else to do. He wants to inspire them to think bigger because eventually he wants them to get bigger, right? So he has taken it upon himself to motivate other adults to go through this training program with One Health lessons, and he's almost becoming a certified lesson leader as we speak. So that takes place in Kenya. There's another One Health Lessons ambassador who's in Malawi, and his background, he's a veterinarian, and he has taken it upon himself to approach an orphanage. And he approached them by talking about, sanitation, wash, and all that. But what was interesting is that after teaching that first lesson about, the connection between everything, they invited him back to speak about the messenger RNA vaccine. So now I think, I challenge you all to think, what can be done as a next step after the general audience already knows about what vaccines are about, why mutations are important to track. So since they already have that buy-in, regardless of what audience you're speaking with, can you think about how much easier the next step is to promote public health, global health, planetary health? So, thank you.
Ferran?
I would like to add that for me, one of the key things is governance. Is here or in Catalonia in Spain, the decisions that are taken are decided by a minority in many cases. And when I say this is not a political party or something, in children that are or people below the age of voting, below 18, and migrant people are sometimes half of the population of a community, and they don't get a voice, they don't get a vote. So many times the decisions that are taken, they are not taken into account. No? So having this scope, this view of the problem, I think that would help to get the problems done.
Thank you. We should start finishing in just 4 or 5 minutes because we are very late. But we have another question right there.
Oh, okay.
Thank you. My question is for Professor Juan Carlos Marc. I've been following for many years your extraordinary role as a pioneer in the School of Patients, no? and the model of the person-centered care. You've said that pandemic have increased the inequalities. Inequalities kill. Okay, what do you think about to what extent people are aware now of their central role in health, no? Because people now are worried, are upset, feel rage. What do you think in this scenario? Things how would evolution?
It seems Juan Carlos Marc is not anymore connected, so we will translate him that question.
Okay, thank you.
If anybody of you wants to answer that, if not, as it was supposed to be in the schedule, now it's the time where, thank you very much for all the speakers, where I should be doing a summary in Catalan, because we agreed for the local population. We'll do it very quickly, maybe 1 minute in English, and then in Catalan 1 minute, because we are leaving. Thank you all the speakers. No, thank you, Dr. Mireia Garcia, and thank you, Ministry of Health. No, it's been a pleasure all these months. The support of the Ministry of Health, it's been amazing. Mireia, Elena Mas, Cristina Santa Rosa, Jesus Galindo, many of the speakers here are here because of them, and thank you for all the support. And basically, thank you, Eduardo, from Nigeria. No, you have been pointing all these aspects of the necessities that are needed now, not in big numbers. And then, as you were pointing, Carlos, you will talk tomorrow about, this afternoon, about migration. No, Juan Carlos also talk about the social umbrella. No, and then we had two extraordinary people targeting children. No, Deborah how we can engage them in a different way and learning things that maybe don't know about the concept, but we already touched them with the sentiments and how we can move them into the right direction. We think that it's the right direction. You say children are not small adults, no? This is magnific, and congratulations for your pragmatical, hands off. I mean, pragmatical aspects with the trees, with the implementation of all these policies was fantastic, no? I will move to, and Clara, of course, you say something very important, no? That the number, the data must be accurate, must be explained, must be thought. And I was thinking how we can use this description of data for planetary health. When we see that in Nigeria what happens, or here also what is going on, how we can use this data, explain data, to convince politicians and bridging that with the first or with the inaugural roundtable. When you, Dr. Piquet, asked to Elena from WHO, why the budgets are not adequate in that sense, So this data could help so that budgets are put together, are poured into what we need, because at the end, if 23% of the burden of disease is due to environmental issues, I think the numbers are clear, So thank you very much. I will make a very... Gràcies a tots per estar aquí escoltant-nos, els que ens estan escoltant. Aquí tenim 4 o 5 persones extraordinàries que han fet un resum de lo que és les pandèmies, les lliçons de la pandèmia. I en aquest sentit, el doctor Ferran i la Campillo, la Débora Thompson han parlat de com els nens poden ser ensenyats d'una manera on encara el coneixement no sigui l'adequat, puguin ja orientar-se cap als objectius de sostenibilitat. I en el cas del Ferran, que està fent una gran feina a Olot, a l'Hospital d'Olot, on ha creat l'oficina de mediambiental, una unitat pediàtrica mediambiental, no n'hi ha gaires, crec, a tots els territoris, i això com crea des del començament que la família planti un arbre, per exemple, passegi pels boscos, faci visites al pediatre d'aquesta manera, i des del començament la família i la relació és una cosa holística i relacionada amb el medi ambient. L'Eduardo Celades ens ha explicat des de Nigèria les necessitats puntuals d'ara mateix i com, per exemple, diferències entre els agricultors i els ramaders respecte a la sanitat, que és això millor que salut planetària, com hem de tenir en compte l'ambient per fer polítiques sanitàries. El Joan Carles March, com sempre, com deia el company, des de fa molts anys, el pacient centrat socialment, en aquest sentit, i això és molt bo. I finalment la Clara Prats ens ha explicat moltíssimes coses sobre les dades i experiències i com ha après molt ràpid a utilitzar aquestes dades amb la política. Moltíssimes gràcies a tots. Passem a la meva companya i ens veiem més tard.
Gracias, Jordi. Thank you very much for this roundtable. Now we will move on the lunch break, and then we return in the afternoon at 3:30, more or less, and then we will continue with the second roundtable. So thank you very much, and see you soon.
Thank you so much. Thank you.
sommes très fiers en Andorre d'organiser ces premières journées de santé planétaire parce que nous sommes conscients de ce que la santé et la planète peuvent avoir de commun. Il s'agit de savoir d'un côté en quoi les souffrances planétaires, entendues comme écologiques, peuvent toucher la santé des hommes et en quoi les habitudes des hommes peuvent affecter justement ceci, l'écologie et toutes disons, les attributions que notre planète, entendue comme écosystème, peut avoir sur la santé. Alors, c'est véritablement, nous pensons, et c'est pourquoi nous en sommes fiers, une innovation que de rapprocher ces deux disciplines qui sont à la mode, hélas, pourrait-on dire. Et donc, ça sera notre première occasion d'accueillir ici de très grands conférenciers qui font autorité en la matière, que nous allons écouter avec attention et que tous les assistants et que tout le public va devoir suivre s'ils veulent respecter à la fois leur santé et à la fois notre planète.
Hi, Jordi. Thank you very much. That's a pleasure to be here in Andorra in this very important activity. Yes, planetary health, for those like me that is in the field for some decades, it's an interesting concept because we start as environmental health early in the 90s, 70s, so discussing in Stockholm all that relationship between environment and people, and very much focus on the media, air, soil, water, and that's all important today, yeah, but it was kind of segmented, and that's come together in explaining the relationship between environment and health, and the environment epidemiology then was a very important concept, and everybody, you know, dedicate ourselves to environment epidemiology, environmental toxicology, and also the science of exposure was a big, you know, community working and discussing it, and that is have an evolution to talk about determinants of environmental health, determinants of health, and then from there there are this new concept that is very interesting, planetary health, where not only you look into the same very important issues, that the interaction between media and people, but a little bit broader. You look for the interaction between humans and the earth, and how that is happening, and also how that distribution is socially fair or unfair. And this is, I think, is the very interesting advancement in this concept of planetary health, different from what we had before, because it's a more holistic view and more focus on the planet, people, and the equity. So that's all the same time, and this is an exciting time, where, you know, after the publishing of the Lancet Commission on Planetary Health and all this big community that is actually evolving and forming, and also trying to perfect the concept itself, because it's a concept that, in principle, looking to go a little bit more focus on Earth system and Anthropocene era, but actually we end up being more anthropogenic and very much looking in the humans' health and very focused on humans. So, and I think the community is now advancing and discussing more and more this interrelationship, this integration, and that's why such meeting like this one in Doha is so important, not only for review where we are, but also to address and discuss how to challenge it and advance knowledge in this very important new field of public health and global health, of course. Thank you.
So thank you very much on behalf of the Barcelona Institute for Global Health, is global. Its trustees, institution, and the whole is global community, to the authorities of Andorra for this kind invitation to participate to this international conference on planetary health that comes at a very important moment. In an intense and closely interconnected, permanently changing world, all health is global and therefore needs to be understood beyond geographic and political boundaries. And also, health needs to be promoted and protected as a global public good. So it's global as an academic research and translation institute, has been a pioneering center in promoting the concept of planetary health as a new way of thinking about and researching health in the context of the Anthropocene. Since this new concept gained visibility a few years ago, Global has promoted its adoption as a cross-cutting approach that requires understanding complexity, working in a multi and interdisciplinary way, and also, importantly, acting urgently. Our commitment to combine human health with the concept of the health of the Earth's natural systems coincides with some of the formulations both of the United Nations and of prestigious academic institutions and different fora all over the world. For its global, our main challenge is how to improve health and human development and at the same time reduce the enormous health inequalities, in other words, the unacceptable lottery of where you are born and raised. And this challenge becomes concrete with our commitment around the sustainable.
Welcome everybody. After this lunch break, we continue to this amazing conference on planetary health. Now we move on the roundtable number 2, entitled Environmental Impacts in Your Health. There's no doubt that all the changes we have been discussing today affect on our health. And the scientific community says that we must increase our awareness and also promote preventive actions. Planetary health is an interdisciplinary health, so we can work on it about different type of projects, different type of work lines. For example, we can approach it by looking at changes in nutrition, or for example, by actions in sustainability. We will talk about that and so many other issues in this roundtable. I welcome now Miguel Ángel Royo from the Carlos III Institute of Health, Pedro Albajar from the World Health Organization, Luis Augusto Casaña from the Center for International Health Relations at Osvaldo Cruz Foundation, Fiocruz in Brazil, Patricia Ripoll from the Reamos Project and COVID Warriors Association, and Irene Emma Corbella, Head of Environmental Health at the Public Health Agency of Catalonia.
Thank you very much, Laura. As you remember this morning, we have prepared some videos to remind you what is that about. Let's launch the video, please. Thank you very much, and we leave the room, to Silvia Ferrer, Director of Environmental and Sustainability of the Government of Andorra. Thank you, Silvia.
Thank you, Jordi. So, welcome everybody. Well, now we start this roundtable about the environmental impacts on your health. So, if we think about environmental impacts, from my point of view, from the point of view of technical point of view, from a person who works in environmental aspects from the technical field. A quick idea is to think about air pollution, water pollution, waste, we just seen in the video, and also maybe climate change, well, the changes or the losses in the biodiversity. But today, with the experts here and our experts online, we will see other issues or other aspects related with the environmental impacts in the health. So we will see how we will talk about nutrition, about the neglected tropical diseases, about also a specific initiative related to air quality. And also about the disbalance in the ecosystems, which are related to the health. And finally, we will have a general overview of the policies related with health of the Catalan government. So we will start. We will welcome to Mr. Miguel Ángel Royo from the Institute, from the Carlos III Institute of Health. An institution that has become the national and international benchmark in biomedical research and public health in Spain, and the government's go-to public research organization for funding and implementing biomedical research nationwide. Carlos III investigates a wide variety of topics, including infectious diseases, public epidemiology, and health, or the relationship between environment and health. So, Mr. Miguel Ángel, the floor is yours. Sorry, Miguel Ángel. I think we have a technical.
Sorry.
Now.
Sorry.
Okay, thank you.
Thank you very much for your introduction. It is my pleasure to be here. I want to thank you, the organizers, the government of Andorra, Silvia, Jordi, and Jesus for their invitation. It's my pleasure, and I'm going to share now the presentation. What I am going to talk is about the impact of food system on human and planetary health. We can say that food systems are the main driver of environmental impact and the main producers of health and environmental impacts in human and the planet. We can see that the number of undernourished people in the world continues to grow. Over 800 million people in 2020, and that year, almost 1 in 3 people in the world didn't have access to adequate food. So we're suffering moderate or severe food insecurity. 1 in 5 people, in 5 children in the world are stunted, 1 in 15 are wasted, and 1 in 18 are overweight. And most of those children live in Africa and Asia, the most populated continents in the world. And if we look at the global population, 1 in 4 people suffers from overweight in the world. Regarding health impacts of food systems, as we can see, almost 1 in 3 deaths in the world are caused by one of the main forms of malnutrition, which are obesity, dietary risks, and undernutrition. And as this report clarifies, undernutrition, obesity, and climate change constitute what we can say a syndemic, or a synergy of epidemics, because obesity contributes to climate change, and climate change through weather events contributes to undernutrition, because food availability and access is reduced. This is endemic because these three phenomena co-occur in time and place in the world now, in the 21 cycle, and they share common underlying societal drivers, and they interact each other with producing complex sequelae. Obesity also interacts with many other diseases, mainly non-transmissible diseases. As we can see with COVID-19 in this graph, we see that the mortality was much higher in countries with a prevalence of overweight higher than 50 or 60%. And this is due to the impacts of obesity in hospitalization. The risk was more than 100 higher. The units of intensive care admission, the risk was 74 higher, and mortality, the risk was almost 50% higher. There are not only health impacts, also obesity has big economical impacts. In fact, the almost 2% of the gross domestic product in the world is lost by the economic impacts of obesity, mostly indirect cost, but also direct cost due to the diseases associated with obesity. And finally, regarding environmental impacts, we can say that food production is the main cause of environmental degradation. Agriculture now occupies 48% of the land, almost 50%, which is, say, the limit of sustainability. We cannot use more land for agriculture. So we must be more efficient in the future. 70% of fresh water is used for food production, and almost 1/3 of greenhouse gases are produced by food systems, mainly by the meat production, and food systems are the main responsible of extinction of species, eutrophication, and death zones in lakes and shorelines. Not to say the big impact of food waste, which is the third emitter of gases, greenhouse gases in the USA and China. And another worrying date is that 30% of fishing reserves are overexploited. In this slide, we can see what are the environmental impacts of different foods. As we can see, the impacts, all the impacts are higher for animal foods, mainly from meat, from ruminants, but also from pork and chicken. They are the higher producer of greenhouse gases, land use, energy use, acidification potential, and eutrophication potential. In this infographic created by a nutritionist from Spain, Aitor Sanchez, we can clearly compare how much more impact has the production of a kilogram of animal protein in comparison to the same amount of vegetal protein. So we need to use 18 more land. We need to use 10 times more water, 9 times more fossil oils, 10 more times pesticides, and 12 more amounts of fertilizers. So meat production from the point of view of environmental impact is not efficient. But what we can see in reality that we see that most of the European budget for the common budget for agricultural policies is dedicated to meat production. So we are growing more animals now than 2 decades ago. So what we can do to reduce the health and environmental impacts of food system? Well, these are the 5 main things we can do. First, global adoption of a plant-based diet. Second, reduce caloric intake, healthy caloric intake to maintain a healthy body mass index, to increase in harvests, to reduce an important reduction in food waste, and to increase efficiency in agriculture. The main intervention is to change this global diet to a more plant-based diet. And this is the health reference diet that has been proposed, which is very similar to the Mediterranean diet and has 5 main characteristics. First, protein source should be primarily from plants. Second, fats must be mainly from unsaturated plant sources, like olive oil. Carbohydrates primarily from whole grains, and less than 5% of energy from sugar. At least 5 servings of fruit and vegetables per day, and moderate their consumption. In this graph, we can see the current food consumption in the world compared to this vertical line, which represents the point of equilibrium for sustainability in 2050 in the world. So we are consuming much more than is sustainable for red meat, for example, starchy vegetables, eggs, poultry, but we are consuming less from vegetal products. So we have to reduce, to be sustainable, the diet in 2050, we have to reduce greater than 50% in global consumption of unhealthy foods, mainly red meat and sugar, and a greater than 100% increase in consumption of healthy foods, mainly vegetables. To do that, following the framework of the World Cancer Research Fund International, the nourishing framework for food policies, we have proposed 5 priority policies for Spain. Regulation of food advertising, food subsidies for vulnerable people. Only in Spain, there are 1 million families suffering from moderate or severe food insecurity now at the moment. Sugary drinks, thus, healthy for food supply in public institutions, and front-of-pack interpretative nutrition labeling is what we call the power of policies. And the good news are that healthy policies are also sustainable. Healthy food policies are also sustainable food policies. They are popular. Most people support those policies, and they are effective, as we can see here with the impact of the sugary drink tax in Catalonia from 2017 that was implemented to now. And in this brilliant paper from published in Science, we can appreciate what is the potential impact of each one of those changes we have to do to reduce impacts in order to limit global warming below the agreements, the Paris agreements. And this is the scenario of this graph is assuming that fuel emissions are reduced to 0 in 2050. So even if fuel emissions are reduced to 0 in 2050, we need to change the food system to reach the agreements of Paris. And the most efficient measure we can take is to change the global food patterns to a plant-based diet. Will reduce almost 50% the emissions. To reduce the intake of calories also has a potential impact, and those are the impact regarding the business as usual, which is the black column. Those are the impact of the different measures that measures have to do with more efficient agriculture.
Sorry, Mr. Royo, you have to finish. 1 minute left. Sorry.
So I am almost in the end. This is the last one.
Okay. Thank you.
We can say that this healthy reference diet is feasible all around the world. Thank you very much.
Thank you very much for this interesting presentation. So our next speaker, our next panelist is Mr. Pedro Albayar. He will talk about neglected diseases, a test for planetary health policies. And Mr. Pedro Albayar is a doctor and investigator. He's a specialist in tropical medicine. He works in the Department for Tropical Neglected Diseases. Tropical neglected diseases, yes, in the World Health Organization. And he is responsible for the control of Chagas disease in the World Health Organization. So, Mrs. Albayar, the floor is yours.
Thank you very much. Let me to speak one paragraph in Catalan. Moltes gràcies. Moltes gràcies. És un privilegi ser aquí i felicitats als organitzadors. Té tot el sentit del món que Andorra, que està en un procés de reflexió únic, és un procés que pocs països estan fent. Ha fet informes dels Objectius de Desenvolupament Sostenible a Nacions Unides, està en una proposta de model de país de salut, desenvolupament sostenible, salut digital. Que sigui Andorra qui ens convoqui avui, aquí i ara. Thank you very much for the invitation. I'm privileged to be here today. And yes, about 3 decades ago, people started to publish things about planetary health. But let me say something. Let me remind something. The concept of Gaia, global village, whatever, as a living intra and interrelated system was part of many indigenous cultures around the planet since the very beginning. So Western society, this model that fragmented the understanding of human beings, especially since the 18th century, putting rational thoughts versus arts, reason versus emotion, has classified and divided this understanding of nature. What we are doing now is trying to recover something that was part of their humanity. In the first half of the 20th century, what we did is to propose an unsustainable model of development, and that just changed everything. Alma Ata, prior to the planetary health for everybody, but even with the Millennium Development Goals, and finally reaching the Sustainable Development Goals, we see a way. Here, when we put health in the center, we see that half of the objectives are risk factors or determinants of health. So neglected tropical diseases or neglected populations in the middle. We are speaking about warming the planet, climate health, but in concrete, in tropical medicine, what we are looking is fire in the Amazon basin, in 9 countries, changing reservoirs, insect vectors, and cycles of diseases, and all determinants, environmental determinants. We are very worried when the World Meteorological Organization is publishing and saying that some parts of the Amazon basin now switch from being synced to a source of carbon. And another very important concept, nature positive. If we stop warming the planet, but we keep reducing nature, we have no future as humans. So this is another important and sometimes forgot piece of the puzzle. We need to not just to keep but recover these natural spaces. And of course for tropical medicine and for humans, that means speaking about reservoirs, about insect vectors, challenge. This relationship between these environmental determinants and diseases has been very well established and mentioned this morning. So when we speak about this group of diseases, 20 diseases or groups of diseases today, they were defined as neglected tropical diseases because we could not say neglected populations. And if we look at the definitions, 7 definitions of what is a neglected tropical disease, you'll see that all of that are health determinants, social determinants, environmental determinants. There are not biomedical definitions here. And we are facing 3 new challenges. Never, there is no any culture prior us that had these challenges. One, of course, Anthropocene. We are producing and generating crises. The second one is the first time that we have more older people than young people in the planet. And of course, we are participating in the 4th technical revolution of the humanity. This is a challenge, yes, but as well is an opportunity. So what we are now facing is a proposal that actually Andorra has participated in the design implementation of this proposal. That starts in 2018, when was discovered that if I treat a girl or a woman of childbearing age, I have no congenital Chagas disease. So when that was discovered, we changed the paradigm from control to elimination. And we have started a work with the Ibero-American General Secretary. It means to see how that could be implemented. Andorra was leading the organization of this summit. And was Andorra that transformed that in a 6-year program to implement a project. And Andorra is one of the countries that is leading, is one of the countries in the world that can achieve first this certification or verification better. So we are speaking about something, neglected tropical disease that actually was defined already in the 90s as a ill house, no ill persons. We are speaking about something related to migrations and health since the very beginning. We are speaking about something that is, we have to detect. How to detect, to do early detection in one person, how to do early detection in a group of population. This is challenging. Detection is not a screening, it's much bigger. Detection is not diagnosis, it's much bigger. To do detection, I have to include all variables, all approach, much beyond biomedical approach. Here you have the underdiagnosis, huge everywhere. And here we have something important, this migration. The challenge is not in the country of origin, it's during trip and arrival. So how we are going to deal with that? This is what Andorra is facing when it's proposing digital health and incorporating e-health records, when it's looking at the world and saying, I have to diagnose any kind of Chagas disease, any kind of neglected tropical disease, including all diversity. When definitely is saying, okay, I have to be part of networks, world networks, because it's the only way of having comparability in time, what I'm doing now to be able to measure, and geographically, to know if what I have is the same of the other half. So working as a network. And here you have a beautiful example in the city of Barcelona. A group of people, a community from Bolivia, that when identifying this opportunity of systematic integration, COVID and Chagas disease, we discovered that determinants, environmental and social determinants of few decades or some decades ago, are the ones that now meet determinants, today determinants. So this group of population have higher prevalence of Chagas disease and higher prevalence of COVID. This proposal worked with the team of Jordi Serrano, putting together dual epidemiology projects. This project in Andorra is proposing to look at prevention of chronic cardiac diseases. I don't care if it's infectious or not. What I care is which are the determinants that actually identify this group of population at risk of. And of course, we have to follow that with an information system that permits us to stop taking photos and monitor, to follow phenomena in time and space. And calling who? Everybody. Everybody, manufacturers, foundations, academy, everybody has to be on board, but starting with the affected population. Here you have 31 associations in 5 countries. We have more associations, organizations of people affected by Chagas disease than countries reporting Chagas disease. So if we work with the affected population, the change is possible. So it means looking at everywhere. Like, for instance, in prisons where you can have a concentrations, or like David told us last summer, you have to go to the ski stations because there you have population at risk. So this is the commitment that Andorra already signed. 194 countries signed a roadmap from 2021-2030 to control, eliminate these diseases. Here we are. We have to switch from multidisciplinary, every crazy with her topic, to interdisciplinary and please, intersectorial. If we don't reach the insectoriality in order to understand that, we cannot reach. But we can. Andorra is already doing. Thank you very much.
Thank you, Mr. Abajar, for this interesting and empowering talk. And thank you to keep to time. So we will move to the next presentation that will be online. So this is a presentation from Luis Augusto Casaña Galvao from Fiocruz, Centro de Relações Internacionais em Saúde. He will present the burden of disease on a disbalanced environment. So Mr. Luis Augusto Casaña is, as I said, from the Center for International Health Relations and the Oswaldo Cruz Foundation, Fiocruz, in Brazil. The foundation offers a great variety of health services, but also focuses on teaching and research. Mr. Casaña has been working in the field of environmental health for the past 3 decades. Mr. Casaña, the floor is yours.
Thank you very much for this invitation. Thank you, Pedro. Thank you, everybody, and Jordi for the preparation. So I'm glad to be here. So this is the challenge to talk after Pedro with all this passion and after Miguel with all these details is a big challenge. So I try to step back a little bit. And so this is the first picture of Earth that was taken in 1950s, so 45 actually, more specifically. And this is all we know about the planet at that time. So it was an important picture because the scientists can see the curvature, some of the problems, and confirm some of the details of the Earth. But not very long after that, we have this other picture that was taken from the moon with much more precise picture and a much more clear understanding of what is our planet, where we are, and what is this about. So during this same period, we also make a big evolution in the understanding and the measurement of everything. And then one of the biggest important fact we now know is we are talking about global change. So when you talk about our planet, we are talking about a planet that's constantly change in several ways. I'm not going to details of this. This is just a nice graph from the University of California Museum of Paleontology, where what I want to say is this red thing here is about the cause of global change. And the yellow part is how the Earth systems work. So anything you are doing out there is affecting how the Earth system works. And the blue part is actually what we can measure, because we cannot measure everything. And the challenge here was to talk about the burden of disease. So what you can measure out of this complex and big system that we can do. We can measure some of the known human causes of global change, like we know when a meteorite impacted the Earth. We know something about solar radiation and others, but we can really measure in very specific details is what are the human cause of global change, because we are the one who are causing it. We are the one to put it out there. So we can measure pollutants, we can measure burning of fossil fuels, population growth, agricultural activities, as Miguel just mentioned that, urbanization, and also the many other aspects of disease we can also measure out of that. One of the measures that was taken by, and this is an interesting article, actually a landmark article from Stephen, and from 2007, he demonstrated that many things after the Industrial Revolution in 1750 was going the same trending. And when you measure the population, when you measure GDP, or water use, or consumptions, or urban population, even McDonald's restaurants, we are going up very fastly. And this is now known as the Great Acceleration. So that was when this global change accelerates very fastly and very rapidly. And together with that, we can measure the CO2 emission, which actually is a greenhouse gas and is the one that is making all this Earth system working in a different way that we want to, and causing all the troubles as you just saw from the presentation. And when we have carbon, you mess with carbon, you mess with the carbon cycle. So it's not only the greenhouse effect, but it's also what is causing in the whole system, in this very integrated system of the Earth. And finally, is also causing problems for health. This is the thing that was already mentioned here, is not only a problem of the whole health system and the whole Earth system, how they are connecting, but we are now living in an area, it's called Anthropocene, the age of man, where we are actually causing problems, and we are now becoming a global geophysical force, which means the things we are doing in our planet is also transforming the planet, which is not something that was really, see before this era we are living after 1750, during the Great Acceleration and all the consequences that have for that. And that is actually what is impacting us, that is actually what we are causing to the planet is coming back to us and causing problems for our health. And that's exactly what we are measuring. Also, the way we contaminate and transform the whole planet is not the same way. We can measure in very specific ways that the contribution each sector can do, are doing for in terms of the CO2 emission and others, any other pollutants that we can actually measure. So we are not talking about, when I talk about the planetary and the Earth system change and the global change, when you go for locally, it's not the same. So you cannot pasteurize and say, oh, the planets change, everything is changing at the same pace and the same way everywhere. No, depends, what, this is just an example in transportation, how is that reflecting here and there? And then you have a different effects also in health. So that's, I want to now stop and talk about some of the measurement and how they are changing after this understanding of where we are and about the global change. One of the very traditional measurement the UNDP have made for many, many decades and changed the whole way we think about development was the Human Development Index, which is a very nice index measuring health and other development important indicators. But what they did is they make a planet pressure adjustment index where they only not measure the traditional Human Development Index, but they measure how much is the footprint of any society to achieve that level of development. And when you see here, you have the traditional Human Development Index. When you add to that the pressure they are doing in the planetary, so you see it's going down. It's going down because there are costs associated with that for the planet, which will influence and slow and make it more complicated for development. Another important measure that was mentioned here is the whole 17 goals agreed under the 2030 agenda. This is an important area, and there are measurements about that. The Institute of Health Metrics and Evaluations from the University of Washington created this interesting visualization tool where you can see here all the greens are the associated directly with SDG 3, which is the health goal, and all the others is the associated with health, but not part of the SDG 3. And they created this index value, which is a reflection of how this is actually contribute for the burden of disease. So this is the Andorra, sorry about that. So, and this is, you can see how good Andorra is doing air pollution. This is one of the map. So finally, I want to touch on another way to measurement and the other way to understand the global burden of disease, which is actually the Planetary Health Lancet Commission, which I think the main conclusion is this: damaging the planet, you damage human health. And this is exactly what we are discussing and reviewing here. So in this regard, you see there are biodiversity, climate change, water use, soil degradation, they are all connect somehow with health. And one of the way to measure this planetary health is actually connecting and discussing the climate change. And this is a very interesting exercise that the Lancet does, which calls the Lancet Countdown. And I do recommend everybody who are interested in following how this planetary health are following and how this is impacting and what is the global burden of disease of planetary health and climate change. You can see here they have this impact and exposure, the adaptation, the mitigation, the economic and finance impact, and public and political engagement. So you can, all the measurements are here. So, but what's the thing? The thing is that we need to think globally, but we need to act locally. And to act locally, we need to have some kind of guides, some kind of reflections. And this is some examples that I participate particularly directly. This is the book I organized by the time I was actually in Paro. This is a very recent publication from the Lancet Commission on COVID-19, where we discuss the transformation of recovery into a green victory. And this is the UN research roadmap for the COVID-19 recovery. So just an example, there are many, many other guides, but the idea here is actually taking this opportunity of the recovering from this dramatic thing that happened to us, the pandemic of COVID-19, and the protect Gaia. This is one figure we create when we commemorated the World Health Day on climate change at PAHO, and this is as a figure like protecting or Pachamama. That was this is from the Americas region, is the indigenous figure, and you can see you need to think globally to protect it, but you need to act locally. This is all locally things in the. And with that picture, I end, and I thank you again very much for this opportunity.
So thank you very much for this presentation, and we will move to the next speaker. So here we have Mrs. Patricia Ripoll. So she will talk about the impact of air quality on human and planetary health. Patricia Ripoll is from IREAMOS project and COVID Warriors Association. IREAMOS brings together various entities and people with a big common goal to determine CO2 levels in closed spaces in order to deliver healthy environments, not only to control the spread of COVID-19, but to prevent many other diseases. COVID Warriors is a non-profit set up to fight the COVID-19 pandemic from different perspectives and disciplines. So thank you for being here, and you have, the floor is yours.
Thank you. First of all, gràcies als organitzadors, al govern d'Andorra, al doctor Jordi Serrano Pons, al SAS i a tots els col·laboradors per deixar-nos un espai per poder parlar d'aquests temes, donar-nos l'oportunitat de visibilitzar aquest projecte que hem portat a terme i, sobretot, per deixar un espai per la divulgació científica. Okay, let's go in English. Well, since the 19th century, we were talking about air and insalubrity. This picture is from the 19th century, and it's talking about, as you can read, la première chose qu'elle importe de ne pas oublier, c'est que si l'air est le premier, comme le plus indispensable besoin de l'existence, il devient aussi un poison permanent par son insalubrité. This means more or less that the first thing that it's important not to forget is that the air is the first and the most indispensable need of existence. And it's also become a permanent poison by its insalubrity. Then I think we were talking since many years ago. We have a lot of literature talking about this important thing. We don't have to forget that if the air, we can see here in this book called L'air, effet de son impurité sur la santé, we can see that the air effects of its impurity on health, if we close the door, the air will be stale, without renewal. A stale air that makes our function look disturbed. Then we have a lot of literature also about this air effect and about the architecture. The origin about our architecture, as we actually know, it's this, because we are always improving the architecture, do it by our health, because we want to improve our health and we want to change the paradigm. And I love this sentence that is saying to breathe is to live, to exhale is to die. I think it's very, very clear. Then air is the first factor of healthiness. This is why we can see that this is Boston. They move the classes outdoor because they want to have a clean air. This is also in New York. And look what they say. They say we should do, if we want to be alive, if we want to be healthy, we have to move outdoor. They were only looking for a clean air. then I think it's something very clear. We made some years ago, and Mark Pons was also talking about this morning. Then, if we know this, why during the COVID we didn't talk about the air and the importance of the air transmission? Aerosol scientists, healthcare workers, and other allies were saying, and let me say, probably shouting, that COVID is airborne. But it seems that at the beginning, or more or less 1 year or a little bit more, the world goes in another direction. We didn't understand why. We have to demonstrate something that we have seen, that it was new, but everyone, and demonstrate again something that we already have done in the past. Then we demonstrate with this publication in Lancet Nature that COVID is airborne, okay, and COVID is in the air. Because let me show how it works. Transmission is like you can see in these pictures. It's like the smoke of a cigarette. If we are outside, you will not or less detect this smoke. But if you are in a shared room, like here, then with if you are more time in the shared room and you have a low ventilation, then the infection will become. Then for probably sure that you are going to be infected. Because we say this morning also, I think some of the people were commenting this, but we spend more than 90% of our time indoors. But how often we think about the quality of air we are breathing? Do you know that the air in the buildings we frequent can be up to 5 times more polluted than the outside air? The indoor quality broadly refers to environmental characteristics, inside buildings that may affect human health, comfort, and work performance. This morning, they show this picture also, okay, and this is a picture from the Strategic Plan for Health and Environment from 2022 to 2026. Elena has shown this morning, and this plan emphasizes in the indoor air quality of buildings and the impact on this in the people's health. We have a lot of studies proving this, proving the idea that measuring how various particles move through the air and controlling 3 variables, as we can see here, ventilation, filtration, and humidity. If we increase these 3 variables, we'll be clearly more protected, okay? In the studies we have seen, we have that if we increase filtration and ventilation, we significantly reduce the viral loads in the air and only in surface. And if we increase the humidity, it's also better for the surface. Then it's clear. It's clear that to improve the air quality, we must increase the clean air to reduce the number of people with the capacity to be infected. And this is why in Aireamos, we were asking for a lot of times to monitoring the CO2 to improve this air quality. We are promoting a standard UNE for making this real. We know that effective measurement of quality indoor reduce the health risk associated with poor indoor air, creating a safer and more harmonious environment for people to thrive. The typical symptoms, if you are sharing a poor air quality, is the eyes, nose, throat irritation, headache, nausea, dizziness, and also fatigue. This is why it's very important to have a good air quality. A poor indoor air quality in the workplace also contribute to decrease the productivity, absenteeism, and even possible litigations. By effectively monitoring of the indoor air quality, employers are able to ensure workers, and we can assure healthier spaces and free from other potentiality chemicals and pollutants. As a result of this, employers report higher retention levels, increase the productivity, and we reduce absenteeism. Thanks to the measurement, we can know the level of ventilation, so we can know if we are increasing this clean air in our space. And another thing that Clara says this morning, it's the data empowers citizens and enables to have objective decision making. Then with this small monitoring CO2 under 200 euros, you are able to know if it's something it's safe or unsafe very quickly. Then it's clear what we are asking and what we are working for. It's for to have a real-time indication of ventilation everywhere. The evidence show, and here I put the article, that prolonged exposure to high CO2 values can pose direct effects on the human health. You can see it's inflammation, reduced cognitive ability, bone demineralization, kidney calcification, oxidative stress, and also endothelial dysfunction. But these effects can occur with exposure to lower values on a recurring basis, values that occur in too many interior places. Recent studies suggest that CO2 has an impact on the cognitive function, performance of the office workers, and concentration previously thought that it was benign, like 1,000 to 2,000. Okay. Because we know and we have demonstrated that good occupational health is a good business. We can include in direct and indirect costs, like higher labor productivity, and we have shown in several studies. We can also improve learning activities. We can have lower absenteeism, and finally, but not least, reduction of healthcare costs. But I think this is a good business, no? I think we have shown that it's something that we can afford, but it's more than this. It's not only about business, it's very important, but it's about our health. Then why we don't do it quickly? And this is the traffic light that I want you to remember, and to remember this number like a post-it number. It's the maximum exposure to CO2 levels in a shared space, okay, to prevent this infection. Because if you are sharing a space with more than 700 ppm and someone is infected, you are increasing the risk of being infected too. And finally, we are now in front of a new paradigm with the air quality. We are in front of giving the same importance as the system that ensure the safety of water and food. Because pollution and air quality is an objective to work on if we want to ensure a better world. And for this reason, we will work in the areas of health, well-being of people, as well as the planet. Thank you very much.
Thank you very much for your presentation. I think that would be very useful, no, in this new paradigm or this new approach to building zero consumption buildings.
Yeah, thank you.
So very interesting. And we will move to the last of our presentations, of the last presentation of this roundtable. This talk would be from Mrs. Irene Corbella, who is the head of Environmental Health and Public Health Agency of Catalonia. Mrs. Corbella's speech was recorded in advance as she was unable to join us today. So we can start the video if you like.
Hello. I would like to thank the Government of Andorra and the event organisers for inviting me to this international conference on planetary health. Today I will be explaining the policies of the Catalan Public Health Agency in the area of environmental health for a healthier planet. The agency also strives to improve environment-related health factors. We know these factors contribute around 20% to mortality and 20% to morbidity, so it is important to try to improve the quality of our water, air, chemical products, and so on. The Public Health Interdepartmental and Intersectorial Plan, promoted by the Ministry of Health and the Government of Catalonia, covers priority areas, including the environment and especially climate change. It is a very important instrument in promoting health across all policies. The recently updated Health Plan of Catalonia also addresses climate change, environmental pollution, and people-based settings and their health priorities, delivering an approach to health that reaches beyond absence of disease. It is another important instrument, especially in providing this working insight into One Health and planetary health. Particular measures and actions in the water area include oversight and control of water for human consumption, where we focus increasingly on evaluating and managing risks to ensure the quality of the water based on the methodology of the water health plans of the World Health Organization. We also oversee emerging compounds such as endocrine disruptors, disinfection subproducts and PFCs, and inform the population of the quality of the water and warn them of the risks when levels of certain compounds are exceeded. Particular measures and actions in the water area include oversight and control of water for human consumption, where we focus increasingly on evaluating and managing risks to ensure the quality of the water based on the methodology of the water health plans of the World Health Organization. We also oversee emerging compounds such as endocrine disruptors, disinfection subproducts and PFCs, and inform the population of the quality of the water and warn them of the risks when levels of certain compounds are exceeded. Another important area involves the use of reclaimed wastewater. City councils and the Catalan Water Agency promote the maximum use of this water to aid the circular economy and preserve resources. The agency's role is mainly to establish health criteria in accordance with uses, farming, city street cleaning, etc., as well as risk evaluation and management around emerging compounds, antimicrobial resistance, and so on. There are two main plans, the Drought Contingency Plan and the Catalonia River Basin Management and Action Plan as instruments of adaptation to climate change. With regard to air, the agency mainly focuses on providing information to the public to reduce exposure to atmospheric pollutants. The Ministry of Climate Change is responsible for promoting plans to improve air quality and reduce pollutants. The main problems in this area in Catalonia concern exceeding particulate limits. Problem has been growing in recent years, so general recommendations for the public are important. For example, exercising outdoors at less polluted times and places. But special recommendations are also needed for times when thresholds are exceeded. We have messages on our website for the general public and vulnerable groups with warnings and preliminary warnings of these thresholds being exceeded. Outreach is via city councils, the emergency services, primary health centres, etc. Of note is the new plan for the improvement of air quality in Catalonia and the third summit on air quality that was held a few weeks ago, where we set out the commitments of the different government authorities and agencies involved in improving air quality. In the area of vectors and arboviruses, of note is the significant increase in the incidence of dengue, both globally in recent decades and in Catalonia in recent years, where we have had a rise, in fact the appearance of the first cases of dengue, and an increase in the circulation of West Nile virus, which was detected in horses and mosquitoes for the first time. Besides the common native mosquito, which is able to transmit West Nile virus, we have now had the tiger mosquito for a number of years, which can infect people with dengue, chikungunya, and Zika. The agency has implemented different actions aimed at preventing cases and outbreaks of these diseases and reducing the circulation and transmission of the viruses. We concentrate on minimizing the presence of mosquitoes, avoiding them stinging people, and so on. We have a strategy to prevent and control the tiger mosquito in Catalonia, standard bylaws to help city councils promote prevention measures, public information, oversight of the distribution of the tiger mosquito to predict which areas it is colonizing, and instruments like the protocols for the oversight and control of mosquito-borne arboviruses in Catalonia, as well as a dedicated one for West Nile fever. We also have a table of responses according to the level of risk of transmission of disease. This is a clear example of taking a One Health approach, human oversight and animal and environmental health engaging together. To that end, we set up the Interinstitutional Committee for the Prevention and Control of Mosquito Vectors to step up to and coordinate all these actions. With regard to chemical products, I would mention two actions. One, the oversight projects of harmonised inspection by all EU member states promoted by the European Chemicals Agency to verify the main regulations on chemical products and which affect health. These include REACH, CLP and biocides. I would particularly mention the ones that make it possible to oversee the ban on the sale of substances that pose a health or environmental risk, and this year's REC checking on phthalates in toys, lead and nickel in jewelleries.
O aquest darrer que s'està portant a terme aquest any, no, de control, per exemple, de ftalats en joguines, plom i níquel en joies, etc.
The other action is the pesticide control program in manufacturers, marketers and pesticide firms to promote comprehensive pest control, where we promote physical, mechanical and biological methods in lieu of chemical ones.
Abans que els químics per fer els tractaments, per fer el control de plagues. També tenint aquesta doble visió de les plagues i els plaguicides.
We also take a two-pronged approach to pests and pesticides. Pests as elements and potential vectors of health problems, and pesticides for their intrinsic biocide properties for the risks they can entail for human health. Therefore, with regard to chemical products, we promote prioritising the production, sale and use of products that are less dangerous for our health and the environment and the circular economy of chemical products.
I promovent així també l'economia circular dels productes químics. I finalment destacar...
Finally, I would mention the Public Health Programme for Climate Change promoted by the Ministry of Health to coordinate and further promote actions to deliver on climate change that covers everything related to the evolution and impact of climate change on health and the identification of vulnerable groups and areas with health and disease burden indicators that include the different sections and plans underway and the promotion of new ones in their evaluation, all in coordination with the Office for Climate Change at the Ministry of Climate Change Action, the Catalan strategy for climate change adaptation, and Catalan and Spanish laws on climate change, along with the WHO, the IPCC, research institutes, etc.
Cooperació amb l'Oficina de Canvi Climàtic del Departament d'Acció Climàtica, l'Estratègia Catalana d'Adaptació, els plans de mitigació.
I would like to end with some final considerations and challenges. We need to apply a One Health focus across all policies to deliver on environment-related emerging health problems such as arboviruses, urban development, air quality and droughts.
La necessitat que penso que cal donar-hi a aplicar els enfocaments One Health i de salut en totes les polítiques per fer front als problemes de salut emergents relacionats amb el medi, arbovirosis, urbanisme, qualitat de l'aire i de l'aigua, sequeres, etc. D'altra banda,
there is also scientific evidence of the interdependence between climate, biodiversity and people. It is important to promote public health plans and programs, given the climate emergency, but also to improve adaptation actions and for public health and healthcare professionals to consider human health as part of planetary health.
I també voldria fer èmfasis en que estem veient una tendència a augmentar en les desigualtats en l'àmbit de la salut ambiental.
Finally, I would mention the increasing trend toward environmental health inequality in relation to housing, energy poverty, air and noise pollution, access to green areas and more. It is important to consider this when we draw up policies to foster planetary health. Thank you.
Well, Mrs. Corbella can hear us, but we thank her for this interesting presentation. No, I think that this is the global overview of the policies they are implementing in Catalonia, and the last conclusions, relating, putting in the interconnections of the biodiversity, climate change, quality of air, waste, pollution, chemicals. So I think we have finished this. We have finished the presentations on the round table. I think they have been 5 fantastic presentations, and now we have to open the turn to questions. No? Well, we will start with the room. If there's any question here, yeah.
Hello, it's Deborah Thompson from One Health Lessons. I had a question for Patricia. With the canary in the coal mine, animals are sentinels for diseases, for really terrible pollutants. Hopefully you understood that part. Okay. Canary in the coal mine, animals can be sentinels for diseases and conditions, health conditions that will affect human over time. So I'm just curious, from your experience, how easy or difficult is it to include the people from the animal health sector and have those conversations so that we can protect people and animals all at once?
It's not easy. It's not easy because as we were talking just a few minutes before we start, they are 2 worlds working in the same area, but they didn't exchange the information. Then it's not easy. But I think if we work in divulgation, as you have the same activities, okay, probably doing something like this, it's going to approach all the visions, because I think it's better to have a teamwork, to work like we and not like me. Then I think doctors can learn a lot in the veterinary world and in the other way. Yeah.
Thank you, Patricia. There's any other question? No? No questions?
Any?
which is the feedback of this IRIAMOS project, and also if the governments and if the schools or the educational centers, do you think that are conscious about the importance of analyze the CO2 air or CO2 components of the closed spaces? I don't know if maybe this project is developing more to raise this awareness about these issues.
Yeah, we made some steps. We can say it probably it's understand like it's small steps, but analyzing 2 years after, okay, I think we made big steps because at the initial, the WHO wasn't saying about COVID is airborne, and now he's saying this. Then I think it's a big step. Also, we are working with governments to change the rules. Okay, in Andorra, for example, they made a pilot and they were testing how to improve this air quality by measuring and monitoring CO2 in the schools. Then I think it's a very, very good improvement. Okay, but I think we have to go further and all be responsible of that. This is why I show the small monitor CO2, because I think it's something that if everyone is making this monitoring, it's going to be better. We are going to achieve our results before. Okay, and this is why also we are working in a standard unit to make this obligatory, let me say, because we think it's the only way to achieve. But we were working with also with the, we were trying to work with the Spain government. Okay, we sent a letter. Also in the White House, we've been received to talk about this. Then we are making IRIAMOS International also. Then I think we have made a lot of steps, but I think we have to still working on. Thank you. You're welcome.
Thank you. Here in Andorra, there's an association for indoor quality.
Yeah.
And so we have been a long time ago with the Department of Environment and with also the collaboration of the Health Ministry. We done these pilots, and we shared some information, and so,
yes.
Very interesting.
Congrats.
Yes. So if that's sorry. Sorry, yes, Jordi, please.
Miguel Ángel, thank you very much for your intervention. No? You talk about that the public health, I don't know if you refer campaigns or policies, health food policies, no, are paid off. No, I remember a nice law, one of the few nice laws in Hungarian government years ago, no, about the sugar drinks. You remember that? And how it stimulated, no, the lower of sugar in the drinks. Actually, the minister that developed that law then was very famous and almost compete with Tedros, no, as president, as director of WHO. And also, I remember implementation policy in the United Kingdom, where they agree with the manufacturers companies that develop sugar drinks to postpone 1 year implementation of a lower sugar quantity law, in exchange that all the manufacturers really develop a program with a mobile app, digital health, to make parents go with children to buy together and to recognize the number of the sugar quantity with cups of sugar for children. It was one of the few successes histories in public health with digital. 9 million of apps download by people, no, in that sense, to reduce sugar. No? So in that sense, you said it pays off, no, to change these things. Can you explain us a little bit, if you have some opinion, why it's not extended, why it's so difficult for governments to compete or to combat or to change some laws, no, in these aspects? Thank you, Miguel Ángel. We don't listen to you.
Sorry. Thank you, Jordi. Some of these sugary drink taxes are depending on the level of sugar of the drinks. So the objective is also to stimulate reformulation by the industry, and to not only to reduce consumption by the impact of the increasing prices, but also to promote reformulation and consumption of less unhealthy foods and drinks. There are the reports that we have regarding implementation of food policies are saying that this implementation is low. For example, probably taxes are one of the most frequently implemented measure in the world. There are more than 50 countries already with a sugary drink tax, but subsidies for consuming fruit and vegetables are much less implemented. For example, only 3 countries in Europe are at this moment giving vulnerable people bonus or subsidies to buy healthy foods. Here, the problem is an economic problem, no? Because this implies a lot of budget, no? Mainly if you have many people, like now in Spain, I said before, there are 1 million families suffering from moderate or severe insecurity in Spain. So it's a lot of money. Other policies, like policies regarding stricter regulation of food advertising, are not implemented because there is a strong opposition from private interests, from not only from food industry, but also from communication industry, even from other industries like advertisement industry or even export industry that are benefiting from this kind of food advertising. And other policies like improving the offer of health products in public space are also advancing, but not so fast. Now in Spain, there are many regional governments that are implementing new regulations to secure that all the foods, for example, in the schools or in health centers, health facilities have a good nutritional profile. But normally regulation, legislation takes a lot of time. For example, the regulation of health and nutrition claims in Europe in 2006, or the law of nutrition in Spain in 2011, talking about health nutritional profiles and regulation of health claims. And we are in 2022 still waiting for the implementation of those regulations. In fact, only in 2021, after France, Belgium, and Germany implemented Nutri-Score, is that Commission European had decided to advance in nutritional profiles, which was an commitment from the regulation of health regulation in 2006. So there are many factors that are, let's say, delaying the implementation of those policies, food policies.
Thank you.
Can I make a question to Dr. Galvão?
Of course. Yes. Go ahead.
I mean, it's a privilege to have Dr. Galvão here. He's one of the fathers of this thinking, this understanding. I have a simple question, a challenging one. I'm seeing in a lot of our discussions and sessions 2 words that are repeating. One is how to empower actors, people that has been left behind, how to empower and to bring together. Another word that is repeating a lot is interoperability. How we can increase interoperability among the different specialities, among the different professionals. We claim that the informatics, the softwares have to have full interoperability, but we are asking that for systems, while we human beings are lacking interoperability. So from your perspective, of some decades and as a pioneer, how do you see the evolution of empowerment and interoperability of actors, and which are your recommendations to move forward in that?
Thank you, Pedro. Thank you very much for your question. It's a pleasure to be with you. Pedro is one of the biggest minds in interoperability. So he is actually promoting and empowering very much, the solution of Chagas disease, for instance, but all the neglected disease. So I think if you want to look in a very good example, and that which I admire very much, is the one that Pedro is I think empowerment is an essential part of the act locally. So since the Brooklyn Commission, we know that we need to think globally, but the solutions is always locally. So what you see today here, for examples from Andorra and others, so the whole conference, Elena also talked about that on the inauguration. So this is a very good examples on how to act locally and empower communities, empower the civil society. That's essential part of the solution. And we know a lot of things today. We have very good measurements of many things, but we're not advancing in the same pacing. And one of the problems in advancing is because who need to be empowered are not totally empowered. So I think this call from Andorra is very important. What you show, I didn't know about that initiative from Andorra, is very, very important for this. And that is one of the biggest challenges. Interoperability is a problem because normally when you talk about that and they say, let's do something intersectorial, and you call all sectors to sit together, and if make that is complicated because the whole system is designed in silos, is designed in distributing money among people, and the people see each other a little bit as competitors. So it's not easy to put together. One way I know we have advanced more is when you establish the win-win solution, when you look into common ground of all the sectors. Instead of looking for a common activity, looking for what is a common ground for that. And that's the higher level of all governments, and not only public government, but the governments of the industry also, and the government of civil society also. If they agree in some bigger objectives, everybody working towards that one, meaning, better food production, better access to better food, and now advertisement for children, which is something we have see there are problems there. So if agreeing some of these things together, we can advance. More agreeing in higher objectives than trying to implement solutions among sector, which sometimes is not so productive as we want. And locally, so locally, everything locally is always integrated. So when you go for a very local health unit, they are all integrated there because there are only one people for all that. So thank you very much for your question, Pedro.
So thank you very much And thank you very much for your question too. So one question for you, Mr. Abayar, no? So there has been one question for every panelist. So we'd like to ask you, how do you think the planetary health policies, if we can say like that, which would be the effect on neglected diseases? That would be, what do you think if?
Yeah, no, definitely. I mean, that was clear as well during the COVID. Yeah, these determinants of health affect as a priority group always the groups of people with less resources. We are very worried today. There is now a concentration of wealthy. And we have more inequity. We have increased determinants, environmental determinants and social determinants. We increase the challenge definitely now, and definitely when we increase the challenge, and I'm thinking in these studies we did even before COVID, yeah, and these populations that are accumulating environmental challenges at country of origin during the trip, when they arrive at the country where they are working now. So we can change that. It was demonstrated that we can act. So definitely, I mean, the future is better communication among us, and to share more real concrete projects where we can show that that is possible. And definitely neglected tropical diseases, that was one of the ideas of Jordi, very good one, is a kind of indicator. At the end of the day, to have neglected populations means that we have a problem with access, a problem with dealing with all determinants of health. In a way, we can say that neglected populations, neglected tropical diseases, in a way, is a kind of indicator of how good we are moving ahead. And I want to finish with one concept. We don't spend in health. We invest in our societies. And this change of mind is very important. To let people behind to this unsustainable way of moving ahead is going nowhere. So, and we have the knowledge, so we have the instruments. So I think here we have the challenges, and at the same time the reason, the leitmotif to keep going on despite all challenges.
Thank you very much. Well, with this question and this answer, we will finish this roundtable, this very interesting roundtable. I will thank you, all the panelists. That has been very, very interesting. And
thank you.
We will.
Thank you very much. In theory, we should do a summary, no? But we are very, very late, and we have to go on with other roundtables. So we'll move forward, and we thank everybody. Some of you will participate tomorrow in the debate, in the final conclusions, no? I know that to be wise, you have to be long, but tomorrow there will be a concourse of just having 1 minute per person, and so you can start practicing, so you have only 1 minute. Thank you very much, and we go for the next roundtable. Thank you.
Thank you very much.
Pleasure.
So now we are launching for outside because we're gonna make some movements, and okay, we're gonna start soon the third roundtable. So we have to add 2 more seats here.
Ui, per què hem de veure això?
Sí. Però un segon. Comença a presentar-la un segon.
A què?
Tinc que veure si han ficat una diapositiva bona. aquí. Thank you.
Miro cap aquí, també? Però jo miro cap allà, o sigui...
Aguanta-la aquí.
Okay, so welcome everybody. We move on the roundtable 3 entitled The Opportunity for Digital Planetary Health. We live in a digital era, but not all the countries have the same opportunities and resources. Moreover, the pandemic has accelerated this digitalization progress, this digitalization process also, and here we have a big opportunity to develop strategies and to develop research projects. In this roundtable, under the moderation of Aline Noizet from Digital Health Connector and IS Global, we'll hear from Stefan Budigiek from the European Public Health Association, Jordi Serrano, my colleague and our Master of Ceremony, that on this occasion he will take the role of a speaker, Anish Shindor, a mentor of EIT Health and investor in digital health, also Alberto Balló from the Polytechnic University of Catalonia, and Alfonso Valencia from the Barcelona Supercomputing Center.
Thank you, Laura. As you remember, we have always this small video to remind you what are we talking about. It seems that it's not still coming, so... We will talk about digitalization of hospitals, homes, try not to go to hospitals, waste, digitalization of the processes of the waste. There are huge opportunities. So we leave the floor to Aline Noizet. Thank you very much, Aline.
Thank you very much. Good afternoon, everybody. I hope that you had a very good day so far. It was really packed with very, very interesting content. But bear with us, because that session you don't want to miss. I'm accompanied by amazing speakers, so you want to really stay till the end. So as we mentioned before, the pandemic has accelerated the use of digital tools and made it possible for digitalization to reach like the different parts of the planet, being through like telemedicine, digital treatment, access, if you think about drones that were able to bring vaccine to people in remote areas, or even data. So Clara mentioned that a bit this morning, like for instance in Barcelona, when they developed an algorithm to predict the people who develop like severe cases of COVID. So in that roundtable this afternoon, we're gonna discuss the opportunity that digital can actually offer us to achieve the best value-based healthcare. So this is a concept that we've been discussing a lot those past years, so really focusing on the patient, on the people, and what matters to them, so really thinking about outcomes. But we have also to keep in mind the sustainability. That's something that we're gonna also discuss in that panel, and try not to leave people behind, maybe because they don't have access to digital tools, or maybe they don't know how to use it. So really to keep that in mind. So that panel will give us the opportunity to discuss how digitalization and digital tools can contribute to the challenge of planetary health. So it's my pleasure to welcome our panelists this afternoon, and we're gonna start with Alfonso, who is online with us. Alfonso, good afternoon. So Alfonso Valencia is a research professor at ICREA. He's also the Life Science Department Director of the Barcelona Supercomputing Center, the Director of the Spanish National Bioinformatics Institute, and the head of the Spanish node of Elixir. And he will tell us more about research data infrastructure applied to planetary health. So Alfonso, all yours. You've got 10 minutes.
Thank you very much. Thanks for the introduction, and thanks for the invitation. What I'm going to do in the next 10 minutes is trying to give you very general idea of the efforts in Europe to put together data in a way that we can do progress in the analysis of the relations between the environment and the diseases. It is I try to do this without going into technical details, and just to give you, I would say, a positive view of the efforts that the European Commission and the European governments are doing in this area, and in good part, I would say, promoted by the situation with epidemic, with COVID, that has made all of us aware of the need of being able to access data if we want to be able to prevent future situations like the one we have. So let me share my screen to show you some slides. So it's in presentation mode. So first, let me just very briefly introduce the Barcelona Supercomputing Center. This is a national facility funded by the Spanish, the Catalan government, and the University Polytechnic of Catalonia. We are hosting a very large computer, Maelstrom 4, and then waiting to install this year Maelstrom 5. That will be one of the three large computers that will be operating in Europe starting this year. As a research institute and a national facility, we are involved in many projects that are dealing with, in my case, in the Department of Life, with health data at the European and Spanish level. And this is what I'm going to describe in the next few minutes. So first is a situation that you surely know. We are dealing with a very complex situation at the level of health data and the level of biodiversity data. Complex situation because this data is growing very fast. Probably the data in this bio area is the fast growing type of data worldwide. If it is not the largest one, it is the fast growing one. But this data is very heterogeneous. You see this in the pictures, very different type of data with very different structure and very different origins. Many of these data are produced by small producers. That put us in a very difficult situation with respect to other areas like high energy physics. The data is very noisy because it's associated to biological experiments, the origin of the samples, the origin of the experiments, and everything makes the data noisy. It's very complex, meaning that to interpret the data, you really need to understand the biology, the origin of the data, the origin of the experiments, and the data is interlinked. In reality, to understand diseases or the relation of diseases with drugs or relation of diseases with the environment, you really need to understand the relation between the different data types. So a complex situation, difficult data, a lot of data growing very fast. The response to that is the creation of European infrastructures to deal with the data. In the case of the biological data, this is Elixir. This is an international consortium between all the European countries, almost with, I guess, one exception, trying to organize the data, to make this data interoperable, to develop the tools and the compute systems that will allow us to do this, to use this data in a proper way. And this included all kinds of data. The examples here are marine data, from biodiversity, rare diseases, human data, plants, and many others. I think it's important to think that the different countries are developed at very different levels in this area. So good part of the effort of Elixir is also to create capacity in the different countries to put them at the level that they can benefit and use this data and also contribute to the analysis of the data. It's a federated structure, so each one of the countries has their own instance of Elixir. So there is a Spanish Elixir node that we host in the Barcelona Supercomputing Center in Barcelona, and is again a distributed structure with many different nodes in the country. What is this? What we use this infrastructure for? One of the examples, I would say one of the best examples, is the project of the 1 million genomes, beyond 1 million genomes. This is an agreement between 23 European countries to share medical data and genomic data for 1 million genomes. This has started a number of years, and we are now in a critical point, 2022, where the infrastructure has been developed, there's a trust framework developed, the data is there, and there is the governance. So the project is in a mature phase. By 2027 is where all this will have to be completed. And I think this is pretty relevant because, as we know, the difficulties for sharing data in these areas, the decision of the countries to be able to do that and to create the infrastructure to make this possible, I would say is quite relevant. This, how this is done, I'm not going to go into technical details, but I have two very important components to be able to do that. One is the construction of a federated structure that allows us to share the data without moving the data that cannot be moved outside the countries. This is medical and genomic data, but they still do this analysis across the different countries and different borders. And this is the structure of the federated DGA, the European Genome Phenome Archive, that is already in operations in Finland, Germany, Norway, Spain, and Sweden. The other component, and just to give you an idea that this is real, these are hospitals in Barcelona operating something that is called Beacon, product of the Global Alliance, that allows them to explore what is the information in the other hospitals. And this is a practical course this winter, in which they will using this structure of this software of the beacons to explore information in the different hospitals without the need of moving the information from one place to the other. So this is real. The 1 million genome project is working based on this basis of the federated DGA and beacons. This is the European infrastructure. This has a translation to the countries. This is the impact project. This is a research project financed by the Instituto de Salud Carlos III, the Spanish institution financing health-related research. And this is the implementation of the first implementation of the infrastructure to be able to do genomic analysis. This means a doctor being able to recommend the analysis of genomic information for the patient, being able to get the samples, do the analysis, the genomic analysis, and give back the data to the results of the analysis to the doctors. All this obviously is a data generated data problem, data infrastructure. This is what we are coordinating at the Barcelona Supercomputing Center, what is called impact data, handling this genomic, medical image data, integrating the data, and providing the means, the technical means to do this analysis and do this in a distributed way, in a way that we cover all the medical systems in the country. Obviously, this is not something that we are doing only in Spain. Almost every European country is doing that. I have here the example of Switzerland, 3 different cantons with their own regulations and different security levels and to a large extent different regulations that are able to share data and to analyze data collectively using a federated type of a structure that allows them to maintain the data in each one of the cantons at the same time that they can share the data. So just to give an idea that this type of infrastructure is common, implemented in different ways, but with a lot of things in common between different countries. We are even progressing further. All this progress of the 1 million genomes is now mature enough to be translated to the countries. So this is a new project that will be launched in a few months, in which the recommendations, infrastructure, standards, methods, all what has been developed at the level of the 1 million genomes is going to be translated to the research environments, in this case to the impact environment in the different countries. In the case of Spain, impact. In the case of Switzerland, the corresponding infrastructure. So we have created not only an environment to be able to share data at the European level, but we are progressing in doing this in a similar way in the different countries, in a way that we are building the basis for sharing genomic data and medical data inside the countries and across the countries. So in a sense, all this, if I want to summarize this, mean that despite the difficulties, despite the complexity of the data, and despite the legal problems and associated to obviously ethical problems of the need to keep confidential the genomic and the medical information, we have done progress at the technical level that are robust enough to be able to share this information across using these federated structures in Europe or inside the countries or between the different countries. This is embedded in a larger
Alfonso, we
framework.
need to wrap up, please.
That's my last slide. In the European health data space, that is the European framework to do that, and the two examples here are the 1 million genomes as the demonstration of the infrastructure to work in this European health data space. So a strong movement to share health data across Europe, political and technological support to overcome the national institutional barriers, examples, Elixir and 1 million genomes, ongoing efforts to do these implementations at European and the national level, the impact in the case of Spain, and a technology that in this case is demonstrated for genomic data or medical data, but obviously can be extrapolated to other areas of data, for example, ecology. Thank you.
Thank you very much, Alfonso. So now our next presenter will be Stefan. So Stefan Buttigieg. Dr. Stefan Buttigieg is coming from Malta. He's a specialist in public health medicine with an avid interest in clinical informatics, social media, and digital health. He currently lectures at the University of Malta Faculty of Health Science on the topics of digital health and social media in healthcare. He's also an author, tutor, and digital health consultant focused on creating transformative and effective change. Within the World Federation of Public Health Association Governing Council, he represents the voices of students and young professionals in public health and is the vice president on the EU PHS sections on digital health. And he will tell us more about how to apply digital transformation of public health on small states and remote areas.
Great.
All yours.
Thank you. So, first thing, everyone stand up. Come on, you've been sitting down for more than an hour. Let's kick that off first. Stand up, shake a bit, get moving, turn around a bit. All right, turn around. And maybe like this, I've improved your head by at least 1 day of life. Great, great. So let's get started. Sit down and relax. Okay, so you see, you don't, the mood is already better, you know? No, so this is the public head. And this is my story. As you can see, I wear a couple of hats. I work at the university, but the one which literally brings, you know, pays the bills is my job at the Ministry for Health, where just recently I was part of the data management team of the COVID-19 public health response. But as you can see, we're moving on. And I'm hoping that I'll be working more on health data and digital health on a national level. So, just to get you involved on Twitter, you can find me on Twitter with those usernames, and make sure that you include this very important hashtag Planetary Health Andorra, and make sure that you also follow their Twitter profile. Quite interesting. So, digital public health. Is it just about technology? I think it's much more than that. It's about problem solving, bigger picture thinking, behavior change, resilience. We saw it well enough during the pandemic. And I think that we need to focus on a paradigm shift. And this is not just in my presentation, but we've started hearing it in previous presentations as well. And we need to look at a stage where we don't say digital public health, its specialty, but just public health. That's totally normal. That the digital aspect is fully integrated within public health. It's normal. You nearly don't see it there. But it's so integrated within the operations that it's part of it. That's what we need to aim for. But in order to go there, we need to have a bit like a reminder of the digital health ecosystem. And I had the opportunity to do this. And I want you to keep this picture in mind, that when we are doing digital public health, we have all these different technologies available for us to take forward. and to help us reach our public health objectives. So I came here like talking about small states and remote areas, but I want you to have a look a bit at what were the big wins of the COVID-19 pandemic. Mobile apps were definitely a big win. Excellent, great-looking apps for public health. We didn't used to dream of this before, but now we have beautiful-looking apps appealing to the eyes, which were distributed across a whole nation. Maybe not the whole, like not the full population percentage, but let's say to a high percentage, to a high outcome. We've also seen operational changes. You know, Clara mentioned this before, and data science and data flows, bringing all of this together and making sense. Even in Malta, for example, having a COVID result submission portal, that result goes to the track and trace system, creates a case, you have all the operational flow in place. Systems and processes that previously were done manually now are being automated. It makes a huge difference. It saves time and makes us focus more on the data quality rather than the data management. But back to the topic. What do we understand by small states and remote areas? We're looking at countries with a population of less than 1.5 million, according to the Commonwealth. And when you think about remote, there isn't really a specific definition in regards to health, but we're looking at areas which are far away from cities, which are difficult to get to. There are some places in specific continents where literally there is no road to get to that location or to that habitable location. That's a big challenge for us. We have to tackle it. But I found this excellent graphic from World Bank, like covering the different islands and at the same time having an idea of what is the population of what are the ones which are the small states. And we are looking at this here. And Malta happens to be one of them, where I'm from, but there is even Estonia. Now, funnily enough, there isn't Andorra because it is less than 0.2 million. But for me, it's still a small state. So there's a view of Valletta, my lovely capital city. But I wanted to get started, like at how we started observing like this digitalization. And during the COVID-19 pandemic, a telemedicine center for the very first time was set up in Malta. And how was this possible? Because just before the pandemic started, an electronic patient record within primary healthcare was fully implemented, along with Office 365 technology, Microsoft Teams. And because of that, if you see the electoral manifesto of the Labour Party, which is currently in government, you see a full promise just dedicated to telemedicine. So don't rule out politics. Make sure that you understand what are the goals and aims, or even make sure that you read the electoral manifesto when you get to choose your representative in government. This COVID Alert Malta, the contact tracing app that we worked for, this is like one of the, I believe, one of the shortest development times that we have for a mobile app. We got this, we got it out there, we had collaboration between 3 different entities, and it was an amazing collaboration experience. Here it's on the Google Play Store, but was also available on the iPhone App Store. And even something as simple as a GitHub repository, where we were pushing all our data. Unfortunately, up to now, we're still doing this manually on a daily basis. But we're hoping that in the future, with all the information systems, the basics that we had to set up, we can even automate this. But more work to be done, as always. Never a dull moment. First, the response in Malta was using Go Data as an information system. And we even got featured as a photo story on the World Health Organization. We were really lucky there. And if you want, you can have a look at this later on. But apart from that, we've done a lot. And actually, not I worked on this, but colleagues working in different departments worked on a vaccination registration system. We also had a vaccine certificate. All of this helped us to have a high vaccination uptake. We even had a test and recovery certificate that Maltese people, or people living in Malta, could use to travel to other countries. And we even got the Verifier app. But one of the things which really struck me most about the whole pandemic is how we fully embraced customer relationship management systems. I think the future of healthcare is really around these kind of products, be it Microsoft product, be it any other kind of technology, but focusing on the patient, client, customer, whatever you call it, and building a whole ecosystem based on business intelligence, applications which are easy to use and accessible, automations, and even building on top of that virtual agents, such as chatbots. So this is the way to go. And this is like just a view of our test registration and track and trace system, which was built on Dynamics. So we moved from GoData to this, because GoData, even though it was a great product, it didn't cover all our business processes. So at the end, some of the business processes had to be done using different systems. And it was only this, and bringing all of this together, we were able to focus on all the necessary operations. COVID test, booking a swab test online. Travel authorization, applying to come to travel to Malta, using a red and dark red list. This helped us protect our health for a couple of months, for sure, if not a year. Linking with the EU Digital Passenger Locator form and the travel authorization system to manage travel requests using a queue system, moving away from dealing by email to dealing with the client and all the relevant requests. We were even able to build real-time business intelligence reports connected to these CRM systems. There's a bit more. And something very fascinating that happened in Malta is that the Ministry of Health had reached 118,000 followers thanks to all the data and infographics that were generated on a daily basis, daily in and out basis. And as you can see, it was created on May 8th of 2020, and now they are at 118,000 followers plus, because this is a bit of an old screenshot, actually. So the biggest learning points from the pandemic: scaling up of human resources, data management, operational workflow, and business continuity, sustainability, and looking towards the future, not just looking at the short term. Multidisciplinary collaboration. If it was just doctors, it would have been crazy. But now we're looking at doctors, computer scientists, health professionals of all kinds, and also dedicated and agile project management teams. Daily stand-up meetings. So back to this. Small islands, small days, small states. Was it just Malta? No. We're even looking at Malta and Estonia being agenda setters in council presidencies. And just looking at Estonia, in Malta, we had a risk assessment tool that we actually forked from the Corona test risk assessment tool organized by Estonia. So reusable code and adapting it to our local scenario. You don't have to reinvent the wheel. You don't have to create a new system. You can use and build on top of that and learn together.
Stefan, 1 minute left.
Thank you. So even Estonia had their contact tracing app. And looking at Montenegro with their digital COVID certificate that they adapted to EU standards. Iceland with their contact tracing app. Luxembourg with their amazing COVID verification, which I was using for a while until we got up and running. Cyprus, also with a contact tracing app. And looking at remote areas, I think we have to do more. I've only found very little literature. And I found this project which was focused on digital transformation in the remote areas. But I think we need to do more. Data and systems are everywhere. And even WHO is working on it with lovely documents that you can build on, literally like an architect blueprint. And even the European Public Health Association is focusing on this topic. So what is the potential? All of these beautiful and forward-looking things to bring public health together and making it more real. How do we get there? I'm proposing that first we start off with health data spaces, as Alfonso mentioned before, but more than that, I would like to propose the spiced path. Supportive digital health ecosystems, clear procurement pathways, innovation framework, behavior change, intensive education awareness, and last but not least, in fact, I added this in the last year, data governance and management. You can make a difference, one course at a time, one talk conversation at a time, one social media page profile, one website, such as the One Health lesson we had before, or even one business intelligence dashboard, which could prove useful to a decision maker. One app at a time. And be ready to jump in at the right time. We have to be at the table and not just on the menu.
Thank you very much, Stefan. So now I would like to welcome our co-host of the day, Dr. Jordi Serrano. So Jordi is a medical doctor and the founder of Universal Doctor and Yuda Health. He has been a consultant for WHO for several years, and he's also involved with many governments to help them with their digitalization and public health. Jordi, all yours.
Thank you. Thank you very much, Stefan. You did it. 78 slides. Thank you. I told you not, but you did it. Thank you. You did well. Thank you very much. It's a pleasure to be with you here again. And well, when you have many logos, it means that you are very old. Okay, so, but yeah, it's a pleasure to have been working for some years with international organizations, public health, governments, and it's always difficult to work with governments, but you learn a lot. So, in that sense, I'm very proud of it and the colleagues I've been able to be with in all these years. At the same time, we had a company, which is even more difficult because to work with government as an advisor, but to have government as a company, and sometimes it's difficult. But it really gives you advantages, no? Because you can do things quick, and if the government understands that, you can do many things, no? With them and so on. I'm not going to talk about, of course, our company, just our experiences, no? And how we have been involved in products initially of translation tools. As you know, we were born like that, universal doctor translation. But then we started working with international organizations, luckily with WHO in many things, and pandemics, epidemics, all that was the key. We were in the right moment, in the right place for Ebola. We had some projects with Ebola, with Zika, and so on. And we started working with all these projects. Basically, but on top of that, with all these projects, we realized that some data was missing, no? And of course, slowly, when I was talking with some public health responsibles, they say, "Oh, why don't you add to this?" No, because I'm very asthmatic. No, sometimes I have more or less under control, but I have asthma. No, and I remember a trip to Beijing, no, where basically I went twice, and the first time I went, it was 2 degrees, winter, foggy, polluted, and my asthma was really. And then I started looking at information, and the levels of NO2, no, ozone, very, very high, no. And then I discovered some, X graphics where if it's less than 7 degrees and you have more than NO2, normally you have no control, you will really start wheezing, no. And I thought, okay, why don't we create a chatbot? We had a Telegram chatbot, no, where there's, okay, the information of Beijing, of other cities, no, where I was traveling to, and then at least I knew, okay, I don't have to take my Ventolin or more Pulmicort with me. Anyway, I wouldn't take them with me, but okay, in that case, it would be in that case, no. So all this information, it's important, no. And planetary health it's like a culmination of all these information, no, because we really have to have into account. And now, as Stefan was saying, now that citizens have their own app slowly, thanks to the pandemic, they can really, what the Americans call blue button, slowly to download all the information, to mix the information with other data. No? All that is coming, and I think we will have a brilliant future for digital planetary health in that sense. No? We don't have to repeat, everybody, all the experts about planetary health have talked about that, but interdisciplinary, this is fantastic. And as Pedro was pointing, the interoperability, and as Luis was also saying, it's difficult. Silos, silos, silos. And we talk about silos, and even sometimes between one silo and the silo of next silo, they cannot share, not even share with everybody. But in that case, digitalization should force that, no? And as you said, not reinventing the wheel, Stefan, and using all these things that we are using. No, obviously sometimes in the outcomes it's much easier because sometimes you make some syntaxes, no, of statistical programs, of some algorithms, and you have more common on the outcomes than in the data that have to enter into that algorithm. No, there's a blocker, no, in that sense, but it's a starting point. No, scientific that are working together with the outcomes can really force the entry points in that sense. No? So many connections already in Lancet. You can find many articles where it clearly relates weather events with cardiology, with neurology, and with many other. The question is that we need the data. If we don't have the data of the heart failure people, of the CPOD, no, chronic problems people with us, we cannot mix them with the weather events, no? But it's really related, and we have tomorrow there will be talks about the aging population, and there are clear studies that mention that dementia, no, can be accelerated if you live near major roads, no. The massive, another chapter that we don't have to forget with, it's digital, but hospitals are one of the most emitters of CO2, no, of green effect, and it's logical. There's a lot of electrical processes. You never can stop. You have to have recovery engines. You have to have, okay, and it seems that in some countries it's up to 6% of emissions of greenhouse gases emissions, 6%. No, I think it's a lot. So it's like agriculture, industry, and then hospitals sometimes, the emission doers. No, so in that sense, we should reflectionate if we could think of hospitals of a hub of reducing emissions, and also, why not, a hub of electricity. In some places, if there is a remote area and you only have a hospital, why do you have to have a hospital on top of that, in that remote area, electrical hub? It has no sense, because you will need the electricity there. So in that sense, when we are regulating these sustainable electricity models with solar electricity and so on, hospitals also could become a hub in that sense. No? What I was saying, no? Well, this is an article that really focuses in all that. We don't have much time because we have to in time, but I will share with all you because it really focuses in that sense. No? The environmental impact of digital health. Okay, imagine that we are able to have a dashboard or to plan on that, where we really have all the visits that have been done by telemedicine, or we have visits that we haven't done. How much CO2 are saving? No? That is a potential initial dashboard where hospitals could knock the door into the governments. Hey, where is my money back? No, because I'm saving you a lot of, because many of the governments are starting to participate in elaborate schemes, no, of CO2 reduction. No? And I think there should be a collaboration in that sense. No? There are many articles. This is Dr. Job Vidal, a very well-known primary doctor. Our primary doctors there. He's been able, with very few resources, to investigate how much CO2 they save in the region during the pandemic because of the telemedicine in these aspects. I think this is very important. No? And as I was saying very quickly, because we don't have much time, some ideas for digitalization, for digitizing planetary health. No? Everybody has been asking, again in silos, for EU opportunities. When they say, no, only green, only digital, and only healthcare, I think was the three topics. And nobody was mixing them. I thought, why not? No? Because everybody was with big silos. It seems that the big infrastructures can only go to these big companies that everybody's saying, oh, this is a typical company that the government puts money in. Yeah, but what are hospitals? No? Huge companies. No? So, and if a group of hospitals really stick together, they can ask for billions, no millions. No? And they say, hey, I am saving you all this electricity, I am saving you all that. Give me the infrastructure to me, because I'm at 6% of the emissions. No? So many of the EU funding opportunities should be mixed. Many green projects should be inside the hospital because with this reduction. No? So we're imagining hospitals as sustainable energy hubs and green and sustainable health actions. And basically, we could imagine, actually, we are maybe with one of the apps we're developing for new projects, we are trying to embed all these aspects of planetary health. And why not having in hospitals dashboards where we could have the CO2 reduction because of telemedicine, obviously, and also all the digitalization of all the processes that can save waste, also in that sense. Every single process implemented to save waste, being that very difficult in some processes in those hospital, of course, because of sterility and because of many other, it can be also noted and have in the dashboard. And that could be a very nice competition between hospitals or with hospitals, and European money should be there put in that sense. Thank you very much. There is a brilliant future for planetary health, and thank you for being here today. Thank you very much.
Thank you very much, Jordi, for that presentation. Next, I would like to welcome Anish Shindor. Anish immersed himself in the pharma world, so working for different pharma companies, and he has been closely involved with numerous technology and software startups, focus on health. His passion is to create human-centric digital solutions based on data, blending insights and approaches across industry to solve complex health problems at scale. He's a seed-stage investor and a firm believer in human plus tech equals healthcare for now and for the future. He recently started his own venture, GSD Health, with partners that share the same purpose of making startups investable and successful. So he will tell us more how we can apply entrepreneurship to transform digital health. All yours.
Thank you. Thank you very much, Eileen. Is it okay if I stand over here? Because we are all boxed in that place, so let's be a little bit out of the box. So Stefan, he stole my thunder. So what I would like to do is, out of the 8 minutes that I have, I would like to use 1 minute and ask you guys to stand up again, one more time. Just relieve yourself of everything. Okay, keep everything down. Just stretch your arms, stretch your legs, do whatever you need to do. All right, loosen up, bend, get your shoulders a bit loose. Okay, and now slowly sit down very straight. Okay. What I want you guys to do is, with your palms facing up, okay, on your knees, just keep your head relaxed, close your eyes for a second, and just focus on breathing, only breathing, nothing else. I'll count, and until then you have to breathe in, and I'll count until then you have to breathe out. So let's go. Breathe in. Hold. Breathe out. We're going to do it 2 more times. Breathe in, a big one. Hold. Breathe out. Breathe in. And breathe out. Now very slowly open your eyes. Just swivel your neck a little bit, make sure that the blood starts flowing to your head, and now hopefully you're ready for a coffee. All right. Perfect. All right. Thank you. Thank you for that. Thank you so much. So look, I've been looking at all the presentations since morning, and at a certain point in time, there was that excitement, and that turned into depression. Because you start seeing numbers that are chaotic, that are very difficult. And I'm going to throw you some more numbers at you, which are very difficult to digest, but it's okay, we'll walk it through together. So my only reason to be here, and I thank Jordi, thank you very, very much for inviting me for this. I try to stay off the radar, but some of the people, they get hold of me, and I happen to be living in Andorra for the last 2 months, so it's perfect timing. So what I want you to do is just think, and if possible, act. And it can be an act that stop using the right by 2050. And why did I choose 2050? I'm hoping that at that year, it will be my retirement year. So at 2050, there will be 9.7 billion people on this planet consuming all the resources. If Indians and Chinese keep on populating the planet at the same pace as we are. But the surprising thing is, Africa is going faster than them in terms of pure percentage growth of population. So 9.7 billion people by 2050, most of the population will live in Africa at that point in time. Now, who's born over here within 1946 and 1964? Raise your hands, don't be shy. Okay, 1, 2, 3, 4, yeah, not more than that. So, and I'm going to say it very badly, but 26%, so that's about 1.8 billion people today are within that age group. Guess what is happening since 2018 with these people? They're starting to retire. In the next 20 years, what's going to happen is, and I'm not saying that you guys should retire, you guys are lovely the way you are, but what's happening is they're going to stop feeding to the social security system, but they're going to start consuming the social security system. Right? So what's going to happen with all the resources and money that's out there? It's going to start evaporating. And we already know our systems are so archaic that they are not even able to fuel the current healthcare scenario. And you saw that in the pandemic. Right? So guess what? My year of retirement plus their age of consumption, those 20 years, I'm screwed. I will have no healthcare by the time baby boomers consume all the resources on this planet. Sad reality, but this is the truth. So think about it and see what you can do to act, right? What I'm doing is I'm saving all my tax money by moving to Andorra and building my own pension plan. Hey. Honestly, that's a serious decision that we took in the last 3 months. So now, if you look at that in the context of all the numbers that we are talking about, and there are some other numbers that were shared, right? 95% of the world's population is sick. Yes, that's us. That's no patient outside over there that has landed from Mars. No, those are people that are in the room. 95% of us are sick. Out of those, 1/3 have at least 5 illnesses. At least 5. And we don't have to be shy about it, right? It is true. It is true what it is. But when you multiply the problems of the growing population versus the resources being eaten up versus everybody is sick even today, our life is going to be tough. But there are some things we can start doing. And maybe I'll just use in terms of relating it back to the health situation, right? In terms of total use of energy, with that population itself is driving. Forget about what cattle farming is creating, what other industries are creating. I mean, clothing industry, we talk about fashion. I mean, when you look at transport, I don't know who projected that graph, transport, how it was divided in terms of CO2 emission. If you look at all the industry and you look at clothing industry, transport is probably around 7 to 8% of what CO2 footprint clothing industry creates. And if you look at agriculture, with all the carbon footprint that it creates, you take a look at that and you break it down, and 80% is just due to cattle farming. So think about those things when you're making your decisions, right? So this is what you see from a pure population perspective on the CO2 that we are creating. You can be walking on the street, nothing, but you're creating that CO2 today, okay? Now, this, I don't know what happened. Okay, so there's one title missing over here, but it's okay. What I have in this pie chart is the study that came out, and maybe I'll just move to the next slide. What you have is, this is the pie chart in terms of what exactly is affecting our health today. Today, healthcare from the industry that I came from is about here. It's about 10% of what exactly is impacting our health. That's what we manage today. In reality, what all is impacting is 40% is behavioral patterns on how we eat, how we walk, do we exercise and things. 30% is genetic predisposition. So that's something that you can't blame yourself. It's a little bit of a manufacturing defect that we come with. 15% is about the social circumstances, and 5% is environmental changes. So still it's under control of what environment affects us. But we can do a lot on those 25 plus 40, 65% of things that are happening that are in our control. And that's where digital health comes. So what you've seen with the examples that Stefan put forward, with what Jordi has spoken about, we can start at today. If you look at a patient journey, usually people think a patient journey means the date that person was diagnosed with something and the date they started a cure for something. But if you think about it, a patient journey starts on identification of the first symptom, assumption and internalization of that first symptom, taking an action by seeing a doctor, getting diagnosed, getting treated, following the medication, and then hopefully discontinuing your treatment because you've actually done everything that you can in your hand. All of that can be done by digital health. All of that. Let that be a little bit of meditation that we did before we started, right? There are about 500 apps that you can download, and I'm not going to endorse any one of them, but 500 apps that you can download for mental health. Today, we talk about mental health, but we don't download anything on our phones to do anything about it. So do something about it. Right? Now, prevention of diseases, this is a most speculative one. But if you go down your family history, and we've spoken about data, right? If you have any family history of any condition that can go down from generation to generation, get it checked when you're in your 30s, because there is a high probability that if you catch it in your 30s, you don't have to actually think about it. And there are solutions that can help you do that today. Lower healthcare costs, I think COVID has just showed us that, right? People don't have to travel anywhere to get treated. They can be treated at home, right? One of the projects that we've been working on for the last 4 years is with NHS is cancer at home. One of the most stressful parts for any cancer patient is going to a hospital, waiting for their chemo to be done, waiting for all the paperwork to be done, and then getting a chemotherapy, then waiting again for 3 hours before they go home. It's a very stressful scenario that people have to go to. But what we are trying to do is how they can get that at home. That easy. So that's where technology comes. Again, don't think about it as like, Like Stefan said, digital health. It's not about digital health, it's about health, but the application of digital as a part of that entire cure. Now, this is the way I look at digital health. You may or may not agree, and it's okay, nobody cares. But what I would look at it is any non-pharmacological, technology-enabled solutions that either standalone or combined with an improved patient outcome and generate new business. We want to make sure that these companies don't go broke. We need these companies to grow and reach as many people as possible. So this could be a mobile app, physical device, and a coaching service. Now, one of the things that we saw, and this is from our friend from Sanitas, he did a research and a paper out of it, they captured actually what the decrease in CO2 emission during COVID was, just with one factor, which is virtual visits of patients and doctors. And they saw an 8.8 degrees of global CO2 reduction. Just this is a doctor visit. I'm not even talking about utilizing the diagnostic solutions in the hospital, doing remote care, no, this is just visits. So imagine the footprint that we are able to create just by having Zoom sessions or Microsoft Office or Teams session, right? So when we look at it, and I apologize, there is a little bit of a English mistake over there, but what I want you guys to take care of and take out of this is, first think about yourself as a disease. Assume the diseases that you have, and it's okay. A lot of people try to shy away from what they have or what they may be suffering with. Take responsibility, because your next door neighbor actually may be suffering with the same or something more severe than that. Talk about it openly, and what you can do is, apart from the climate change and the decisions that you make on usage of plastic bottle, gas operated vehicles, whatever it may be, your health and how your technology around you, because everybody of us has a smart devices in our hand or in our pockets. Use that effectively. It's not just for Instagram, right? Perfect. And that's it. Scan me if you want to get connected. I'm not that famous on Twitter, but LinkedIn, I'm quite responsive. Thank you very much.
Thank you very much, Anish. Thank you for the meditation, for a great presentation. Now we're going to move to Alberto Abello. So Alberto is an associate professor of Universitat Politécnica de Catalunya. He leads the group of database technology and information management and coordinates the innovative training network on data engineering for data science at the UPC. He has more than 20 years of experience in research and technology transfer in the field, and has been collaborating for many years with the Department of Neglected Tropical Diseases and the WHO, as well as Probitas Foundation. So he will tell us more about the relevance of big data for planetary health.
Okay, thank you. Yeah, thank you. Okay, good afternoon, everybody. First of all, thanks, Jordi. Gracias, Jordi, por convidarme hasta aquí. Un placer. It's a pleasure to be here. And I mean, I want to talk about big data. And first I was a bit worried because I felt like playing away, you know, because I expected an audience, plenty of physicians, epidemiologists, etc., etc. And then this morning, when I started listening to the presentations and everybody was talking about data, I started thinking, maybe I'm not playing that away. And then Deborah asked explicitly, okay, who is more technical or considers himself or herself more technical? And then mostly everybody raised his or her hand. And I said, okay, I'm not playing away, I'm playing home. Okay, so my presentation was about making a case for the use of big data in planetary health, or the need for using big data in planetary health. So I don't think it's that necessary anymore. But anyway, I'm at least trying to give you my view of big data and how it can be beneficial for planetary health. And most of it, I think, has been already said during the day. Okay, so it's kind of a wrap-up or a summary. And I think it's good because since I'm the last speaker, also it can be very convenient. Okay, so here you have some definitions or viewpoints about what is big data. I mean, it's about volume, velocity, and variety from some perspective. So it's a regional definition. Then also some people, we talk about the technology we use, which is called NoSQL. Then some people is talking about whether we use text, image, sound, so different kinds of data. Then some people understand this as signals from the external world as opposed to signals or knowledge from inside the company or the enterprise. Then also some people see this as an opportunity for business, of course. And then what I prefer is a new term for all stuff, in the sense that we are pressing the technology to the limits, to the borders of knowledge or of science. Okay, so this is the one. But today I would like to focus on this. Okay, and this is a nice definition or view of big data, and it's just a kind of a metaphor of big data being kind of the nervous system of Gaia, of the planet. Okay, so it tells us what is happening in our planet. And then if we see here which are the aims or the purpose of the nervous systems in a body, in a human being, okay, we can think of this and translating in having some sensors, so it's sensing some things. Also, we can think of it like receiving some inputs from our senses. In this case, could be social networks. Then also, of course, integrating all this information from all around our body, and then finally making some decisions. Okay, so this is the role of big data in planetary health somehow. Okay, so why is all this relevant? So this is, I think, the most important things that we can get from big data. First, it can help us to identify the problems and make decisions. If you don't identify the problem, how can you make any decision about it? Okay, so first, this is the first thing you need to do. Then the second thing, and I think this also appeared in the talks this morning, is about awareness. I mean, raise awareness in the public. And then this, I may be adding this myself, denunciating some situations which could have been done better, let's say, or other way at least. And then finally, fighting fake news. So let me just give some examples of this. This is a very well-known case, maybe the birth of epidemiology, the cholera epidemic in London in 1854, where they just plotted where the cases were happening, and then they found that there were some around, and there was some pattern because they were around some wells, and then they identified these wells specifically in the source of these wells as the source of the cholera epidemic. So actually they were just identifying the problem with data. Okay, so this would be the first point. The second point, I mean, this is about greenhouse emissions, also a recurrent topic today. And then these represent the different countries, how much they are emitting, and then here we see which is the situation, let's say, or what they did to solve this problem with different colors and so on. So here we can use this kind of infography to raise public awareness, again, with the data and plotting the data in some kind of chart of map in this case or whatever. Then the other is something I saw recently in Twitter, and it's about how the difference from 2020 against 2019 in the life expectancy in the different regions in Europe. And we see that in the top 3 is Madrid with minus 3.5, and then it's not by chance that the third position is for Castilla-La Mancha. If you are familiar with Spain, Castilla-La Mancha is just here, I mean, around Madrid. Okay, so it's the same, actually the same region, geographically at least. Okay, so then I did some more research by myself, and then I took the average of the deaths according to Eurostats, and then this is quite stable. So I compare the deaths in 2020 and 2021 against this average in the last 20 years. And then what I found out is that indeed, I mean, there were 53% more deaths in Madrid and 40% more deaths in Castilla-La Mancha, while in the rest of Spain, kind of the average was around 23. So they doubled the amount of people that died because of COVID. And I mean, you can think of which is the reason. It can be the local government, it can be the autonomous community government, it can be the national government, it can be whoever, but something happened here that didn't happen in the other regions in Spain. Okay, so you can blame whoever you want, but at least something was different there and not for good. And then the other use we can make of big data is just to, I mean, just show that fake news are actually fake and they are not real. So here you have something that appeared in the news that the pediatric hepatitis was related somehow with COVID vaccination, And then I took some data from the UK Health Security Agency, and here we see that actually, so the green area in the bars, so the bars are the tests that were performed for each one of these diseases, and what was found was adenovirus, the one that was, 40 cases were adenovirus and only 10 were SARS-CoV. Okay, so actually, if there was some problem, it was definitely not COVID, and most probably was adenovirus. COVID was kind of similar to other diseases. Okay, so we can use it to fake against fake news as well. So these are the few examples, and then the next question is, can we do something? So if we think about the business in this case, we can see that big data is being massively used. So technology is not a problem. So business is using big data already, but why don't we use it for other purposes which are not just for profit, let's say, or not necessarily for profit? So this is the point. So the problem is not the technology. The problem is the will of doing it. Okay, and then also there are some challenges for using big data in planetary health. The first one most probably is the lack of data collection, not any data collection. We were discussing this morning, it was garbage in, garbage out, so it's not just data, it must be high quality data, otherwise what you get is purely noise and absolutely useless. So we need to collect data systematically and guarantee the quality of this data we are collecting. Then the second point is we need to put resources to really analyze this data and extract the knowledge from this data. This is the second challenge, this is the point, so we need investment into this. And then the third problem is privacy, and the lack of trust. Okay, it's personal data. There is a special, concrete law against, doing some things or analyzing data without permission from the people. Okay, so we have some issues there, and also there is a lack of confidence, let's say, or trust in what the companies or the public administrations are doing with our data. So this is also an issue in this case. Okay, so I'm not saying it's easy, but okay, it's challenging. Okay, but it's still possible, most probably. So just to finalize, planetary health, for planetary health, big data is crucial. So we have these 4 different usages I envision or I see identify for this. So the first one is we can identify the problems, that's to decide or to know what should we be doing. If we don't have big data, how can we know what should be done, which is the most pressing issue, which is the most important problem we have to solve and we can solve. The second one would be, just explaining everybody what we are doing. Okay, so it's impossible. We really progress in planetary health without all the population, the 7 or 8 million, 1,000 million people in the country, in the planet, actually being aware of there is a problem and willing to contribute and to push into the same direction. So it's important to show these kind of things. Then the other is, okay, what happens if we don't do it, or what happens if we don't do the right things, okay, or the things that should be done and that we know that should have been done. Okay, then which are the consequences? We can show this as well with data or with big data. And then finally, there is some people that maybe because of selfishness or because of other kind of interests or because, I don't know, they don't have sons or daughters or whatever, and they don't think of these children are inheriting our planet, and they don't care much about this, and they simply deny things that are obvious and are real and are for real. So then in this case, again, we should fight against this fake news and just show, okay, this is what is happening, this is reality because we have the facts, we have the data here, okay? So, that's all from, I don't know if this was that necessary today here with this audience, but this is what I wanted to say. Thank you very much. You're welcome.
So thank you to the 5 of you for your presentations. So now we're going to open the floor for questions. So is there a question in the audience? Okay, we need a mic here at the front, please. I think there's another question over there. Yeah. Okay. Nice. Here, at the front.
I would like some comments from anyone from the panelists. What about the ownership of the data? In terms of individual ownership, I am a patient. My data health is hosted by my healthcare system. I am initially quite sure that my data in the Garmin is mine, but it's not. This is a question. And the other one is a question as a territorial or as a nation. How to deal with a big amount of data. We cannot just make analytics by ourselves. We have to put in the cloud or in what is safer. Is Amazon safer enough if I put the data that? Or maybe the Barcelona Supercomputing Center is a more safer way to host my data.
Who wants to start?
I can
Anish?
go first. Yeah. So I love the question, by the way. It's always your data, and I'll give you an example of why you should feel that you're in control. Again, what happens on the gadgets on the computer is different, but what happens in the healthcare system is very important for us to understand. So I had a surgery because of lack of my skiing capabilities some years back, and had to do various analysis at different places. And I've always been a data guy. So I went for analysis in one place, and there was this LOPD form that they ask you to fill out and sign that you're giving access for them to share with different people your data. And I was like, I don't want that to happen. So I did not sign. I said no. Guess what happened when I actually went to the doctor's visit for the follow-up after doing all the tests? The doctor did not receive my data. It was still within each and every clinic that I had done those analysis and diagnostic. I had to individually go to each and every one of those clinics, ask for my data, and then that was made available to the doctor. So yes, whose data it is today your data. The issue that you have today, or that we have, is our data is all over the place. There is no central location, nor with ourselves, nor within the system, nor within the government, that our data is managed. A solution for that, and I wish my friend over there, Simone, he would speak about it. He's in the back. There is, and I'm going to throw a jargon out there, but it is something that nobody has seen applied so far at scale in healthcare, which is blockchain. One of the things that you can have is you can put your data on blockchain, have full control over it within the certificates that you can have. And from a territorial perspective, so first, let's make sure that it's available, make sure that it is normalized in a certain format that you can understand it yourself and everybody else is able to understand it. So that's where the public and private key comes into place. And on the cross-border piece, I think all of us are very global citizens today. We go on vacations in different continents. One of the biggest issues that we have is language translation and data accessibility. If we are able to, and I don't have the answer for it, and maybe Jordi with the navigation that he does from a governmental level, one of the things that we could collectively look at is how we can get each and every government to kind of check off saying that yes, we are able to access or we are able to certify data that's on a blockchain database and accept that as a way. So there are solutions out there. Like you said, right? Technology is there. It's just that our policies and our regulation prohibit us from actually opening those borders. Hope that's an acceptable answer.
Stefan?
A quick comment. I think that the way forward is to separate the data from the systems. Before we do that, we won't get anywhere. So making sure that whatever we design the systems which have separate data, and the data can move wherever we want it to move. So there is a lot happening where data is still deeply integrated with the system. So it can't go back to the patient being the master of the data, because it's simply so deeply integrated to existing systems. So before we do that, it will be very difficult to achieve. We need to do that first.
Let me add something, because this idea is not new, as I said. I mean, the technology is there. There is something which is called personal information systems, if I'm not wrong. Okay, for example, so you are the owner of your data, you have your data, and whoever is willing to use your data, then you simply kind of give your connection to them, and then they take the data from there, but the data is yours, and you own your data, and you host your data, and whoever wants to use it just can do it.
The same way that we receive an authorization request for an app, like, can I access your Facebook? Like, can I access your health data, please? Allow. So go ahead. I think if you have something to say, say it. You know,
if I may.
Can we get you the mic?
Yeah, because this is the way it should be, like open conversation.
Yeah, no. The only way to do that is to build the infrastructure for it, and it can only be blockchain today. This is the only technology that is going to enable full control by patients on their patients or customers, because if we think about it, it applies to much more areas where personal data is currently being used or even abused. And so blockchain infrastructure is the only way that we're going to be able to achieve to empower the patients to revoke the right of using their data, because that data is on the ledger and access is provided by the patients, and it will be in its cell phone. The data will not move from your phone, right? That's the difference. With currently, when the data goes from your phone, it goes to somewhere else, it's stored somewhere. Thanks to blockchain technology, we can make sure that your data always stays on your phone, and you just give access when you want, right? So accessing your data, and you can share what you want also. You're not, and you can also be incentivized of sharing your data by being retributed for it, which in other systems is not possible. So there's a revolution around the corner. Everybody's talking of crypto. Right now we're having a bit of a trouble, but the real underlayer technology is much more powerful than just crypto. Crypto is the end of the chain. Everybody wants to get rich, so they focus on that. But the impact that we can have with blockchain on operations and that kind of problematic is going to be massive. And I think it's going to open up a complete dimension for big data, quality of data, cybersecurity. Your data would be secure because no hacker is going to be interested on spending days and days to try to hack your phone, unless you're the president of the United States, maybe. But this is really what the technology is gonna enable. So I think it's one of the key elements.
Thank you very much.
Can I say
Simon.
something to this?
Yeah, Alfonso, yeah.
Yes, briefly, please. Yes, sure.
No, I think, I mean, these are very good points about the privacy of the individual data. I think that we have to be, to think in another dimension, that is when we want to use massive data. And that's not that easy if the data is held in a cell phone of each individual. And the real problem, I don't think that is security. The real problem is interoperability. When we want to use this data for the human for the human health, we need to use massive amount of data in a way that this data is interoperable. So I will probably concentrate less in the security of the individual data and more in the security of the global data and the access and interoperability of the global data.
Thank you very much. So I think we had two more questions here, yeah? One over there.
Yes, thanks for the talks, very, very interesting. I have a question. I'm myself bioinformatician, so nice. I completely, fully agree with or all your statements. So one thing I think we face as a society, and it's because we have this increasing amount of data, people are wearing more and more wearables and are monitor all the time. So we also see a digital divide, a digital gap between older and young people. Okay. So I would like to have the overview on how we actually work in this subject.
Can I take a lead on this? So the same way that we have nurses, for example, treating specifically diabetic nurses, we should have digital health nurses, community people in the community. And what will happen is this. There are very subtle ways to realize that a person, for example, doesn't have a mobile phone. For example, in Malta, we have like a telephone number and they have the mobile number. And if you realize in the contact number that only a telephone number is provided and no email is provided, that's most probably a high-risk group, which could be considered, for example, to have a targeted intervention. It could be just a simple call by digital health. How can I help you to access your My Health? Okay, no problem. Let's get you set up. We need to do this, you need to do this, this and this. And just having that human touch and bringing digital health closer to that person, just with a human intervention. So the same way that we have for diabetes, we have for even wound care, for example. People could come, talk to that person, have a consultation, help them access their data, and move on. I think this is possible. And following up, even possibly through a telephone call. How are you doing? Are you managing? Yes, my son-in-law is helping me out. Now I know my data. So there are ways and means by bringing back that human touch, gathering the data that we already have, and there are some really simple and subtle ways to identify this group of people, and at the same time bringing it all together. It's not easy, mind you, it's challenging, but there is an opportunity, and that's why something like I forgot to mention, but one of the biggest successes of the COVID-19 pandemic in Malta was a 111 helpline. It was set up. Thank God for that, because otherwise it would have been crazy to reach and give information at the right time and the right context. Thank you.
Jordi, do you want to add something?
Yeah, well, no, this is, I totally agree. No, obviously, nurses are very busy. No?
That's why specific, eh?
Yeah,
specific.
but I agree with you, but even it could not be nurses. It could be other type of healthcare workers or even administrative people. But then when that happens, all these silos say, no, this is mine. No? Because it's like I was saying. No?
Fair point.
But it would be very nice because even all of us here, if somebody was a coach for us, hey, Jordi, every time you do that in the computer, you could do that better. You could save 10 minutes, or it could be more tight than that. It could be, everybody would get win, no? So nurses, doctors, whoever, could we take care to empower the patient with the data? And that transition of the ownership of the data, probably these advisors should be there. Going that to linking with Planetary Health, because we don't have to forget, one of the, and Luis, one of the fathers of Planetary Health, mentioned in one conversation we had, Planetary Health is communitary health. It's the fathers of Planetary Health wanted to have it communitary. It's social determinant of health that it's linked also. Doesn't work. It's linked also to the social determinant of health and the inequity. No, in that sense, we have seen that with the banks, how elderly people had to go with some demonstrations to with the banks and so on. So in that sense, it would be very important, as David was asking, how we can solve that. Here, of course, there has been the launching of the app, for Andorra citizen, and the app, to enter the app for the moment is not very easy. So we have to do it better, in that sense, for elderly people.
Only comment. Doctors and nurses are busy now. Don't be busy in 5 years from now.
There will be
artificial intelligence will skip 90% of this time, and we can just devote to do this kind of things, just to be the connector of the knowledge with the human beings. So it is a new profession that we have to move from the knowledge-based the technology that the doctors we are right now.
I think that, was there one last question?
Yeah.
Okay, so
Deborah.
Carlo also wanted.
No.
Ben, we have time for one more question.
Okay, so
very quick question, Deborah. Very quick question and very quick answers from your side, please.
Okay, it's for Anish. So we're in the same generation, let's say that. Social Security, totally understand that. A lot of people don't have the opportunity to move. So if you had a magic wand, you could change policy, you could change legislation that can affect the world, okay? Magic wand here. How can you fix this problem for everybody else in our generation?
The way I would fix it for myself is, first of all, I think the common level of understanding of health within the society, even within the same generation that we are, is not the same. Even if you're in your early 30s, mid 30s, early 40s, you feel you're very young. But at the same time, there are things that are creeping up inside you which are not there. So I think I would start the first level on raising awareness of what that actually means, so that you can secure your present, but at the same time, kind of future-proof yourself by doing the right tests. For men, one of the tests that happen, and especially in US, when you reach 40, is you can get a prostate exam done. I tried to do that when I was 38. In Spain, they told me, no, you have to be minimum 45. Couldn't push the system to do that for me. So I think the level of awareness needs to be done. I don't know what that formula would be to make sure that there is awareness, but what I know is people who are below 55 at the moment, they are much more concerned about their own health than what people have been in the past. So that would be my first step, to make sure that there is awareness and there's consciousness that let's make sure we make ourselves future proof. The second one, which the gentleman asked the question, right, about the devices, and I think we answered it from a data side, we didn't answer it from a device perspective. Since we all have some sort of smart devices, and I think over the next 5 to 6 years, all of us are going to have a wearable, some sort of a invisible patch, something like that on us, with keeping all the cybersecurity and all the other threats aside. I think what we will be able to do is know a little bit more about ourselves. Today, what the biggest problem in our society is, if we have a health problem as a patient ourselves, that health problem doesn't talk back to us. So if you have a heart issue, your heart doesn't tell you what that issue is. And that's where you have devices that can actually help you do that. I think that progressively would be the second step that I would put in place, so that people understand what is wrong with their health and how exactly that is feeding back to you. Sorry, Alina, I'm giving a long answer. And the last one, if I may, if there are no policies in place, I would just make sure that people live a bit of a healthy life when it comes to, and we saw a lot of things being spoken about in terms of plant-based food, in terms of, I don't want everyone to go vegetarian, I'm not, I love meat, but it's something, those are steps, minimum steps that you have to take in order to secure your future. Now that partially answers your question, it doesn't fully, but I would start at that, because today my thinking doesn't tell me what's at the end of 100 kilometers. What I can only see is what is in front of me, 100 meters. So this is what I can see that we can do. And that 100 meters is going to take us a long time to establish. Once that is done, when we are there, let's look at the next 100 meters. I think that's how I see it happening. If not, we'll just create a big illusion for ourselves and we'll fail in our own promises. Sorry, not a good answer, but yeah.
Thanks a lot. So that marks the end of the panel. And now I will just close the panel in French, so doing a short summary in French. Donc, nous avons parlé beaucoup aujourd'hui des données. Et on a depuis plusieurs années la capacité de collecter des données, c'est un fait. Donc l'importance est revenue de interopérabilité de ces données pour pouvoir les utiliser et prendre des décisions adéquates qui affectent la population de façon positive, non, comme les différents projets qui ont été présentés. Et ces données peuvent aussi nous aider à identifier les causes à effet pour certaines maladies, comme l'asthme ou COPD, comme Jordi nous a mentionné avant. C'est pour ça qu'on a besoin de ces données. Et si ces données sont de qualité, encore mieux. On a parlé aussi de l'impact positif des outils technologiques, que ce soit pour les professionnels de santé ou pour les patients. Donc plus pour les patients, de les accompagner le long de leur patient journey. Et de la partie prévention aussi. Donc prévention, ça a un impact sur la santé planétaire dans la mesure où ça permet de réduire les coûts et d'améliorer la qualité de vie des patients et des citoyens en général. Ces outils technologiques permettent aussi d'amener la santé chez le patient, à la maison du patient, au lieu d'aller à l'hôpital. Et ça, on l'a vu pas mal pendant la pandémie. Et ça, un aspect positif au niveau des écosystèmes. À Barcelone, par exemple, on a vraiment vu la diminution de la pollution quand les gens n'allaient plus chez le médecin parce qu'ils étaient bloqués chez eux. Donc ça, on le sait, ça a vraiment un aspect positif au niveau de la télémédecine. Et donc, en parlant des CO2, c'est une chose qu'on a parlé. Les hôpitaux représentent 6% du CO2 qui est produit. Donc, il y a vraiment quelque chose à faire à ce niveau-là. Et l'importance d'avoir des fonds européens, des différents programmes qui se font pour supporter justement les hôpitaux et pour réduire ces différentes émissions. Et voilà, et peut-être dernier point, donc gardez en tête, on a parlé d'interopérabilité et aussi de la propriété des données, à qui appartiennent ces données.
Thank you, Aline.
Merci. Okay. Allons-y.
Just to comment, remember that there is. Hello, thank you very much. We're going to close now quickly in 1 minute. Remember, there is a wonderful talk now about mental health in this center, Will. Many of you are tired, but if you can go, it will be fantastic for your mental health and for the dissemination. Just a small comment for all the people that thank you me. If tomorrow you only thank you me, you will have 2 minutes less to talk. This is a work team, okay? So thanking all the team together. It's been a pleasure to work with the Ministry of Health, ARI Foundation, SAS, and University of Andorra. No? And I've been able to do all this work these weeks because, for example, my colleague David has been supporting me in doing many things I should have done. So thank you all the team and in that sense. So tomorrow, who thanks me? 2 minutes less. Thank you. So let's go and close.
Yes, thank you very much, authorities, partners, researchers, for joining us at this first international conference Health. Today we discuss about plenty different topics related to this interdisciplinary concept. As Jordi said, now we will close this first day with a conference related on the pandemic impacts on mental health. So we invite you to come with us at this last talk, but if not, we will continue tomorrow with the second conference day, and we will have 2 roundtables, and then we close the event with 2 open Davids. These Davids will be amazing because we will discuss all these topics related to planetary health with some of our experts and also the audience. So thank you very much, and we will see now or we will see tomorrow.